moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog skin to prevent itching. Andiroba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Pappy Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes your dog's skin to promote a healthier and manageable coat, and fipronil that eliminates and kills the fleas and ticks that try to bite our pets that can be itchy and uncomfortable. It can also cause painful allergic reactions and transmit dangerous illnesses. Papi Mixidin is a combination of miconazole nitrate and chlorhexidine gluconate that helps provide relief against fungal infections such as ringworm and superficial skin infections caused by yeast and bacteria. It is the shampoo of choice for those suffering from mixed fungal and bacterial infection and skin with wound and other skin damage. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. Multivits, multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Bion Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Papi Plate Leaf contains a combination of multivitamins, minerals, and Euphorba hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nakalvit ZC is a combination of two mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Papi Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silymarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Papi Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin wound ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn, and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iozine wound spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Papi emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is also used in dogs and cats to induce milk letdown and to promote milk production. Vermifuge and Volapets is an anthelmintic drug for the treatment of mixed infection by nematodes and cestodes of the dogs and cats, such as Toxocara canis, Toxascaris leonin, Uncinara stenocephalia, Ancylostoma caninum, Echinococcus species, Taenia species, Dipylidium caninum. Happy Oatmeal Shed Control Shampoo gives a long-lasting soothing relief in controlling shedding or loss of hair of your pets. It contains oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Happy Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itching. Andiroba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Papi Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes your dog's skin to promote a healthier and manageable coat, and fipronil that eliminates and kills the fleas and ticks that try to bite our pets that can be itchy and uncomfortable. It can also cause painful allergic reactions and transmit dangerous illnesses. Papi Mixidin is a combination of miconazole nitrate and chlorhexidine gluconate that helps provide relief against fungal infections such as ringworm and superficial skin infections caused by yeast and bacteria. It is the shampoo of choice for those suffering from mixed fungal and bacterial infection, and skin with wound and other skin damage. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. Multivets, multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Bayan Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Papi Plate Leaf contains a combination of multivitamins, minerals, and Euphorbia hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nakalvit ZC is a combination of two mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Papi Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silymarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Papi Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin Wound Ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn, and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iodine wound spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Papi emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is also used in dogs and cats to induce milk letdown and to promote milk production. Vermifuge and Volapets is an anthelmintic drug for the treatment of mixed infection by nematodes and cestodes of the dogs and cats, such as Toxocara canis, Toxascaris leonin, Uncinara stenocephalia, Ancylostoma caninum, Echinococcus species, Taenia species, Dipylidium caninum. Happy Oatmeal Shed Control Shampoo gives a long-lasting soothing relief in controlling shedding or loss of hair of your pets. It contains oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Happy Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itching. Andiroba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Papi Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes your dog's skin to promote a healthier and manageable coat, and fipronil that eliminates and kills the fleas and ticks that try to bite our pets that can be itchy and uncomfortable. It can also cause painful allergic reactions and transmit dangerous illnesses. Papi Mixidin is a combination of miconazole nitrate and chlorhexidine gluconate that helps provide relief against fungal infections such as ringworm and superficial skin infections caused by yeast and bacteria. It is the shampoo of choice for those suffering from mixed fungal and bacterial infection and skin with wound and other skin damage. Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as boilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. Multivits, multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Biome Plus is indicated for the use of prevention and treatment.
Test mic. Good morning, everyone. Good morning to all our dear colleagues here in Penglai and those who are attending remotely. Recognized as the Philippine pioneering veterinary specialty college in our country, the PCCP continues to champion excellence in companion animal medicine through education and professional development. This two-day course will be available through online face-to-face modalities, offering participants a chance to earn up to 11 CPD points for on-site attendance and 6 CPD points for online participation. So without further ado, we welcome each and everyone as the Philippine College of Canine Practitioners gears up for the 5th Veterinary Focus Course, Elevating Companion Animal Care. I am Sherlyn Subiaga, commonly known as Doc Aline, and I will be your host for today. And so let us now begin with our simple prayer.
Panginoon, kami po'y sumasa inyo sa mga oras na ito upang magpasalamat sa pagkakataon at mapagpakumbabang hilingin ang inyong gabay at karunungan sa pagsimula ng makabuluhang programa para sa aming bayan. Panginoon, kalooban ninyo kami nawa ng sapat na lakas at pagpalain ang bawat isang naparito na siyang bumubuo ng mahalagang hakbang na ito. Dalangin namin na magsilbi itong daan tungo sa mas epektibo at progresibong paglilingkod sa publiko. Itinataas po namin ang lahat ng ito sa ngalan ng inyong banal na presensya. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Mahal ko ang Pilipinas, bansang mahal ng Diyos, dakilang lumikha. Mahal ko rin ang propensyong veterinaryo ng bayan at ibang panig ng mundo.
Alay sa pangmadlang veterinaryo, loobin ay makadiyos makatao. Marunong magilas matatag sa paglago ng propesyon sa bayan at sa mundo. Mahal ko ang Pilipinas, tungo sa kanyang pagulan hanggang wakas. Mahal ko ang lahing Pilipino, pagbabago sa bansa'y matatamo. Tayo ay nagpuli at nagkakaisa upang talakayin ang suliranin sa pagtataguyod ng kalusugan. Mga alagang hayop sa bakuran kanayunan. Mahal ko ang Pilipinas, tungo sa kanyang pagunlad hanggang wakas. Mahal ko ang lahing Pilipino, pagmula sa propesyon matatamo. Pagmula sa propesyon matatamo. Pagmula sa propesyon matatamo.
We will now all sit. Okay, so for today, before we formally start our 2-day course, let me call on the product manager of VetMate, Dr. Dennis Bernabe, for the opening and welcome remarks. Let's give him a round of applause.
So, good morning. So, welcome sa PIP Veterinary Focus Course. So, maraming tatanong bakit Veterinary Focus Course. So, BFC kasi 'yon, initial ng VetMate Pharma Corp. Kaya Veterinary Focus Course. So, welcome kayo. Hopefully sa mga naka-online. So, mag-relax ka kayo, mag-enjoy. Then, hopefully marami tayong matutunan sa 2-day course natin na 'to. Yun, thank you.
Thank you, Doc Dennis. And to formally introduce the Specialty Board of the Philippine College of Canine Practitioners, let me call on our Vice President, Dr. Randy M. Galutan.
Thank you, Doc Aline. Good morning, everyone. Thank you, Doc Dennis. Thank you, VetMate. Papi makes me happy. Yan yung laging nakikita sa kanya eh. Okay, it's my honor to present the Philippine College of Canine Practitioners Specialty Board. The Specialty Board of the Philippine College of Canine Practitioners serves as the authoritative body dedicated to uphold the highest standard in the field of companion animal practice in our country. Composed of experienced and highly qualified practitioners, the board is responsible for evaluating and certifying members. The specialty board ensures that its members are equipped to deliver exceptional care and by promoting excellence and setting benchmark for clinical and practice competence. First, we have Dr. Ray B. Oronan, a graduate of the College of Veterinary Medicine, University of the Philippines, Los Baños, a top notcher of the PRC VLE. He took his Master's of Science in Veterinary Medicine from UPLB and taking his PhD in Japan. He is a diplomate of the Philippine College of Canine Practitioners and a fellow of the Philippine College of Veterinary Surgeons. He is also the past president of BIPAP, and this department, he is an assistant professor of the Department of Veterinary Clinical Sciences, the College of Veterinary Medicine, UPLB. Second is Dr. Lester Luis L. Lopez, also graduate of the College of Veterinary Medicine in University of the Philippines, Los Baños, a diplomate of the Philippine College of Canine Practitioners and a founding member of the Philippine Society of Veterinary Internal Medicine. He is a past president also of the Veterinary Practitioners Association of the Philippines and the owner of Manila East Veterinary Care. We have also Dr. Criselda Lau, a graduate and a class salutatorian of the College of Veterinary Medicine, University of University of the Philippines, Los Baños, a diplomate of the Philippine College of Canine Practitioners, fellow of the Philippine College of Veterinary Surgeons Companion Animal. She holds degrees in both veterinary medicine and nursing and is a licensed nurse in the Philippines and the United States. Her academic excellence has been recognized with accolades such as the Edna Lucille Enriquez Yap Research Award in Veterinary Anatomy and the Research Award from the Philippine Society of Animal Scientists. Currently sitting as a board of director of VIPAP and also an active advocate for animal welfare and public health. She serves as the board member of Pausivity Project Philippines. Dr. Lau co-founded the the ARC Veterinary Clinic, which was located in Davao City and now in Carmona, Cavite. Fourth, we have Dr. Wenceslao Ortiz Jr., a graduate of the Fatima Medical Science Foundation in 1988. And also, he is a fellow of the Philippine College of Canine Practitioner and a fellow of the Philippine College of Veterinary Surgeons Companion Animal. He's now professor of the De La Salle Araneta University. We have also Dr. Elizardo Reyes. He is also known by the name EVR. He is a graduate of the University of the Philippines in 1985 and a fellow of the Philippine College of Philippine College of Canine Practitioners. We have Dr. Sixto Miguel Enrique S. Carlos, a graduate of UPCVM in 1992, a fellow of the Philippine College of Canine Practitioner and a fellow of the Philippine College of Veterinary Surgeons Companion Animal. We have also Dr. Menandro Valerio, a graduate of the Araneta University Foundation Institute of Veterinary Medicine in 1974, a fellow of the Philippine College of Canine Practitioner and a fellow of the Philippine College of Veterinary Surgeon. We have also Dr. Cesar Bernardino, a graduate of the Gregorio Araneta University Foundation in 1990, a professor of De La Salle Aventari University, and a fellow of the Philippine College of Canine Practitioner and fellow of the Philippine College of Veterinary Surgeon Companion Animal. And last but not the least, our chairman, Dr. Adrian P. Ibanez. His academic journey began with Bachelor of Animal Science cum laude from Visayas State College of Agriculture, followed by a Doctor of Veterinary Medicine cum laude from Leyte State University. He furthered his education with a PhD in Veterinary Sciences, Internal Medicine from the United Graduate School of Veterinary Sciences of Gifu University and Obihiro University of Agriculture and Veterinary Medicine in Japan. Additionally, he earned his diploma in Research and Development Management from the University of the Philippines, Open University, and a master's in Business Administration from Southwestern University, PINHA. His contributions to science has been recognized nationally and internationally, including being named among the top 75 medical and health scientists in the Philippines in 2022. He is also the past president of the Philippine Society of Veterinary Internal Medicine. He is our immediate past president and a fellow of the Philippine College of Canine Practitioner. So these are the specialty board of the Philippine College of Canine Practitioners. Good luck po sa inyong lahat. And of course, I would like to acknowledge all the members of PCCP that will be giving their comments later on. Aside from our specialty board, all members will be giving their comments, suggestions, and good luck. Thank you.
Thank you so much, Dr. Randy. Okay, before we start, I will be presenting the rules for this two-day event. The first one is that please note that the link is only for you and should not be shared. Second, to help ensure a smooth and professional experience for all attendees, please keep the following Zoom etiquette tips in mind during the 5th Veterinary Focus course. First, join early. Log in at least 10 to 15 minutes before the session starts to check your connection and ensure everything is working properly. Use also your full name. Please use your real name and credentials when joining. This helps with attendance tracking. Mute. Keep your microphone muted during the presentations to minimize background noise. You may unmute when called on or during Q&A. Also, turn off your camera. We encourage you to turn off your camera for better Wi-Fi or data connection. Dress appropriately. While you're joining remotely, we ask that you dress in a professional or business casual manner. Use the chat respectfully. The chat feature is for relevant questions, comments, or technical support. Please be respectful and on topic. Also, avoid multitasking. Treat the course as if you would be in an in-person seminar. Give your full attention to make the most of the experience. Also, if you are having technical difficulties, contact our tech support team via the Zoom chat or call any of the officers of the Philippine College of Canine Practitioners. So I have already presented the rules. Are you all ready to our 5th Veterinary Focus course? Yes. Good job. So now, the PCCP actually is very, very proud because this year's lineup highlights outstanding veterinary speakers who will deliver specialized clinical presentations. So, I would like to introduce our first speaker. She is a licensed veterinarian with a strong foundation in companion animal medicine and veterinary clinic management. She earned her Doctor of Veterinary Medicine degree from Central Luzon State University in 2016 and passed the veterinary licensure exam that same year. She began her career in small animal practice in Nueva Ecija and Caloocan, where she gained hands-on experience in general medicine, surgery, and client care. In 2019, she broadened her clinical expertise internationally as a veterinary technician in Singapore, specializing in anesthesia, exotic animal handling, and international veterinary standards. In 2020, she co-founded Petlandia Vets in Malolos with her husband and currently serves as the practice manager of both the Malolos and Plaridel branches. Her key interests include preventive medicine, dentistry, exotic animal medicine, and anesthesia. She is passionate about raising clinical standards and building client-centered veterinary teams. Without further ado, let us call on Dr. Reyna A. Mutia Cardenio. And she will be discussing about the applications and practicability of point-of-care quantitative PCR in the diagnosis of tick-borne diseases in dogs. Doc Reyna.
Hello po, Doc. Thank you po for that introduction. So, ang hirap naman pala. Pwede ba huwag na lang dito? Okay, so this morning, I will be presenting to you my study entitled The Applications and Practicability of Point-of-Care Quantitative PCR in the Diagnosis of Tick-Borne Diseases in Dogs. So we all know that tick-borne diseases are a growing health concern of canine health in the Philippines. So where environmental conditions favor the proliferations of tick population. So blood parasitism caused by pathogens such as Ehrlichia species, Babesia species, and Anaplasma species is a highly prevalent among dogs in both urban and rural settings. So it is transmitted by the brown dog tick, Rhipicephalus sanguineus. So these parasitic infections pose a severe health challenges for dogs ranging from mild symptoms to life-threatening conditions. So a proper diagnosis of tick-borne diseases is crucial to ensuring a timely and effective treatment. So an early identification not only prevents severe complications in infected dogs, but also reduces the risk of transmission to other animals and in some cases in humans. So in the Philippines, these are the diagnostic tools used in detecting tick-borne diseases. So we all know the microscopy, hematology, lateral flow, immunochromatography, ELISA, and nucleic acid-based test. So what are the objectives of this study? So this study aims to determine the applications and practicability of point-of-care qualitative PCR in the diagnosis of tick-borne diseases in dogs, so such as the positivity rates, hematological profiles, and the associated risk factors. So what are the significance of this study? So first is the proper detection. So we all know that proper detection is crucial in managing tick-borne diseases in dogs. Identifying tick-borne diseases promptly allow us for a timely treatment and improving the outcomes of the affected dogs. So next is the diagnosis. So diagnosis is essential for us to make an effective treatment. So analyzing hematological profiles in conjunction with an advanced diagnostic tools like POCQ-PCR enhances the validity and reliability of our initial diagnosis. So this combined approach helps us to determine whether we are correctly identify the pathogens responsible for the disease. So once we have the responsible for the disease, we can make a targeted intervention. So identifying the risk factors and associated hematological profiles helps in creating a tailored prevention and treatment strategies. And finally, disease management. So disease management relies mostly on monitoring the positivity rates of tick-borne diseases in the clinic. So it helps us veterinarian to understand the disease occurrence, frequency, and implement an effective measures in the local practice. So in this study, this is a retrospective cross-sectional design where medical records of of dogs that comes in our clinic with tick-borne diseases from the December 2023 up to January 2025. So for the inclusion criteria, I include dogs with complete history, CBC, point of care qPCR, and I exclude all the patients that has an incomplete records without CBC, and also our referral patients. So for the hematological profile, I analyzed the WBC, RBC, hematocrit, and the platelet. So for the POC-qPCR, dogs tested with this panel, the Ehrlichia species Anaplasma phagocytopilum, Babesia canis, and Babesia gibsonis. So I also analyzed the risk factors. Oh, so sorry with the, hindi ko alam na ganyan, sorry. So also I analyzed the risk factors such as the blood count, tick exposure, gender, outdoor, preventives, history of blood parasitism and treatment, and the number of dogs in the household. So this is an overview of a polymerase chain reaction. So you can see here that a single DNA is amplified to make 1 billion copies. So in our clinic, this is an overview of a point-of-care qPCR workflow. So first, we need a sample in a whole blood sample in an EDTA, then a 200 ml of 200 UL of blood is transferred to the preservation buffer. So 200 UL of blood on that buffer is transferred to the DNA extraction kit. So after you put it in the DNA extraction kit, you will transfer it into the DNA extraction machine. That runs in about 5 minutes. So during DNA extraction, you will see the principle of this DNA extraction. It uses a magnetic DNA bead. So the magnetic beads will stick to the DNA, and then a magnet pulls out the beads out of the liquid, and so it can be washed and purified. So after that, 20 UL of extracted DNA was added to lyophilized reagent, and it will run in a thermal cycler. So the result will run in real time. You will see the amplified genes will serve as curved lines, especially if the cycle threshold is below 35. So for the hematological profile analysis, an independent t-test was used to compare the hematological profiles of a disease-positive and disease-negative dogs. These tests helped to determine if there were significant difference in the blood parameters between two groups. With a p-value of less than 0.05, it is considered an indicative of a statistical significance. So the odds ratio calculation is used to determine if there is a significant association between the blood profile and the positive outcomes. So for the risk factor analysis, the odds ratio was calculated to assess the association between the exposure to various risk factors and presence of tick-borne diseases in dogs. So whereas A was the number of exposed disease-positive dogs, B was the number of exposed disease-negative dogs, C was the number of non-exposed disease-positive dog, and D was the number of non-exposed disease-negative dogs. So here are the results. So in this study, I reviewed a total of 88 dogs, but due to the inclusion criteria, I removed the 15 dogs. So I already mentioned what are the inclusion criteria before. So this left me with 73 dogs that will included in the analysis. So these 73 dogs forms the basis of the hematological profile, risk factors, and associated risk. Okay, so here are the demographic and clinical characteristics of all the patients included in the analysis. So for the gender, we'll see here that there are 38 male and 35 female. So this gives us an unequal gender distribution. So for regarding with the preventives, majority of them don't have preventives or incomplete preventives. So that's, and only 14 dogs had a complete preventive. So in case of their living condition, majority of them were indoor and only 6 dogs were outdoor. So in terms of the history of medications, patients with the history of medications were recorded in 42 dogs and 31 dogs were recorded without a history of medications. So these are the summary of clinical findings presentation of all dogs examined. So we see here the general signs of illnesses such as inappetence, lethargy, and weakness. It was recorded in 25 dogs. So anemia, low platelet count, this is a hallmark of tick-borne diseases. It was noted in 20 dogs. So gastrointestinal signs such as vomiting and diarrhea, these were recorded in 12 dogs. So pale gums, bruising, and epistaxis, which is signs of blood-related abnormalities, these were noted in 11 dogs. So approximately 7% of the patient don't have clinical signs that are greatly attributed to a severe clinical signs. So these are the summary of clinical findings and presentation of tick-borne disease positive patients. So a sign of general illnesses such as lethargy, weakness, and inappetence, it was observed in 13 dogs. So 6 dogs were observed for anemia and platelet count. So gastrointestinal signs such as vomiting and diarrhea, it was observed in 4 dogs. So pale gums, bruising, epistaxis were observed in 3 dogs. So these clinical findings and presentation really showed that it is crucial to determine a proper diagnosis for tick-borne diseases. So the positivity rates of tick-borne diseases in POC qPCR, we'll see here that in Ehrlichia, there were 22 positive out of 51 negative. So this gives us a 30.14 positivity rates. While in Anaplasma phagocytophilum, only 2 positive over 71 negative were noted. So this gave me a low positivity rates of 2.74%. So, however, I did not see any Babesia gibsoni. So the only Babesia we have noticed is the Babesia canis, which is, there are 4 positive out of 69, which gives me a 5.48 positivity rate. So here we can see the frequency of co-infection between Ehrlichia species and Anaplasma phagocytophilum and Babesia species. So we can see a single infection of Ehrlichia species and Babesia canis were noted in 1 out of 26. So this gives me a 3.84% positivity rate. Similar to Ehrlichia and Anaplasma phagocytophilum, I also reported 1 out of 26. So this gives me a 3.84% positivity rates. So here we can see a whisker box plot. So okay, so the values inside the box are the range, and the line here is the median. The X here is the mean average, and the whiskers are the line outside from minimum to maximum. So the dots here are the outliers, which are the upper to lower extremes. So when using an independent t-test or to compare the 2 means was computed, we can see that there is no statistically significance between the means of the RBC count of A positive and negative dogs because the p-value is greater than 0.05. So similar to the hematocrit of a positive and negative patients, we can see here that there is no statistically significant because the p-value is greater than 0.05. So, however, we can see here the WBC count of a positive and negative dogs. There is a slightly, in the positive dogs, there is a slightly low to normal values than to the negative dogs, which has a wider range of value. So, however, there is a slightly low p-value, slightly low range of statistically p-value is 0.46. So, same as with the platelet, we can see here that the platelet count is statistically significant in the positive dogs than the negative dogs. So, same as the WBC count, the platelet count of a negative dog had a wider range. So, here, whenever we see a low WBC count and platelet count, we should suspect tick-borne diseases. So here, the hematological profile of individual tick-borne diseases. So we can see here that all patients included had a low platelet count. It also noted that there is a slightly anemia, and in terms of WBC, there is only low to normal. So, a single co-infection of Ehrlichia species and Anaplasma phagocytopilum, the WBC count is increased to 21.3, or it has a leukocytosis. So we look into the various exposure or risk factors that can be associated with a positive result. So, unfortunately, I did not see any statistically significant risk factors. So, in terms of no prevention, gender, history of tick exposure, age, number of dogs in the household, being outdoor, has tick during exam, has received doxycycline before, or even severe clinical exams. Based on these are not a good predictors of a positive results. So, here we can see that a mere decrease of platelet count below 200 is still not a statistically significant to be a positive result. However, so for example, if the patient had a platelet count of 190, it is less likely to be positive in PCR. So, however, the platelet count of 180 and below, we will see here that the p-value is statistically significant as the platelet decreases. So, next, in terms of the low hematocrit count, there is no significantly, this is not a statistically significant. So, also, even if I lower it to 25%, it's still not statistically significant. So, also, in the low RBC count and high WBC. So, wait, hinga muna ako. So, for the discussion, so we can see here that in my study, we can see here that the positivity rates of Ehrlichia is much higher than the published reports. Maybe possibly because in my study, most of the patients are sick patients. So, in the published reports, the patients included mostly are randomly selected, and there are healthy controls. So, and also maybe possibly the positivity rates or the frequency is due to the locations and the possible risk factors. So here we can see that I identified a low positivity rates in terms of Anaplasma phagocytopilum, which is 2.74% compared to the published reports. So maybe because the published reports are identified at the genus level, and some are identified at the species level, such as in Dr. Corrales et al. And Dr. Galay et al. So I identify, in case of Babesia, I did not identify a B. gibsoni. I only identify B. canis. So Because some of I don't see any molecular evidence regarding the B. gibsoni in the Philippines, but we are suspected that it is already present in the Philippines. So actually, we have a case of B. gibsoni in our clinic, tested or confirmed using conventional PCR, but it was not included in the study because of the exclusion criteria. So here, there is a single co-infection between Ehrlichia species and Babesia canis, and also a single co-infection between Ehrlichia species and Anaplasma phagocytopilum. So previously, there were reports by Dr. Ibanez that there is also a single co-infection between Ehrlichia Anaplasma species and Babesia species in Cebu. So here, since WBC count can be used as an initial basis for further testing, I correlate it as a positive indicator of tick-borne diseases. So, how you can see here that the WBC count showing a low to normal, there is a statistical significance. However, it is contradicted to other other literature, such as it says that leukocytosis can be more common in acute phases. So some reports are also contradicting because it also depending on the severity and the stages of the disease. So some reports said that leukopenia is a common hematological findings, and it also said that commonly observed in dogs infected with Ehrlichia species, co-infected with Ehrlichia species and Babesia species. So some also reports that leukocytosis are linked to more severe clinical signs, particularly in dogs co-infected with Babesia and Anaplasma species. So, in short, WBC count cannot be used to diagnose tick-borne diseases. But we can use this as our differentials, so we can suspect tick-borne diseases in our patients. So here there is a clear association between the cutoff value of the platelet count of positive patients. So we can see here that as the platelet decreases, the statistically significant increases. This is also in agreement to some literature said that thrombocytopenia is a hallmark of ehrlichiosis, which is also majority of our cases is Ehrlichia. Okay, so there are no risk factors identified. So maybe because the homogeneity of the study population and also the selection bias. So in this study, there are no healthy control. So also the sample size. So there is a low sample size. So maybe an increase will also increase the chances of a positive result. So next is the study design. So in this study, during physical examination and getting the information from the clients, we rely mostly on clients' information and recall. So, however, in some literature, there are possible risks identified, such as having no preventives and outdoor activity. So these are the limitations of the study. There are no peripheral blood smear exam in all patients. So, hindi namin ginawa yun. So, no comparison on antibody testing in all patients. And there is also no confirmation using conventional PCR and DNA sequencing. So, the specificity and sensitivity of POC-qPCR use is not yet validated and published. Thus, there is an inherent limitations of PCR, such as low DNA in sample and an acute infection. So, and also, lastly, not all tick-borne diseases are included in the kit. Okay, so these are we're showing with you the cases which are the applications and practicability of POC-qPCR. So we can see here that in case number 1, POC-qPCR as a parallel or adjunct test to increase diagnostic accuracy. So this patient, Juno, is an 11-year male intact Siberian Husky, came in our clinic for second opinion. So this patient was already confined from other clinics for 3 days, and they already test it using lateral test kit, and it is positive for Ehrlichia canis antibody. So during presentation, the patient is anemic and tick infested. So the owner wants to have the patient confined, but it was declined due to tick infestations, as in madami po talaga. So upon physical assessment and CBC was performed, it was noted that the patient was anemic and had a platelet count of 1. Okay. So the client were advised to do the PCR as a parallel testing. So it came out that the patient is an Ehrlichia positive. So since the patient cannot be confined, and the patient was sent home with this prescription, so doxycycline 5 mg per kilogram BID for 30 days, platelet enhancer 5 ml BID for 30 days, and during physical examination, the patient already given oral tick prevention. So it was also advised, the client was advised to give it maintenance. So after 2 weeks, the patient came back for follow-up, and the good thing is the CBC are all within normal limits. So we can see also the improvement in the patients. Then after the 30-day treatment, the CBC reveals slightly low platelet count. So another platelet enhancer was advised for another 2 weeks. Then after that, the patient went in again for follow-up, and the patient fully recovered and now in our wellness program. So in this case, the POC-qPCR was used as a parallel despite the parallel testing, despite that the patient was already tested with a lateral kit. So this approach was used to determine if it's solely due to Ehrlichia canis or if there are other blood parasite present. So such a diagnostic tool, you see here that it increases the our diagnostic accuracy, and we can give a proper treatment. So for case number 2, POC-qPCR is used to monitor reoccurrence of blood parasitism. So this patient, Dior, is a 2-year-old and 8 months, female intact mixed breed. So this patient had a history of Anaplasma and Babesia species positive in a lateral flow kit. So this patient came in with a chip complaint of bloody stool with mucus. So the owner was advised to do an initial CBC, and an initial CBC showed that the patient was anemic and had a thrombocytopenia. So since the patient already had, I think it's last year, from the time of the presentation, that it was tested for positive for lateral flow kit, AQ-PCR was advised to the owner. So we can see here that the qPCR was tested positive for Anaplasma phagocytophilum. So the patient was sent home with prescriptions, same. We all know that doxycycline is the same dosages. In this case, we used prednisone, 0.5 mg per kilogram, BID for 7 days, then tapered it into 0.5 mg per kilogram SID for another 7 days. So also a platelet enhancer was used at 5 ml BID for 30 days. So an oral tick and pre-prevented was advised as a maintenance. So after 2 weeks, the patient follow up, and the CBC results were all within normal limits. So the patient finished full treatment. So in this case, POC-qPCR was used to to confirm the diagnosis so that we can have a prompt treatment. So this also highlights that using a qPCR is an essential so that we cannot have a false positive and the misuse of antibiotics. Okay, so in case number 3, POC qPCR in dogs suspected of blood parasitism with exposure to previous positive patients in household. So this patient had a history, lives with patient that has a history of positive blood parasitism. It is also don't have an tick and flea prevented. So the patient came in with, again, the same, bloody stool with mucus and impotence. So this patient also had a history of giardiasis. Okay, so an initial CBC was performed and it showed there is a mild anemia and another thrombocytopenia. Okay, so, and then, because of the history in the household, para mas mabilis, we just advised the qPCR. So then it came out that it is positive. This is the single co-infection of Ehrlichia and Babesia canis. Okay, so the patient was sent home with the same medications and based on their weight, and an additional kidney and liver supplement was added. And since it is a Babesia case, we give imidocarb at 6.6 milligram per kilogram once every 2 weeks for 4 weeks. And again, and then oral preventives maintenance. So this highlights the history of blood parasitism in the household is crucial because we all know that ticks transfer blood parasites through bites. So this also highlights the possibility of co-infection with multiple blood parasitism. So this is also crucial in our treatment and treatment management and overall well-being of our patient. So after 2 weeks, we see here that the CBC are all within normal limit and the patient completed the full treatment. Okay, so in case number 4, POC qPCR as a pre-surgical screening in dog with tumor and anemia. So this patient, Danaya, is a 7-year and 5 months old female intact Shih Tzu. So this came in for a tumor removal and umbilical hernia repair. So as part of the surgical clearance, CBC were performed and it showed that the patient is anemic. But you will see there is a normal platelet. So since this is a surgery, even if it's non-emergency, we still advise the owner for a qPCR, and there it came out that it is a Babesia canis positive. So if the patient was not tested for qPCR and the surgery was performed, it is crucial to the patient. So because if the surgeon don't know that the current overall health of the patient, maybe the patient will, syempre we all know that tumor removal causes bleeding. So this is a Babesia canis. So Babesia canis is a blood parasite infects RBCs and can also lead to hemolytic anemia. So the patient was discouraged for surgery, is sent home for treatment, for treating the initial findings. So it was sent home with the same medication. Since it's Babesia, we give imidocarb, 6.6 milligram per kilogram once every 2 weeks for 4 weeks. And then the patient follow up after 2 weeks. The CBC are all within normal limit. So the patient finished full treatment. However, the patient did not return for surgery. I don't know why, but I asked for follow up and they said that the patient was okay. Okay, so for my last case. So POC qPCR as a pre-surgical screening, again, in apparently healthy dog for routine castration with thrombocytopenia. So clinic, we are having a routine promo coupon every Friday. So this patient was part of that. So Brownie is a 2-year-old male intact mongrel. So the chief complaint is just a castration. So the patient was bright alert and responsive. Though it don't have a history of vaccination and deworming, also there are no preventives. So as part of the surgical clearance, CBC were performed, and the CBC results, leukocytosis and thrombocytopenia. Then again, it was advised for a qPCR because it is a surgical procedure. So qPCR also check if there is an active infection. So you can see here that it is positive for Ehrlichia and Anaplasma phagocytopilum. So the patient was discouraged for, of course, hindi na siya fit for kapon. So the patient was sent home with medications, doxycycline 5 mg per kilogram BID for 30 days, platelet enhancer for 3 ml BID for 14 days, liver supplements, 1 cup once a day for 30 days, and an oral maintenance of tick and flea preventives. So the patient did not follow up due to financial constraints. So however, the owner the owner brought the other pets for chemotherapy. So I think he just prioritized the other patients, and the owner was we asked if how is Brownie. So then the owner reported that Brownie is doing well. So in this case also highlights surgical screening. So it is important that when we see when we suspect, if you have a qPCR in the clinic, then you might advise to the owner. So for the conclusion, conclusion na. POC qPCR is a useful diagnostic tool for detecting tick-borne diseases such as the Ehrlichia species, Babesia canis, and Anaplasma phagocytopilum. So Ehrlichia infection had a highest positivity rate in dogs admitted for consultation in our clinic, followed by B. canis and Anaplasma phagocytopilum. So a co-infection of Ehrlichia species with B. canis or A. phagocytopilum was reported. So, and then dogs with tick-borne diseases had a significantly lower WBC count and platelet count compared to negative dogs. There are also no risk factors identified due to the homogeneity of the sample population to the studied exposures. However, it was identified that a low platelet count was significantly associated with positive results. So here are my recommendations. So hematological profile should be further evaluated using peripheral blood smear exam. So if suspected of blood parasitism, perform a parallel testing using antibody and PCR to increase the sensitivity and diagnostic accuracy. Then also do not rely mainly on client's recall and patient's history. Na magagawa natin yung sinasabi ng client. So, but avoid information and selection bias when conducting examination and testing. And lastly, perform a serial testing after treatment to monitor the treatment effectivity and infection relapse. Thank you. Question.
Yes. Thank you so much, Doc Reyna. Okay, the floor is now open actually for all your questions, comments, feedbacks, and recommendations, especially those dun sa mga nasa Zoom platform. Okay, the first question po, Doc, is, I would like to ask, how do we manage, possible resistance of any preventives measures like available preparation medication we have in the market, given there are reports of a possible resistance? Again, good morning, Doc. I would like to ask, how do we manage possible resistance of any preventive measures like the available preparation medications we have in the market, given there are reports of a possible resistance? Second question, how can we manage it in connection to a patient with recurrent blood parasitism and client compliance and the need of monthly prevention? Is it okay po ba if we alternate those available products to avoid drug resistance? Thank you po for your presentation. Very informative.
Thank you for that wonderful question. Parang miss you. Actually, regarding the tick and flea preventives, marami tayong available in the market. So, I think we should stick to one oral preventives or any spot on. And then, when the patient come and complain, you will see that there is an recurrence of ticks or whatever. We need to change. Okay? So, marami namang available. So, and then, regarding the client's compliance, we should, pwede mag-Tagalog na lang ako. So, dapat, clients are informed regarding the preventives, the management of ticks in the household. So, you need to advise that that they need to maintain a specific tick and flea preventives, and then they also need that dapat lahat ng patients in the household merong monthly preventives, or now meron quarterly, and now meron na tayong annual preventive. Then kailangan din nilang i-check if there are ticks inside the house. So kahit naman magbigay tayo ng tick and flea preventives, kung nandiyan pa din yung mga garapata, alam natin yung life cycle ng garapata. So bababa lang yan, mag-stay, akit ulit. Paano kung na-miss out niya yung isang month ng preventive? So there will be really a reoccurrence of that parasite. So you need to advise properly the clients regarding the management of the environmental preventives using, pwede tayong gumamit ng amitraz or any acaricide. We can advise that. So I think this combination would eliminate those parasites. I hope I answered those questions kasi nakakalito.
Okay. Next question, Doc. What is the essence of knowing the species? I think the doctor is referring to the blood parasite itself. If the same treatment is applied.
Okay, so what is the, sorry Doc?
What is the essence?
Essence. So knowing at genus specific or species specific. Actually, there are some tick-borne parasites that are transmitted, that can be transmitted to humans. I never mentioned the Anaplasma phagocytophilum. This is a zoonotic disease. So, in this species level, if we know that this parasite is a zoonotic, we can advise the clients more. Sabihin natin na, ma'am, nakakahawa po ito. So, dapat mas ang preventive measures natin and treatment plan regarding this. Kaya nga po, managing or monitoring the treatment, the tick-borne diseases in our clinic, this help us. So makikita natin kung ano ba yung mga positivity rates doon sa clinic natin. That would help us to a proper management treatment.
Okay. Third question, Doc. Is 48 days doxycycline acceptable or 30 days only?
Actually, I checked the other literatures. They said that it is 28 to 30 days lang. So I don't know the 48 days. Maybe you can tell me the literatures about that. But upon checking, I only checked the CHOCUP and Doc Poly and other literatures is only 30 days. Maybe if you will see, if you check for another qPCR and it was still an active infection, I think you can modify your treatment plan. You can extend the antibiotics and recheck again.
Okay. So bear with us, Doc Reina, because you still have 17 minutes to complete the 1 hour slot. Okay, good morning, Doc. Is it appropriate to treat a patient who seemed to be apparently healthy with blood parasitism upon annual checkup showed thrombocytopenia with no other apparent signs and tested positive for the lateral flow kit, considering PCR is not available in the area for the detection of active infection and lateral flow kits usually detects antibodies? Thank you.
Okay, thank you. Magandang question yan. Actually, if the patient was apparently healthy during during physical exam, this is just an annual health check. I think there's no need for treatment for doxycycline. However, we need to treat the thrombocytopenia, so we can give a platelet enhancer. So hindi naman magkakaproblema kasi most of our platelet enhancer are just mga herbals, but they can help. I think that's my answer to that.
Yes, thank you, Doc. Hello, Doc. I've been having increasing cases of blood parasitism infections in my clinic where the CBC is largely unremarkable, but the patient has the usual symptoms of BP infection like lethargy, inappetence, and evidence of bleeding. Lateral test kits are also negative or faint line positive, but peripheral blood smear shows blood parasites like Babesia, Anaplasma, Ehrlichia. What is your opinion on this, Doc? Thank you.
Wow, ang galing mo para makita yun sa peripheral blood smear. So, I think you send that sample to a conventional PCR so that we can check and we can share that information na despite negative in the antibody testing, there's still possibility of an active infection. So, para matapos na yung kakaisip mo, Doc, you need to go to conventional PCR laboratory to confirm your suspicion. So, I think ang galing mo para makita yon sa blood smear.
Okay. Doc, is it true that using different brands of doxycycline will decrease or prevent the resistance ng blood parasitism sa doxycycline? Pag nag-recur po ba yung blood parasitism, need na ba ng ibang brand na yung gagamitin or yung previous brand na ginamit?
Actually, we all know that we should prescribe in generic. So they're all doxycyclines. So in that case, I don't think brand matters. So they're all the same doxycycline. Of course, you have a trusted doxycycline in your clinic. So a proper dosages uses, I think, reduces the misuse of that specific antibiotics. And of course, wag yung bigay lang ng bigay ng doxy. Blood para, bigay agad. Wag ganun. So, I know, previously, wala yung mga advanced diagnostic tools. Pag nakita nga naman talaga natin na mayroong thrombocytopenia ang patient, we all suspect it as a blood parasite. So, I think this is a call for everyone that we need to do an advance, wag tayo matakot sa advance diagnostic tools. Kapag wala sa clinic, wag ka malungkot. You just refer. Send it to the clinic that has a qPCR. Hindi yun, walang mawawala sa'yo doon. At least malalaman mo na mas mapa-properly treatment mo yung pasyente mo.
Okay. Doc, after the 30-day treatment, do you recommend repeating the POC qPCR? If yes, do you recommend continuing the medications if the patient is still positive, even when the CBC is normal and the dog is physically active?
Actually, that question already answered kanina. So, but regarding with the POC, PCR, so it is, actually wala namang protocol regarding when do you need to repeat the POCQ-PCR. But of course, we all know that possibly the infection would last for days, and maybe after 30 days, you repeat the qPCR. Also, in our clinic, we advise that. But it depends on the client's compliance kasi medyo mahal din po siya. Regarding sa treatment, if it's still positive, you can modify your treatment plan. So, ganun pa may active infection pa. We all know that kapag nag-test tayo ng qPCR, we'll see that there is present. So, nakikita naman, molecular level na siya. So, we just need to modify our treatment and retesting and follow-up.
Okay. Doc, since you've mentioned that doxy should be given for 30 days, what alternative medication should be given if the CBC results to leukocytosis and anemia for more than a month already? Also, should antibiotic still be given for BP positive or suspected BP patients despite no clinical signs? If yes, how many days pa can we extend the antibiotics?
Okay, so this one, if there are no, pag hindi ito na-test for qPCR and there is no active infection, you should stop. If there are leukocytosis and thrombocytopenia, anemia, I think you can further investigate. But hindi lang naman blood para ang nagkakos ng mga yon. So you just further investigate, and then pag negative talaga siya sa mga possible diseases, then you just nakikita nyo na the patients are okay. So you just give platelet enhancement. So more on supplements.
Okay. Doc, old vet here. Babesia is common about 30 years ago. What is your opinion? Bakit laganap na ito ngayon sa mga dogs?
Siguro po, before, wala pang masyado nag-export. So, baka yung mga common tick-borne diseases sa atin is locally lang na dito. So, possible, I think it's possible na yung pag-export from other pets, from other countries that that have a babesia, I think that's one of the reason. So, lahat naman po nag-evolve. Kaya nga po, so yung kanina, yung regarding dun sa essence ng species specific, so pag nalaman natin, dito yon yung mga ganitong question, pag nalaman natin yung species specific, though we still have a same treatment regimen, we can personalize the preventives and management for our patients.
Okay. Doc, this is a quote-unquote question. You still have 8 minutes. Yes. I like to use, quote-unquote, qPCR to know the case has recurred or a new case. Is this statement wise? I like to use qPCR to know the case has recurred or a new case.
I like to know the cases. Yung magte-test ka na lang basta para malaman kung ano. Of course, you need to have a basis.
So that statement wise daw. I like to use qPCR to know the case has recurred or a new case siya.
If there is an evidence of clinical signs, then for me it's wise.
Okay. In qPCR, is there false positive, false negative? Is it possible daw, Doc?
Actually, I mentioned it in the limitations in my study. So the POCQ-PCR are not yet validated and published. So this is just a test, a molecular test that are available in our clinic. So if you want to confirm for a confirmatory, you need to send it to the conventional laboratories with a conventional PCR.
Okay. Doc, was there doxycycline resistance case already? If so, what other drugs can we use?
Actually, I think yes. There is already a resistance kasi there are lots of misuse of these antibiotics. I think if the patient comes to you without any improvement. For the cases of babesia, you can add the combination of the clindamycin and metronidazole. This was advised in Trocom, so I saw it, and also we're also using it in our clinic.
So, Doc, can you say that test kits are not reliable or PCR ang better?
Actually, kailangan mo lang siyang i-weigh in. No? Hindi naman sinasabi na test kits are not reliable. Of course, they are all reliable. Depende lang yan kung paano mo siya gagamitin. So, if it's for screening and hindi pa nagagawa yung testing, I think it's better to use, lalo na pag budget-wise at tight ang budget ng client, you can still use the antibody testing. So, alam naman natin, even before qPCR was introduced now, we are using that as our diagnostic tools.
Okay. If positive na po ba, Doc, sa test kit, I think you've mentioned na is it okay na wag na mag-PCR?
Anong test kit po yung lateral?
Lateral.
Wag na mag-PCR. Antibody po si lateral kit. So, si PCR is to check if there is a presence of a DNA of that pathogens.
Okay. For the next 5 minutes, I will allow all the doctors here in Penglai to ask their questions po. So, who's going to ask first? Okay, Doc.
Ang dami namang questions.
Good morning, Doctora.
morning.
My question is about, actually I have 2 questions. What is the difference of using this doxycycline hyclate and doxycycline hydrochloride in treating these tick-borne diseases?
Actually, to be honest, Doc, hindi ko po alam, to be honest, kung ano yung ano niyan. Basta, pag magre-reseta lang, ang alam ko lang is doxycycline.
Hyclate or hydrochloride?
Sorry, Doc, hindi ko po alam kung ano yung difference. Hindi ko pa na-search yan. Pero, maybe both of them are available in the market, then we can use it.
So far, is there any resistance that had been reported?
Actually, Doc, I don't, hindi ko pa na-check.
Okay. My second question is, a client went to you and his dog had undergone a treatment of 30 days against ehrlichiosis. Sometimes it is co-infected with other blood parasite. So they have to be treated for at least 42 days. So after the treatment, the next question that the client will ask you, Doc, kailan natin itetest ulit to, baka negative na. So what is your recommendation? A lateral flow or this PCR of what you are recommending?
I will ask you also, what diagnostic tool did you use before you lateral flow? So, na-mention ko na yun kanina. So, lateral flow is just an antibody testing. So, I think I recommend that you refer, if you don't have a qPCR, you refer for further testing for qPCR to check if there's still an active infection. If there's no active infection, I don't think there's still a need of treatment. So you just treat the underlying cause, and if it's still if the patient's still not well, I think you need to further investigate. Baka hindi nga kasi siya blood para.
Okay.
Thank you, Doc. I think this will cover up for your last question, Doc Reina. Hi, Doc. Do you encounter puppies infected in blood parasite? Can you share your treatment plan? Especially, we know that tetracycline has a negative side effects on young pets.
Okay, yeah, we have. Okay, so actually, mostly, marami na tayong nakikitang ganyan because some of the tick-borne diseases are transferred through placenta, and some of that are transferred to tick bites from mothers. So I think it depends on the situation of the patient and age. You just weigh in the pros and cons of using that antibiotics. So we all know that antibiotics will cause yellowing of the teeth. So I think you need to just weigh in your treatment to current situation of the patients. Kung hindi pa pwede at positive siya doon, then and then the puppy is still active, I think you just give platelet enhancer and everything. And then when the patient comes to that age that it is possible to give the doxycycline, kung medyo tawag dito, worry ka regarding that side effects, you can give that. You can retest and give. And then if it's negative, then that's good.
Okay. Thank you so
dami
much,
kong
Doc
question.
Reyna. All right. I think we've learned so much from Doc Reyna, so being the number 1 speaker for today. Okay, let us go on to our second speaker. He is a faculty of the La Salle Araneta University while performing as the administrator and practice manager at the Veterinary Teaching Hospital and Laboratory Animal Facility. He is currently serving as one of the director of Philippine Society of Veterinary Surgeon Companion Animal and chair of the University Institutional Animal Care and Use Committee. Furthermore, he is currently a veterinarian consultant of Bounty Fresh Inc. for canine clinical trials and relic veterinary products. Most recently, he was appointed as a member of the Regional PNP Explosive Ordnance Disposal and Canine Unit NCR Advisory Group for Police Transformation and Development. His field of interest in companion animal medicine includes internal medicine and surgery, toxicology, ethology, reproductive biotechnology, and veterinary research. His work is about the dissection of complications of trichoblastoma in an 11-year-old female spayed Shih Tzu case report. Without further ado, let us call on Dr. Manuel Paulo Granadusin Jr.
All right, so good morning, everyone. So I think some of you here are quite sleepy yet, but let me present my study in front of you with enthusiasm and energy. All right, so my report for this morning is entitled Dissection of Complications of Trichoblastoma in an 11-year-old female spayed Shih Tzu. This is a case report held at the Veterinary Teaching Hospital at De La Salle Araneta University. So as a faculty member of the college, of course we need to define first the study. So let us know first, what is a tumor? So a tumor is an abnormal growth of tissues that can be either benign, which is a non-cancerous type, and at the same time we have the other type, which is the malignant or the cancerous. So tumors are abnormal masses of tissues that can be formed in any parts of the body. So be it in the peripheral side or inside the body. So abnormal mass of tissues that forms when cells grow and divide more than they should, or do not die when they should. These are the definition given by the National Cancer Institute. So how are these tumors formed? So all animals, including companion animals, dogs and cats, are succumbed to this particular tumors. So this can be formed with the different factors in the animals. The tumor formation in general can occur due to the imbalances in cell growth and death, which may lead to excessive accumulation of a certain cell. This can be caused by a variety of factors also, including genetic mutations, lifestyle, environmental toxins, and others. Let's go first with environmental toxins. So environmental toxins is a factor which contributed to the formation of tumors. There are some journals which gives us the data that most dogs are succumbed to formation of tumors if the household are heavy smokers. So these particular chemicals in tobaccos which can cause the formation of tumors not only in dog, of course, but also in humans, is very important for us to consider. Second are the use of pesticides and herbicides. These particular carcinogens are usually used in the household to kill pests and of course to kill weeds in some gardens. So itong mga to, it can contribute more on the formation of the tumors if the pet will be exposed to these certain chemicals. Another thing is environmental toxins that we have are toxins in food bowls of our dogs and cats. That's why usually in some studies, they prefer to use porcelain type or stone type na feeding materials for your dogs and cats, because right now one of the major problems in science is the accumulation of microplastics in tissues and different organs. Actually, in the college, we have studied different food producing animals that are exposed to microplastics, and we found out also that this microplastic can lodge even in the dorsal meat of your tilapia and bangus, not only in the GIT. So if this will be consumed also by pet animals, they can be also, microplastic can also affect these particular animals. So ano bang kinukos ito? It can cause now genetic mutation. Genetic mutation is very important for us to understand, because this is the thing that very crucial to animals. They are exposed to sudden factors such as radiology. So when the animal will be subjected to radiology, kaya kung minsan it's pag nagkakaroon tayo ng patient that we need to x-ray, do x-ray, nagkamali, sige, ulitin na lang yan, ulitin na lang ng ulitin. But it should not be the proper way to do that, because you are exposing this particular patient na meron nang sakit to radiation, which can cause genetic mutation to the cell. Then the lifestyle of the animal, especially if the animal is, although dogs and cats are particularly playful, but if the animal is, for example, obese and they do have sedentary lifestyle, even in humans, so they are more and more accustomed of having the tumors. Other factors, of course, can also be included, such as mechanical trauma in the muscles, which then can develop into certain tumors and the likes. So tumor formation are still being researched as of the moment, because we have several key mechanisms to understand the formation of these specific tumors. So hindi lang po ito, hindi tayo nakakahon sa factors na ito na this is the only factors that can trigger the formation of tumors. As of now, scientists all over the world are still searching for more and more factors na pwedeng mag-contribute to the formation of your tumors. Now we go to the classification of tumors. So again, like what I've said, we have benign or the non-cancerous type, and then we have the malignant or the cancerous type. So skin tumors in dogs and cats broadly classified into this particular classification. Pag sinabi nating benign tumor, they typically grow more gradually and slow. So also they do not have, some of the benign tumor do not cause symptoms at all. So they do not cause pain or anything or even annoyance to the animal. So they become very large and develop in particular time, which can then affects the lives of this animal, especially if the growth of these particular tumors are located in areas which are sensitive or sensitive body parts, such as in the nervous system, for example. So in the brain or other parts which can cause annoyance na dun sa animal. So in this case, in my case, the patient that we handled has a tumor in the head, particularly on the median canthus of the eye, which is usually annoyance talaga sa kanya. But if the benign tumor usually located at the back of the animal, at the neck of the animal, which do not affect naman the daily routine of this particular animal, then usually surgical resection is not usually advised. Then we have the malignant or the cancerous type, usually grow rapidly and can spread to the different tissues or body parts of these particular animals. So such as lymphatic system or in the blood, so they can shed this particular malignant cells into this particular system. Even in the bone marrows, malignant tumors can spread. This part of the process is known as metastasis. So this is just a review for those who are not more familiar with metastasis and the formation of malignant tumors. These typical cancerous cells can break through from tissue to tissue, and they can invade also normal or healthy tissues. That's how they are very progressive. So, what are the difference between the two types of these particular tumors? As we dig deep on this, we know that benign tumors and their characteristics are the following. Benign tumor cells tend not to spread, and most benign tumor cells grow slowly. It does not invade close tissues. It doesn't spread to other body parts. They tend to have clear boundaries. So usually, ang makikita ninyo, ang best described for benign tumors, they are round, and if you are going to palpate them, makukuha mo sila on your hand. They do not have asymmetrical or ununiform structure. They are usually round with have uniform and exact proportion from left to right. So does not secrete hormones or other substances except for this particular one, pheochromocytoma of the adrenal gland. And these particular tumors may not require treatment if it is not sabi ko nga, if it does not cause annoyance to the animal at all. Kasi the more na pinakalaman natin yung tumor, it can, number one, subject the animal into anesthesia. So, pwedeng may chemical intervention na naman. At the same time, post-operative care is very maselan pagdating sa mga case na ganito. Now we have the malignant or the cancerous type. So malignant tumors and their characteristic are followed. Cancerous tumor cells can spread to tissues. Sabi ko nga, even healthy tissues, they can spread. Kaya even in surgeries, we should be very, very careful handling malignant neoplasia in surgeries because we might, the term is seeding, we might do seeding to other healthy tissues which will then become malignant or neoplastic. So usually, they overgrow. It often invades surrounding healthy tissues, like what I've said. It can spread through the lymph nodes or the bloodstream. That's why they are very dangerous and progressive. So the more that you severe the areas, pwedeng dun kasi dahil lymphatic systems and blood systems are organized system. So once this particular malignant cell ay napunta dun sa area na yon, it can spread throughout the body. That is why, makikita niyo sa malignant type, when we do surgeries of neoplastic, we usually check na other organs. So when we take out malignant cells or tissues like this, dapat yung progress ng pag-check ninyo in different organs is there. Lalo na sa lungs, para makita natin or ma-identify natin if this particular tumors nag-metastasize na. Then, it can secrete substances that cause fatigue and weight loss. Tumor may recur after surgical removal, sometimes in areas other than the first site. Ito na yung sinasabi natin, nagkakaroon ng seeding. Diagnosing cancerous tumors may require strong treatment, including surgery, radiation, chemotherapy, and immunotherapy as a treatment plan for this. So what are the different types of skin tumors which affects dogs? So just to give you a brief of these particular cells, I put it in here. This is also for the information of those in the public. So mouse cell tumors, these are most common skin tumors in skin of dog. They can appear as nodules, bumps, or flakes, and vary wildly in appearance. So, ibig sabihin to, kung titignan ninyo, yung palang any abnormalities in the skin of my dog might be considered as mast cell tumors because a little bump on the skin, a little nodules, a little plaques can be considered as mast cell tumors, or it can be a differential diagnosis for these particular areas. So some are benign, with others are malignant and require aggressive treatment. So lipomas, ano naman ang Doc, may malaki pong lump yung dog ko sa head or sa neck po niya, pero malambot po, para siyang squeezy. So this is lipomas. So there are fatty tumors, usually benign and often found under the skin. So when we have lipomas, Doc, kailangan po ba yan tanggalin? Yes, kailangan tanggalin yan kung it will affect the operation of your animal. If it is not, okay lang na nandyan siya. So histocytomas, these are typically benign tumors that are spontaneously regress or disappears on their own. They are usually found in young dogs. And lastly, we have papillomas. These are wart-like growth caused by a certain virus, and they are generally benign. So how does this look like? Ito sila. So these are the differentiation when it comes to gross morphological appearance of these particular tumors. So as you can see, like for example, in papillomas, so makakita ka ng case na ganyan, you can still consider this as a benign case. So usually, sabi nga niya kanina, it is caused by a viral disease. So pag sinabi natin viral disease, automatic, pwede siyang makahawa to other dogs. So you need to quarantine agad or to isolate this particular patient of yours para mag-treat dito sa particular na case. So these particular tumors are under the benign, but the muscle tumors can be either benign or malignant. So it depends on makikita natin with your biopsy or with your histopathology. Kaya pag nakakita kayo ng muscle tumors na ganyan, you should always consider doing biopsy because it might be a malignant tumor. So malignant tumors, we have malignant melanoma. So malignant melanoma is the serious type of skin cancer that can be aggressive and spread quickly. They are often dark in color because melanoma is the black pigment. So in this case, this gives us a quick view na pwede, dahil ang pigment naman kasi it is produced by the body, so ibig sabihin progressive yung kanyang growth. Squamous cell carcinoma, which is very common, especially in cat. So this cancer arises from the skin squamous cell. It's more common in dogs with light colored skin and those which spend a lot of time outdoors. So isa yan sa pwede nating i-consider as differential diagnosis, especially for dogs which are in the farms or dogs that are usually outside of the house every time. So yung mga dogs na usually katulong ng mga farmers, for example, in the farms. So pag nagkaroon sila ng ganyan, you can also consider this as your differential diagnosis and then check for it. And then fibrosarcoma, which is a type of cancer, arises from the connective tissue. So all of these particular tumors, Doc, saan po natin nakikita yan? Or what dogs are, breeds of dogs are usually succumb to this disease? Saan po natin yan? May Shih Tzu ba yan? Makikita ba yan? So these are the particular breed which are predisposed to this particular formation of tumors. We have poodles and cocker spaniels. So other breeds with increased occurrence include the caribou terriers. We have your Siberian Huskies, Shetland Sheepdogs, Bichon, Police, Bedlington Terriers, Kakapus, and also the Boxers. So they are usually the one suffers from tumors. Although these particular tumors are present in this breed, it doesn't really mean that those other breeds are not usually become a victim of this. So they can be, especially those mixed breeds, they can also be succumb to this particular. However, as I read some report, more research is needed still in the definite establishment of what is the most predisposed breed for this particular case. So ang sinasabi lang, most predisposed for at this time, the research is the poodles and the cocker spaniels. So the case is trichoblastoma. So what is trichoblastoma? So originally this is described by Headington, which is a benign tumor resembling to embryonic hair. So despite the variations in terminologies, it is characterized by the proliferation of basaloid cells in the dermis, and often usually forming hair-like structures. And in histological variant exists, the clinical behavior is similar, which is leading to suggested term as benign trichogenic tumor. So what does this nodule look like? So diba, this usually looks like a 1 to 5 centimeter round with firm circumscribed appearance with which usually show follicular differentiation also in histopath. So what are the stages in the development of this trichoblastoma? There are 3 distinct variants or stages in the development of tumors which were originally recognized. Number 1, we have trichogenic trichoblastoma. Next, we have trichoblastic trichoblastoma and the trichoblastic fibroma. So depending on the relative proportion and the maturity of the epithelium versus the stroma. All right, now we go to the case. My case is a case of an 11-year-old female spayed Shih Tzu presented with a slowly growing firm nodular mass on the upper right of the median canthus. So the mass has been present for approximately 6 months and showed no signs of ulceration or discharge. Fine needle aspiration yielded scant cellular material which was non-diagnostic, and surgical excision was performed, and histopathological examination revealed trichoblastoma. This is to inform that the case that we are handling right now, or that the case that we had handled, is a case that has been through other clinics already. We are the 6th clinical veterinary hospital to handle the case. So this is to inform that there are also other treatment that is also given to the animal prior to our treatment plan. All right, so this is the patient. So we have the presence of the mass on the medial canthus of the eye, and then we have a dry, cloudy appearance of the left eye because this particular tumor usually cause mechanical trauma to the eye. Kaya nagkakaroon na rin tayo ng irritations of the eye, which might include the dryness and cloudiness of the eye. So the patient is Mochi. So this is for patient signalment. A female, Canine, 11 years old, weighing 3.4 kilogram. The presenting sign is the patient is bright, alert, and responsive. Mass is approximately 3.5 centimeter in diameter. There is no significant mass that was palpated apart from this one. And medical history, no significant condition or surgical intervention given prior, but medicine is given. Resection of the tumor was delayed for almost a year due to clients' hesitance. So also, there are other clinics that suggest that we need to wait until such time they have decided to bring it to the vet hospital for the finality of the verdict for the tumor. So for the differential diagnosis, for this particular trichoblastoma, we have the squamous cell carcinoma, which occurs in the outermost part of the epidermis. So yung squamous cell carcinoma na yan, pag nakakita ka ng tumor, usually, as veterinarians, we usually consider squamous cell carcinoma and the basal cell carcinoma. So the basal cell carcinoma originates in hair follicle also, which make it a good differential diagnosis. Why do we usually consider basal cell carcinoma? Actually, pag nakakita tayo ng tumor na ganyan, we always look that, baka basal cell carcinoma to. Why? Because if it is a basal cell carcinoma, you need to check. Because it is a malignant tumor. So just to pop you up na, kailangan ko talagang mag-test because baka basal cell carcinoma. We do not want to think na trichoblastoma agad yung case. Because baka mamaya, it is a basal cell carcinoma, which is a malignant case, nagkaroon tayo ng wrong diagnosis. So trichoblastoma is derived from trichoblastic epithelium, which is the primitive hair germ. Trichoblastoma is most commonly found in older dogs compared to younger dogs. So kung titingnan ninyo, pag may old dogs na may ganyan, usually, ano talaga siya. The patient is old also, falling into geriatric stage. Trichoblastoma can be histologically classified into severely types including ribbon, trabecular, granular cell, and spindle cell. So tests that has been performed, we do CBC, hematology, which have the result that indicated that all the parameters for blood is normal, hence the patient is fit for surgical intervention. We also perform fluorescent eye stain and ophthalmoscopy. So we have deep corneal ulceration that is found in the eye. Partial to complete blindness of the left eye, right eye is normal. So this is some of the complications that we have. This is sabi ko na our case is usually a tumor lang. It's a benign tumor, but some complication arises from it. So like for example, the position of these particular tumors can contribute to other cases. Like for example, in this case, nagkaroon na siya ng ulceration of the eye because of the particular site na kung nasaan siya. So nagkakaroon ng mechanical trauma doon sa area until such time, of course, it's dog, they need to scratch it out. Or in some cases, nagkakaroon ng pagtama yung bukol mismo doon sa mata niya, kaya nagkakaroon tayo ng problem with the eye. So the treatment for this particular tumor is lumpectomy. Lumpectomy is performed as the final verdict for the surgery of this case. So treatment, ellipsoidal shape of incision was done during the resection of the tumor to allow easier closure, of course. If we do the round type of incision, medyo mahirap siyang isara. So you need to do ellipsoidal type. Also in this case, ang isang challenge pa for this is that you cannot do a big ellipsoidal cut because it's in the medial canthus. So apparently the challenge is there with you cannot take out much of the skin because baka magkaroon siya ng problem with the apposition of the skin. So blunt dissection of underlying tissue was done to preserve blood vessels. So undermining is done. And the challenges that we have is to reduce the tension of the skin edges and reduce wound dehiscence. So how are we going to manage this to reduce tension on the skin edges? So sabi ko nga, we do ellipsoidal shape incision, but make sure that you measure the length of this particular incision that in sense, kaya pa rin magkaroon ng apposition. So in some cases, pag hindi talaga kayang mag-ano yan, you can do other techniques like for example, combination of your suture patterns and the likes. But in this case, we managed to do the closure of the skin. Reduce wound dehiscence. How are we going to reduce wound dehiscence? Of course, client advice, education to use Elizabethan colors, proper disinfection of antiseptic used for this particular type of tumors kasi irritant nga yan. So pwedeng magkaroon ng irritation din sa mata. So they should be the one to be educated on how to clean it every time. All right. So with the complication of the tumors in the eye, we do temporary tarsorrhapy. So nagkaroon ng temporary tarsorrhapy para lang ma-close muna at ma-rest yung mata, trying to salvage because the owner doesn't want it to be removed pa. So as much as possible, sabi niya, we need to retain the eye. So we do what is advised by the client. So we pursue with the temporary tarsorrhapy. Treatment plan is given. Take-home medicine is also given, and we advise them to give it on a certain time na dapat siya ibigay. Kasi ang problema natin din with post-operative care with this surgical patient is client compliance. So this is out of our control. The client compliance is usually the problem. Kaya nagkakaroon tayo ng na-aggravate yung ating plan. So in this case, this is what happened in the post-surgical complication. So the post-surgical complication that we have encountered is this because the client doesn't want to clean the wound. They just apply the wound cream. So nagkakaroon tayo dahil meron nag-exudes pa rin naman yung mga body fluids in there. So there is no cleaning happening. Kaya nagkakaroon ng natatakot daw sila baka mas lalong lumaki. So they are usually advised to clean this twice a day para malinis na malinis because this is near the brain. So which make it also a very sensitive case. So with all of the advices that we give, usually they just give oral medicines and the cream. Kaya we have this type of problem. All right, presenting signs and medical history after they bring back the dog. So extremely dirty wound with plenty of scabs and dried exudates is seen or was seen in the animal. Ophthalmoscopy is also done, and this time there is blindness of the left eye. So in ophthalmoscopy, there was retinal thinning. There is also loss of photoreceptor cells and pigment changes in the fundus. The tapetum appeared dull and had areas of discolorations, and optic disc appeared to be pale. So the impression is progressive retinal atrophy or atopy. Post-surgical treatment that we do is surgical debridement and cleaning of the wound. Kaya sabi ko, pag nagkaroon po tayong problem, pag post-surgical yan, usually we advise, mas mahirap pa ang post-surgical treatment ng ganito kaysa yung mag-surgery po tayo. So tatagal yung treatment natin na ganito. Instead, if you abide with the advice, mas mabilis po yan nagagaling. But since nandito na tayo sa case na to, so this also gives us, all veterinarians, the insight of letting ourselves emerge with their experiences. So paano nga kung di namin talaga kaya, anong gagawin namin? So we need to understand also their part. So in this case, baka mayroon lang tayong mas meaningful or mas madaling suggestion or way para sa kanila. So let's give them the best option possible for this type of case. So the best option is the one that they can do by themselves. Okay? So take-home medicines is also continued. Ophthalmic drops is given. Wound cream is also given as a topical treatment. The challenges that complication arouse from post-operation and client compliance. Although apologetic naman ang client natin when it comes to this. So they admit that they have lapses on their part. So recommendation is follow-up check-up after 1 to 2 weeks to ensure client compliance and check if the patient wound is healed properly. Kung kaya ni client na mas madalas pa ang pag-visit with this, then better. So kayo naman as veterinarian, we just take a look at it naman. We do not usually charge pa naman them. So follow-up check-up, this is our patient now. The left eye is still dry. Ulceration is evident in the left eye. Wound from lumpectomy is healing well during that time. Deep corneal ulceration is still present, but that's why the medication is still given during that time. Treatment of ophthalmic ointment. The left eye will be left to atrophy over time because the owner doesn't want it to be removed by globe enucleation. So the finding on surgical site, there is reduction in the wound site, reduction in the redness and inflammation. So kung makikita niyo, ay, Doc, bakit meron pa rin there's still, this is 2 weeks after the post-operative clearance. So right now, as I finish my PowerPoint presentation, kinusta ko yung patient, there's no even scar seen right now in this patient. So let's go now to his pathological result. So the trichoblastoma is a well-circumscribed, predominantly dermal tumor nodule which may extend to subcutis. So predominantly basaloid epithelial cells in nest with peripheral palisading, keratin cyst, which may contain dendritic melanocyte and appear to be pigmented. So we encourage our owner or the owner to do histopathology, although we know that it can go, or it is usually a case of a benign tumor. So we still offer them histopathology for us to have a clearer view of the case. Baka mamaya may ma-miss out kami. So there is mitosis and apoptosis which can evident, but cellular pleomorphism is minimal. Prominent cellular stromal component with papillary mesenchymal body formation. Clefting occurs also. And this may show cribriform, rippled solid patterns. So the finding indicative of this particular case is trichoblastoma intermediate grade. So we submit the sample into diagnostic laboratories which can perform histopathology for us, and this is what their findings, which is coincide with our gross morphological description. So for the prognosis, trichoblastoma has a favorable prognosis with a low incidence of recurrence. So ibig sabihin, when you remove the tumor, usually most of the cases resolved na siya. There's no recurrence at all. Progression is also zero. And association with malignancy is very, very low. So outcome, complete resolution of the mass with no recurrence at 6 months follow-up. So this is a complete case for us that we resolve. So for clinical significance, so this case highlights the importance of considering trichoblastoma in the differential diagnosis of cutaneous masses in dogs, particularly those with slow growth rate and benign clinical appearance. So while the use of fine needle aspiration may be non-diagnostic, surgical excision provides definitive diagnosis and treatment. So the star for this is cytology, biopsy, and histopathology in identifying this particular tumor and identifying whether they are malignant or benign. That is the only way to identify that. Further studies are needed to determine the prevalence and risk factor for trichoblastoma in dogs. All right. Thank you so much for listening to my presentation this morning.
Thank you so much, Doc Ems, for
Thank
that
you, Doc.
wonderful and very informative presentation about this section of complications of trichoblastoma in an 11-year-old female spayed Shih Tzu. Okay, you guys here in Penglai, you can ask questions directly, and also those who are in Zoom modality, you can also ask questions. Is there anyone here po na may tanong? Ako na lang muna, Doc. So, Doc, yung first question ko is about the price range. Kasi your case report is actually complete. From top to bottom, from the surgical intervention, from the diagnosis part, then also the surgical part, and up to the histopath. So, price range, kung magkano halos yung nagastos ni client, dun sa whole, kahit range lang. Yeah.
You will be surprised with the price range that we have. In the full treatment of this animal, we only charge them 14,000.
Full workup. That's for a full workup already, Doc?
Yes po.
Wow.
Why? Because we are a veterinary teaching hospital. So we usually take the chances of our student to observe the case, to handle the case, to do intervention for this case with the veterinarian. So yun siguro yung mas singil namin dun sa case. Because not all the time we have this type of case. So, lalo na, students are very excited when meron tayong case na tumors, meron tayong case na lumpectomies. So, they are very excited to know that. So, if in the veterinary teaching hospital, I usually ask them to, this is the findings, the CBC, this is the blood chemistry, what is the next step? What is your treatment plan? So, nakagroup po sila. So, you provide me the best treatment plan. And then you report. And then, after that, we usually convene what is our lapses with the treatment plan. We talk about that every time. Kasi hindi naman pwede na we perfected the whole treatment plan. So, sabi ko nga, meron tayong complications with the surgery. So, meron tayong part na naglapse. Ito nga, isasabi ko yung, baka we do not give the best option for the owner to treat the particular post-operative care. Or baka we just lean on the kaya nyo na yan mentality na kayo na po ang mag-treat niyan. Nasa inyo naman, aso nyo naman yan eh. Mas ano po kayo dyan. Although, ganun din kasi sila na dahil mahal na mahal nila yung aso nila, they don't want to, yung konting iyak lang ng aso nila, ay, umiiyak po kasi siya eh. Kaya nilalagay na lang po namin. So, yun yung isa sa mga tinitignan namin po na naging challenges din po dito sa case natin. With the price range that we have, I think yun po yung nasingil namin sa kanila.
Wow. Thanks for that information, Doc M. So, next question. In your presentation of treatment, you use stem cell solution therapy. As we know, stem cell therapy is more focused on promoting tissue regeneration and repair, which is not the primary need for benign tumors. What is your reason for using stem cells in your line of treatment, Doc?
The stem cell is used in the ulcer of the eye. It's not used in the tumor per se. So we know that this particular stem cell is very beneficial in eye ulcerations. So because kailangan natin mag-regenerate ng cells doon, we do not want to just give antibiotics and do nothing. So kung meron kaming available option to give, which is the stem cell, so we usually give the stem cell. And actually, kung minsan, may mga client tayo na, Doc, hindi namin kaya ng stem cell. So we can do half. We can harvest the blood, we can do serum, autoimmune serum with combination of the stem cell. So half of the price.
Okay. Doc, can you give us a glimpse about mutation causing cancer in dogs?
All right. Mutation in causing cancer in dogs is not different from other animals. So sabi ko kanina, with the genetic mutations that we have, nag-alter kasi the genetic makeup of the animal. So how are you going to alter the genetic makeup if the animal is subjected to a factor na kung saan it can disintegrate the DNA or it can cause changes in the DNA. Like for example, high beam radio still imaging, RADS. So, pag madalas na nararad yung animal or still imaging usually done in animals, even healthy animals can be succumb to the particular genetic mutation. Aside from that, other mutations can be caused by chemicals in the food na we give to our animals. It can be from the soil, it can be from the water. Kasi as of now, highly industrialized, especially in urban areas, we are highly industrialized. So these chemicals are, even though in small amounts, they can be accumulated into some parts of our body, even in dogs and cats. Especially those with impaired liver, for example, with impaired kidneys. This small amount of chemical can cause a big impact to their health. So anong pwedeng mangyari yan? Ito nga, it can cause genetic mutation. And if there's genetic mutation, it can lead to proliferation of pwedeng cancer cells or cells which can cause damage to the other healthy cells.
Okay. Doc, clarification. Trichoblastoma was diagnosed in the end or later ba? Don't you think that the prior treatment aggravated the tumor?
I don't think so because what actually ang ask ni client is to remove the tumor, which is asked to other hospitals na pinagpuntahan nila. So what we do is to just remove the tumor para maging okay yung animal. And the question is, does the identification of the tumors done prior to surgery, after surgery? It's after surgery. Because we submitted the sample and they perform histopath. Although, sabi ko nga, we have an idea that this is a benign tumor. So we do not give ourselves the benefit of the doubt na baka benign tumor lang ito. We want it to be subjected to histopath because sabi ko nga, biopsy and histopathology is the only way for you to determine whether if it is a malignant or a benign tumor. We do not want that in the process of treating the animal, tinitreat mo siya as benign, malignant pala siya. So after a month, babalik si client, nag-surgery po kayo tapos naging ganito na po. Na-miss natin yon. So we do not want that thing to happen.
Doc, saan po pwedeng mag-send ng specimen for histopath and included na po ba yun sa 14,000 na overall cost na binayaran ni owner?
Sa case po niya, yes, it's included. Saan magsisend? Madami po tayong laboratories na pwedeng pag-sendan. I do not want to name names. I do not want to promote them. Pero there are many reputable laboratories na pwede po nating pag-sendan. Even in University of the Philippines, Manila, we can send samples there and the OST.
Okay. Doc, what's your take on this? Stem cell is not advisable to suspected neoplastic patient. Agree or disagree?
Yes. It should not be given to suspected neoplastic patient because sabi ko nga, paano pag ito pala ay malignant and then you give the stem cell. So we do not give chance to that particular cell to reproduce. So as much as possible, we do not use the stem cell, or actually it's not actually stem cell in the sense we just call it stem cell pero regenerative serum lang naman talaga siya.
Doc, did you do staging since you were suspecting a tumor?
Yes, we do. With my class, we do staging and actually we plan for it to do staging muna prior to that particular surgery.
Okay. Doc, how old was the patient when she got spayed?
We do not have the record because it's not a first-hand patient.
Doc, follow-up question. What was the stage if you did the staging?
It's written in the manuscript, but we do not I do not have the first-hand on the stage.
Okay. Any questions po from Penglai? I'll ask first Doc Reina and then si Doc.
Ay po, Doc. Di ka
Ay,
nagtanong
Doc.
sa akin kanina, pero magtatanong
Yes,
ako.
Doc.
So what are your thoughts regarding the laser therapy with your cases? So I saw that what are your thoughts using laser therapy as the after treatment or after the surgery? So
my thoughts on laser treatment is very, very good. It's just that it so happened that we do not have it in the hospital. That's why I envy people or veterinarians here with laser. And the laser therapy is very, according to journals also, laser therapy is very beneficial to surgical patient. So this will lessen the inflammation, lessen the treatment time, and it gives a big impact on the surgical patient. Kaya if we have the chance to have the laser in the hospital, so we might probably use it also in this type of patient. Or in the near future, if we do have the laser, then we can have it in.
Doc M, my question
Yes,
is,
ma'am.
this might be outside of the trichoblastoma. The case is TVT or transmissible venereal tumor. Do you recommend surgery?
In case of TBT, again, like what we said, TBT can be treated by surgery. Only if the animal is very, very annoyed. Yun yung ano namin eh. Kaya niya pa bang i-bear yung tumors that we have? If it is not, then we need to remove. But if it is a single, for example, small type of tumor, which can be addressed by chemotherapy, then the option is, we can also give the option for chemotherapy to the owner. But still, the owner should decide whether to do surgery or whether to do chemotherapy. And of course, we need to prepare the animal prior to if the surgery would be chosen as an option. Yes, Doc.
Doc, what are your insights po dun sa tumor marker testing na available nowadays?
All right. So with regards to tumor markers, di ba sabi ko kanina, the gold standard for the identification of your tumor as malignant or benign is histopathology. But there are now new technologies like, for example, identification of tumors by tumor markers, particularly in case of tumor necrosis factor, for example, which might increase when there is tumors. So this might be a good help also in the preliminary stage of getting to know if this is a malignant or a benign tumor. So this can be a helpful tool for veterinarians to assess the case further. Also kasi it will also be proved to linkages eh. Kung may mga link ba yan when it comes to because if you collect, for example, body fluids or bloods or and the likes, pag tumataas yung kanyang tumor necrosis factor, so might probably there is an ongoing problem with neoplasia.
Hi, Doc. Good morning.
Yes, Doc. Good morning.
Yes. Whenever we see a mass, ang unang iniisip natin agad is this could be possible, nag-mets na to sa other parts ng katawan. So, do you have any protocol in the teaching hospital on how do you diagnose yung or stage or ano yung mga test na ginagawa natin? Kasi for example, in our clinic, anumang bukol, matik dapat may thoracic x-ray. So parang matik siya doon. I don't know if I just miss it sa lecture, but is it part ng protocol nyo na whenever we see a tumor, regardless where it is, you always check for thoracic x-ray for possibility ng METs? Kasi that could give us the first indication na yes, possible, baka malignant itong tinitignan natin. And what's the point of removing at mass if it's already in the lungs? So any comment about that?
Yes, Doc. We do have protocols of still imaging, sabi ko. We do still image of these particular tumors. At the same time, we ask, part of the RADS is asking the client if they are willing to subject first the sample for fine needle aspirate or fine needle biopsy. So usually we collect samples via fine needle aspiration and then we send it also to the lab. So para makita namin kung meron na ba siyang nagde-develop na ano. And then after the removal, kapag wala pa rin yung result, then we give part of the tumor to the diagnostic laboratory. And yes, we do perform X-ray po, Doc, for that.
Okay. Doc, as you mentioned na may factor yung mga procedures to alleviate genetic mutation. What's your insights, Doc, in using laser therapy in skin incisions as a part of post-op and using laser therapy in some skin cyst? Doc, I remember nasagot mo na siya, pero may follow-up pa. I heard kasi that laser may be contraindicated for neoplastic patients due to neovascularization, which contributes to healing, actually, but might also feed neoplastic tissue left behind. So what are your thoughts?
All right. So this is a very great venue for us to learn. Sabi ko nga, when it comes to laser therapy, nahuhuli kami because we do not have the machine. Because although we are excited to have this particular instrument sana in the hospital, we still do not have it. So, dun sa question na, okay ba siyang gamitin pag with regards to inflammation, siguro yes, this will lessen the inflammation. Kung meron namang natirang cancer cell doon, whether you use laser or not, magpropagate pa rin naman yun eh. Okay? So, kung magkakaroon siya ng complication by surgeries, if there are malignant tumors that are still in there, so with the use of laser or without the use of laser, it will progress. So, ang mahalaga during the after surgery, we use the laser to minimize the inflammation, minimize the time of healing, because what we want is to give a better days to these particular animals. Diba yung kaya nga animal welfare because we want the welfare of the animal to be first hand. Hindi naman kung talagang nag-produce yung kanyang malignant tumors bumalik, then that's another story to tell. So we might probably give other option to the owner. So sa amin kasi I believe that one step at a time, we treat our patient one step at a time on a given time. So kasi if you are looking for, baka mamaya malignant to, hindi naman pala. Nag-overthink tayo. So what we want is to heal our patient at that certain time, and if there would be complications sa mga susunod na pages ng kanyang buhay, then we will address that as a strong veterinarian.
Hello.
Hi, Doc.
Doc. So maybe this is the last question.
Yes,
And in
please.
regards to doing surgeries for older or for geriatric patients, so we all know that not all veterinarians are parang confident, to do those surgeries. So how do you encourage na lang maybe for younger vets especially? Kasi we've noticed in our practice, we have a lot of parang referral cases. So they don't do the surgeries because of the fear na yun baka hindi nga kakayanin ng patient because they're too old na. So we have cases like 13, 14-year-old. So insights na lang po siguro.
Yes, Doc. Thank you so much for that. My insight for that, sabi ko nga, the patient has been from one clinic to other clinic hanggang mapunta sa amin. Why? Because another problem is the age of the animal. So why did we accept the case? Matanda na yan, geriatric na yan. Because we are confident to do the surgery, that's all. So, paano natin ma-address to sa young generation? Equip yourself to become a better individual, to become a better veterinarian. So, immerse yourself every time to learning. So, we learn by doing things that are uncomfortable. We learn by doing things that are very challenging. Kasi if you are not challenged by some sort, you will not gain any rewards at the end. So my advice is, learn more and dig deep on your skills. Kasi ang surgery sabi ko nga sa mga student ko, I'm teaching surgery. Ang surgery, hindi yan natututunan ng isang araw, ng isang gabi. You need to hone your skills in surgery. Kahit nga yung pinakamatandang surgeon, usually nagkakamali pa rin. So, ikaw, kung hindi mo i-dig deep yung sarili mo to become a better surgeon, you will not learn. So, ang inaano kasi natin doon is yung confidence din ng mga younger veterinarians. So, how can you have that confidence? Learn yourself to do the surgery. So, yun lang naman po.
Thank you so much, Doc Ems.
Thank you po.
All right, so are you all ready for the third speaker? Okay, actually, with the presentation of Doc Ems, it's also empowering to know that it's also noble to say, I don't know yet, Doc. Hindi ko pa po alam. Because yung learning, it should not be like, I know everything, I'm a diplomate, I'm ganyan. So it's not like that. Because we learn from others as well. And just like in our everyday lives, di ba? Kapag nagjo-duty tayo sa ating mga clinics, minsan nagtatanong din tayo. Sino dito nagtatanong? Sa mga colleagues. Okay, Doc Randy, yan ang gagawin ko dito. So, saan ako mag-e-ensayo? So, something like that, di ba? And always make sure na equip tayo dun sa perseverance to learn. May knowledge, nandyan lang yan eh. It's in the webinars, in the trainings, in CPD points like yung mga katulad nito. But the thing na important din talaga is meron kang eagerness na matuto. No? So our next speaker has earned her Doctor of Veterinary Medicine degree from Benguet State University's College of Veterinary Medicine in 2018. That same year, she successfully passed the Philippine Veterinary Licensure Examination. After relocating from Baguio to Metro Manila, she began her professional journey as a resident veterinarian at Marikina Veterinary Hospital. Over the years, she has demonstrated a commitment to continuous professional development by attending both local and international training sessions and seminars. Her areas of interest include soft tissue surgeries. Currently, our speaker serves as a senior veterinarian and veterinary practice manager at Marikina Veterinary Hospital. In addition to her clinical responsibilities, she has recently achieved diplomate status with the Philippine College of Veterinary Surgeons Companion Animal, reflecting her advanced expertise and dedication to the field. Her studies about clinical management of insulin-dependent diabetes mellitus, or IDDM, in a 6-year-old male dachshund. Without further ado, let us give a round of applause to Dr. Sayeda Aisha Hussein.
Good morning po. Last topic na po before mag-lunch, so bear with me na lang. Okay, so good morning dear doctors. Thank you for your time for today's lecture. And I hope that you would stay until tomorrow kasi maraming interesting topics yung mga colleagues po natin. So I'll be discussing a case with clinical management of insulin-dependent diabetes mellitus in a 6-year-old male dachshund. Okay, so I'd like to start by briefly explaining the condition itself. So diabetes mellitus is a common endocrine disease commonly affecting middle-aged and older dogs ranging from 5 to 15 years old with the characteristic of impairment in glucose utilization or loss or dysfunction of insulin secretion by pancreatic beta cells, commonly caused by pancreatitis, exocrine pancreatic insufficiency, obesity, hypothyroidism, and kidney disease. Risk factors for developing diabetes mellitus for dogs includes the following. So we have genetic breed predisposition. So here are the mga common breeds that are affected. We have Dachshunds, Doberman Pinscher, German Shepherd, Golden Retrievers, Labrador Retrievers, Toy Poodles, and Terriers. So for the sex and neuter status naman, most commonly affected are the castrated male dogs and intact female dogs. And insulin resistance is also caused by the obesity of the patient. And according sa WASAVA, patients with a body condition score of 7 to 9/9 is already considered as obese. And we have 4 classical signs for diabetes mellitus. These are polydipsia, polyuria, polyphagia, and weight loss. Okay, so there are 2 types of diabetes mellitus in dogs. We have type 1 and type 2. Type 1 diabetes mellitus is an insulin-dependent or juvenile onset diabetes mellitus. So common characteristic is absence of insulin. So the pancreas is unable to produce sufficient insulin amount in the body, and it is more commonly observed in young patients, while type 2 diabetes is also known as non-insulin dependent or adult onset diabetes mellitus. So it is commonly affected by the lifestyle of the patient, and it is characterized by decreased insulin, and usually mas common po si type 1 diabetes than type 2. And then the age naman, more commonly affected ang mga adults. The objective of the case is to describe the clinical presentation and diagnostic process of insulin-dependent diabetes mellitus or IDDM in a 6-year-old male dachshund, and to outline the management strategies and treatment protocols implemented in the case of IDDM in the subject based on the available resources in the Philippines. Okay. This case involves Loki. So as we can see here, si Loki, hindi siya yung normal po na dachshund na nakikita natin. Loki is a very chubby patient. So, Loki is a canine castrated male dachshund with a body condition score of 9/9. During the time of our initial consultation, Loki was only 5 years old. So, during the physical exam, we have multiple patchy areas of hair loss, muscle weakness, difficulty in walking. So, madaming pwedeng cause yung difficulty in walking niya during this time. Number 1, kasi sobrang taba po niya. Yung katawan niya, hindi nahihirapan na siyang itapak, yung mga legs niya. Then, imagine natin, sumasayad na yung ventral part ng mula thoracic hanggang lahat, hanggang sa may abdominal area. And then, other signs were vomiting and cloudy eyes. So, on initial consultation, this was May 1, 2021, the chief complaint was persistent alopecia with an unknown duration. Matagal na daw po na merong areas of the skin niya na laging nakakalbo. Tutubo yung hair, then makakalbo ulit. Ganun lang. Pero hindi nagiging fully grown yung mga hair dun sa areas na yon. And during this time, body condition score was 8/9, and the weight of the patient is 17 kilos. Initial diagnostic tests were performed, like skin test, but the results were unremarkable. And at this point, the owner requested for an allergy test since possible na baka meron siya napapakain kay patient nagkakos ng alopecia. So during this time, while waiting for the result of the allergy test, management includes prescription of hypoallergenic diet and prescription of medicated shampoo. Okay, so in follow-up consultation, there were no progression or improvement of the hair loss, and there were no additional findings, and the result of the blood parasite test was negative, and the serum biochemistry results showed elevated serum lipase. So at this point, ito lang po muna yung lab tests that were performed. This is the result of the, This is the result po of the allergy test, and no noted allergen was observed related to the sign of the patient. Okay. So the patient was lost to follow-up. And after 2 years, yun na yung naging follow-up consultation niya. The chief complaint was vomiting, was muscle weakness, and difficulty in walking. Before po dumating si patient, galing na siya sa ibang clinic due to the same concern and was only given antiemetic. And for the review of systems, the patient had an increase in appetite, and during this time, the patient's body weight was already 24 kilos. So from 17, 2 years ago, this point po, naging 24 kilos na siya. Sobrang takaw daw po niya, sabi ni owner. Pero nagtataka po sila kasi bakit matakaw na siya, pero bakit nanghina pa rin. So the owner was thinking, possible po ba na nasobrahan ng pagkain, kaya nagsusuka na siya ngayon. So given then for the difficulty in walking, kasi mas mabigat na siya. And the body condition score was already 9/9. So at this point, based on the clinical signs and on the history of the patient, we have to consider diabetes mellitus, and the diagnostic performed were urinalysis, thyroid function test, radiograph, CBC, complete serum biochemistry, and fasting blood sugar. Okay. So for the other diagnostics, the results were unremarkable except for the urinalysis, which we can see there was a presence of glucose, and the thyroid function test at this point were all unremarkable. So this is the fasting blood sugar of the patient. The green line represents the upper limit, while the orange line represents the lower limit of the glucose level of the patient. So during the time of the initial checkup, hindi fasted po si patient. So we have to confirm by doing fasting blood sugar. We followed po the 8 hours fasting. So the client declined for confinement. Dinadala niya na lang po everyday si patient for testing. So we have July 25, July 26, and July 27. And the blue line represents the result of the patient. It was way beyond the normal values. And at this point, because then of the given signs of the patient, alarming na po yung case niya. So we have to, at this point, we're already considering chronic type 1 diabetes or IDDM. And there are few treatments or approach in this disease. So in the medical treatments, we have insulin therapy, dietary management, blood glucose monitoring, and oral medications. For the oral medication, there is no known literature na gumagamit ng oral treatment for dogs, but if available, it is only used in patients with type 2 DM. So wala po siya for type 1. And then sa lifestyle and supportive care, we have exercise, weight management, and hydration. And for sa holistic and complementary approach, there are a lot of other approach, but we have to consider then that during this time, pandemic po yun. So kung ano lang yung available natin na easily accessible both for the clinic and for the client, yun po yung ginamit natin sa kanya. Yan po. So we have acupuncture, herbal med, supplements, homeopathy, aromatherapy, co-therapy, and dietary additives. Okay. Sige. So the goals of the management, we have 5. Number 1 is to maintain appropriate blood glucose level. So in maintaining blood glucose level, it is important that we have to monitor ng maayos. So how? We have to establish yung number 3, doctor-client partnership. It is very important since yung goal natin is to control the diabetes and prolong the life of the patient. Diabetes is a disease that yung we can control. So, it is important na naiintindihan ng clients. Kasi some clients, when we discuss diabetes, ang tingin lang nila, okay, sige, baka gagaling din yan. Parang hindi nila masyadong naiintindihan yung importance or kung gaano po baka grabe yung disease. So, it is also important na why doctor-client partnership is important because as veterinarians, we can only give advice. Pero yung everyday na life ni patient, nakadepende kay client. Kung gaano sila ka-compliant dun sa treatment program natin, dun sa dose ng gamot, kung gaano nila ifa-follow yung treatment, and yung mga follow-ups. Yan. And the goal also of the treatment is to improve the clinical signs. And of course, weight loss. Sa patient natin, sobrang important ng weight loss. Imagine reduction, 24 kilos, dapat mga 5 kilos lang siya. 5. Siguro minsan nakakita tayo ng 8 or 9. Pero yung 8 or 9, imagine natin, sobrang laki na po nun. So, how much more yung 24 kilos? And also to prevent further complication. Loki is just 6 years old nung na-diagnose natin. So, bata pa siya. Okay. So for the treatment, our treatment plan includes dietary restrictions, insulin lente, daily activities, blood glucose monitoring at home, and insulin administration. So for the dietary treatment recommendation, we've prescribed prescription satiety diet. So, yun po yung binibigay ni owner. Ngayon ko nga lang din po nalaman that the gram of the pellet, 1 gram siya per pellet. So, sinusunod po yun talaga ni client para ma-achieve yung goal natin na wait for the patient. Okay, for the insulin lente, we used porcine insulin zinc suspension. This is the common commercial insulin available in the market in the Philippines at the moment. So for lente, because it is long-acting insulin in dogs. Then for the blood glucose monitoring, we have glucometer, and the preferred blood collection site was sa footpad. The owner considered blood collection bonding nila. So, the patient loved blood collection so much that since day 1, walang naging problem. Sobrang okay sa kanya. Siguro natitikal siya or something. Hindi ko din alam. Pero if nag-try mag-collect yung owner sa ibang blood collection site like sa ears, nagagalit po si patient. So that's why footpad yung preferred na blood collection site. And then for the insulin administration, so we taught the client where to inject and how to inject. So there were few sessions before po natin hinayaan si client na umuwi at sa bahay na i-administer before natin masabi na yun nagagawa niya ng tama, yung treatment. And then for the blood glucose monitoring, so initially, dun sa first 3 days, it was done at the facility, but for the succeeding days, the blood glucose monitoring was done at home. Since this was pandemic, nahihirapan po si client to travel from their home because malayo siya, then dadalhin sa clinic. So what we did was, we had an Excel file, so me and the client, then ini-enter niya na lang po dun yung results. Then what we do, we have an available glucose curve calculator available online. So if ano yung time nung blood collection and then yung result, ini-enter lang natin, then automatic na po siya magkakaroon ng blood glucose curve. Okay, so our goal is to have an stable blood glucose curve. So, ganyan po yung itsura. If hindi tayo familiar, we can also, there are available guidelines online. Nice, yan po. So, yan. So, here is a 7-day glucose curve of the patient since he was diagnosed. We can see that the results were unstable. So, from day 1, makikita po natin, bakit 4 lang? 4 na beses lang siya na-test during the day. Di ba dapat every 4 hours? Ayan. So, if we can see, the time of the collection was not as consistent because we also have to consider the availability of the client at home. So, maliban po dun sa client have to adjust, me then as a veterinarian have to consider the time of blood collection, the administration of the drug. So, from day 1 to day 2, and then sa next slide, we have day 3 and day 4. So, we can see dun sa from day 2, balik natin. Yan, from day 2 na pa-increase yung glucose level ni patient, bigla siyang bumagsak on the 3rd day. So, this is not the blood glucose curve that we want for our patient because it is an indicator that the dose that we are giving to the patient is insufficient or too much for the patient. So, and on the day 4 naman, sobrang taas naman po nung result niya. During the morning, then sobrang baba in the afternoon. So, ayan po. And then day 5, day 6, day 7, we have a very erratic blood glucose curve for the first 7 days. So, what we did was, what we did was from the frequency of once a day, we proceeded with the 2 times a day of administration of the insulin. So in the initial duration activity of the insulin, if we can see that the activity is inadequate, we can already begin with the twice daily therapy. But we have to consider that if we will proceed with the twice daily therapy, the 2 doses divided should be 25% less than the original dose of the patient. So from the original once a day dose of 0.8 IU per kilogram, the twice a day dose was already 0.3 IU per kilogram. So, and on the 8th day, day 8 to day 10, so we've already achieved our desired blood glucose curve. And up to now, ginagawa lang po natin, medyo nag-a-adjust lang tayo from time to time if nagkakaroon ng abnormality to have an established blood glucose curve. So, when administering insulin, we have to consider the adverse effects, including hypoglycemia, especially if the insulin dose is very high for the patient. Pwedeng biglang bumagsak yung glucose level. And also, we have insulin-induced hyperglycemia, insulin resistance, especially for prolonged treatment, and also injection site reaction, insulin overdose. Common na encounter po namin to, mga referral. Or nakakwento din ng ibang vets. Sobrang taas daw po kasi ng glucose, kaya sobrang dami din ng binigay nilang initial na dose, which is wrong. Kasi syempre, lahat naman ng mga disease may process yan. It would take some time. So we just have to be patient when treating and when giving drugs. Hindi, especially that the insulin, we have to take note 12 hours before yung effect. So hindi natin expect na pagkabigay natin ngayon yung 1,000 na result ng glucose, bababa na po siya agad. So dapat gradual din siya. And we have to take it step by step and one day at a time. And also, consider drug interactions and other drug contraindications. And common complication of diabetes mellitus, we have DKA, cataract, and recurrent infections, pancreatitis, hypertension, and insulin resistance. So for our patient, since he was really obese, regular naman po yung monitoring lahat, blood test, except for the urinalysis. So si patient kasi mahilig siya umihi sa grassy area. So hindi natin siya napapaihi sa floor, and hindi tayo nagka-catheter kasi baka tayo mag-introduce sa kanya nung infection causing UTI. So mahirap mag-treat. Okay, for the weight management, our initial monitoring was 3 months. So from 24 kilos, 20 kilos na lang po siya after 3 months. And total weight loss is 4 kilos. And up to today, hindi na siya bumaba sa 19. Pero at least hindi na siya 24. And then medyo mas nakakatakbo na, nakakalakad-lakad na din po siya. And then yan, may regular daily activities including swimming and mga konti-konting walk. Okay? So this is just an example of the discharge form that was given to the client. We have to take note since diabetes is a lethal disease, hindi pwedeng verbal lang yung pagsabi natin ng instructions sa clients. Dapat lahat po yan written. So, para lang may idea tayo, we have available then online by AAHA. I-encode lang po natin doon lahat ng mga details na pwede ibigay sa client, or kung meron tayo protocol po sa hospital natin, pwede din naman yun. So at least, the client knows when to call the vet, the client knows what to do if the level of the glucose in the body falls na kunyari sobrang baba or sobrang taas, what are the first aids. So included po sila lahat dyan, including yung feeding, how often do we feed the patient. So it's, yeah. And also, this includes the insulin directions, what the injection site, the amount, how do you keep the insulin, where to store it. Yan. And for the monitoring appointment, regular visit po siya as in monthly. Regular testing of biochemistry, glucose test, and weight monitoring. Okay, so ongoing care appointment. So according to the owner, we have reduced clinical signs, enhanced mobility, improved energy, and improved overall quality of life. Mas happy na po si patient, hindi na siya laging tulog, hindi na siya laging nakahiga, mas naging outgoing patient na siya. Ayan po. So nakakasama na din po siya sa mga video po, sir. Video po. Pwede So this is Loki po. Imagine how fat Loki is. Pero the weight of Loki here is 20 kilos na lang. Pero we can see po, sobrang taba niya pa rin, sumasayad pa rin yung ventral part ng body. Naka-muzzle siya kasi minsan nagsasnap, pero generally, mabait naman po si Loki. But we can see here that the alopecia in the skin is still persistent. So sometimes tutubo, sometimes hindi. Minsan may maiiwang maliliit na alopecia, pero nagre-resolve. But overall, nag-improve din yung skin niya. Shiny na. Yan. So in conclusion, the case demonstrates that the successful management of diabetes in 6-year-old male Dachshund requires a patient-centered approach that integrates medical, dietary, and lifestyle intervention, and ongoing glucose monitoring and collaboration with the pet owner is very essential. Hindi lang siya essential, very. In maintaining long-term stability and quality of life. So here are our recommendations. We can also choose holistic approach and then yan regular urinalysis. We can also perform abdominal ultrasound, blood pressure monitoring in ill diabetic patients, and the use of continuous glucose monitoring. For this particular patient, the client refused the continuous glucose monitoring if we're familiar with the Freestyle Libre kasi nga she considers blood collection as their bonding moment. And then we can also consult with nutritionists in creating a tailored diet plan for the patient. So this is Loki for celebrating 6th and 7th birthday. Ayan po. So that's the end of the case.
Thank you so much, Dr. Sayeda. Okay, actually, Doc, hindi ka pa tapos. There are a lot of questions already popping. First question, was pancreatitis ruled out?
Opo. So during that time, we don't have available CPL, and it was not, parang the owner did not want to do any lab test. So that was the initial consultation, so no.
Okay. How often do you need to do glucose curve? And what was the, what is NADI or nadir during monitoring? Is insulin as part? I mean, rapid-acting insulin considered? How often do you need to do glucose curve?
So for this particular case, we do blood glucose curve if the patient exhibits abnormal signs. So the owner will tell me when, for example, just recently, just January, the owner observed that the patient was uneasy and yung unable to walk, very weak. So, hindi lang tayo nag-stay dun sa isang test lang, which is yung regular monitoring. So, nag-blood glucose curve po ulit tayo just to make sure na tama pa yung dose, especially that the weight is fluctuating, so we also have to consider that one. And then, for the rapid-acting, I'm not sure about that po because meron po ba available in the market for dogs? So, kasi, meron po. Ayun po. So, hindi po ako aware doon. So, hindi po namin siya ginamit sa patient.
Okay. Doc, the other one is, what was the nadir during monitoring?
The range was 100 to 150.
Okay. Doc, what's the lifespan of a diabetic patient?
So, for a managed diabetic patient, we can extend, from the time of diagnosis, we can extend po the life of, as long as it's managed for 3 to 5 years.
Okay. I assume, Doc, that the case is type 1, dependent diabetes. Since the patient is responding to the insulin, what do you think is the cause of this patient's DM?
As mentioned in the case, po sa title niya, insulin-dependent diabetes mellitus. So it is type 1. We've diagnosed it as type 1 given the age of the patient when he was diagnosed and the clinical signs, and also type 2 is not common in dogs.
Can you give us a quick overview of diabetes in cellular level? Why does the blood glucose cannot be taken by the cells? What does insulin do to the cell for it to take the glucose?
Okay. Right po. So for type 1, for diabetes. Okay. So first po, we have type 2 diabetes. We have type 1 and type 2. So in type 1, this is insulin dependent, and type 2 is non-insulin dependent. This is also to answer the question earlier. So type 1 is juvenile onset or commonly affecting the young patients, and type 2 naman is the adult onset, commonly affecting adult patients. So So in type 1, we have insulin-dependent diabetes mellitus, wherein the pancreas is unable to produce sufficient insulin in order for the body to absorb glucose. Okay, so we have to help the patient or administer insulin as a treatment or to help the body to absorb glucose level. To absorb glucose po in the body.
Okay. Doc, question. Glucose curve must be done in the hospital for strict monitoring of the curve to identify the nadir. Agree or disagree?
Yes, agree.
If agree, why was it not done to the patient?
During this time, it was pandemic and the client declined for confinement. So we do not want naman to not treat the patient just because ayaw ni client. So we have to adjust then as a veterinarian. We have to make compromise, and ganun din for the owner. So what we did po was we agreed that at a certain time of the day, actually as early as 5 or 5:30, the patient already is at the facility for the testing, and bumabalik po siya dun sa follow-up time of the day.
Does the blood glucose reading enough or need to see symptoms like weakness, lethargy, and seizures? And also, can insulin be given IV?
It is also important that we consider the signs of the patient, not just the glucose itself, because there are a lot of other factors that can increase glucose. There are also external factors.
Can you give the insulin IV?
I'm not sure po for the insulin. What we did was sub-Q.
Okay. Doc, in cats, do you consider diabetes if the blood glucose is high?
As mentioned earlier, there are a lot of other external factors. So we have also to consider since one test is not enough. One high glucose test is not enough to consider that the patient has diabetes.
Okay. Doc, prolonged treatment of type 1 diabetes cannot cause type 2 diabetes. Can you expound what you said that prolonged treatment of insulin can cause resistance?
So it is possible, like for my case po. So for type 1 diabetes, in prolonged treatment, there is a possibility that the patient will have an insulin-dependent treatment. So like for my case, we also regularly check on the urinalysis and the HbA1c of the patient. So this was, since we had a repeat fasting blood glucose curve performed last January, we have to check. So this test was done po last March to see if the patient is really insulin dependent or nagkaroon lang ng other external factors. Since the urinalysis is already negative in glucose, it is possible po that the HbA1c here is parang remnant lang of the previous abnormality in the glucose.
Doc, was HbA1c done every 3 months as well?
No po. It was performed when the patient have an abnormal signs.
Oh, okay. So you did not monitor it every 3 months, just like in humans, ano? Okay, Doc, DKA, diabetic ketoacidosis, have you done sodium-potassium leveling? Do you agree on normalizing hyperkalemia by IV insulin, then glucose IV? Sodium-potassium leveling.
Opo. For the DKA, in the normalization of the electrolytes, yes po, I agree. But I'm not familiar with the administration of glucose IV.
Yeah, do you agree on normalizing hyperkalemia by IV insulin, then glucose IV? IV insulin, then
Yun po,
glucose
I'm not
IV.
familiar with the IV insulin po.
Okay, so hi Doc, what's your insight in using freestyle Libre tool in glucose monitoring?
Opo. So I have an idea but I've never used it.
Okay. Doc, what if the owner declined glucometer or blood glucose monitoring at home? Is blood chemistry GLU accurate enough po ba as a substitute for daily monitoring of fasting blood glucose?
Yes po, we can use, but it is more expensive.
Okay.
And more blood needs to be drawn from the patient in order for us to run a complete serum biochemistry test.
Okay. Yes, Doc.
No po.
Wala. After insulin injection?
No po.
No, okay. Kasi dun sa, based on the curve that we saw a while ago, yung glucose, the glucose level.
He can tolerate po.
Wow.
Yes, the
Yes,
only
really.
sign that he have shown is uneasiness. Sobrang uneasy po niya.
Uneasy. Okay. Sige, Doc.
Okay. Next question. May question, Bob, sa loob. Doc Paul.
So, let's try to move out dun sa this particular patient. Let's just deal with the IDDM. So, can you take us into a journey of diagnostics and management? Kasi siguro what I am trying to get here is what we could learn from this particular case, what should have been done, and if you will be suggesting a way to catch this particular condition and diagnosis, ano yung dapat na algorithm or yung parang kailangan nating checklist? Okay, check the glucose, check for this level, and then after that, if proven, or send to another laboratory, if needed ba yun, or kailangan ba mag-check muna ng pancreas for particular diagnosis. So let's try to move out dito sa patient na to, and let's come up with ano ba yung tingin natin na magandang masuggest natin na protocol for our practitioners to do kapag na-handle nila yung isang pasyente na suspected nila ng diabetes.
Opo. So, during the initial consultation, we have the result of the biochemistry. So, dun pa lang po high na yung serum lipase ni patient. So, during that time, or even, sige, dun po tayo mag-start. If we have a patient with a high serum lipase, what are the things that we need to do? So, we have to consider pancreatitis if we have available CPL in our facility, or if not, we can send out. And then, we can also do diagnostics, including complete blood count, to also rule out other possible disease. Complete blood count, urinalysis to check if there is glucose in the urine. Also, ultrasound to rule out other neoplasia, especially in the abdominal area, that can also affect the increase in serum lipase of the patient. And then fasting blood sugar is important also in monitoring. So if we have a patient with an increased serum lipase, we can initially do this lab test. Basta take note po that if we do not have, hindi na natin siya papatagalin pa. If we do not have, we can refer it to a facility where the patient can be accommodated, since we are considering that DM is a lethal, but if diagnosed early, it can be managed. So in patients naman, generally, pupunta lang po sa clinic for a random blood test. No other signs. We have a patient po like that na dadating sa inyo, and then ang papagawa lang CBC and chem. Then doon pa lang makikita na natin increased yung glucose niya. So you have to rule out other diseases, and also history din ni patient. If walang makapagbigay sa atin ng history, we can perform na other lab tests like urinalysis. And yung common lang, kung halimbawa hindi si client yung nagdala, hindi makapag-decide yung nagdala sa patient. So yung mga available na lang po natin, we have urinalysis, and then fasting blood sugar. For the fasting blood sugar, hindi naman kailangan magstay ni patient. If ayaw nilang ma-confine, pwede uuwi, then magbibigay tayo ng time ng balik nila sa facility. So, ang rule po natin for fasting is 6 to 12 hours. Depende na lang po if anong protocol ng facility, but what we follow is an 8-hour fasting. So, para hindi din mahirapan si owner, kasi yung time ng sleeping time din ni client, i-consider din natin. Then, gaano katagal yung travel nila to our facility, yung time ng opening din ng facility natin. So, the first thing na gagawin pagdating sa clinic, kukuha na ng dugo, then instruct po si owner na kapag mababa yung blood niya, for the next 2 to 3 days, ito na po yung mga next na steps natin. Magsa-start na po tayo ng ganitong treatment, and perform ng other laboratory test.
Okay. Doc, how do you manage chronic UTI secondary to diabetes mellitus po in your patients, especially if naikutan na yung antibiotics na susceptible sa urine culture and sensitivity? Thank you.
Opo. So, I've never handled a patient that has that case, but I would recommend to do a urine culture. Yun po.
Okay. Doc, sorry hindi siguro na receive kanina yung message. Ano? What do you think is the cause of this patient's diabetes? And do you think dogs can also contract diabetes if their diet is very rich in sugars, just like in humans?
Yes po. For this case, since the case of the patient is type 1, so um, genetic abnormality. And for yung sa next question, yes, possible then for type 2 diabetes. Yes,
So sugars can affect.
possible.
Okay. Was the dog ba, Doc, on a human food before?
Yes.
Okay. Doc, did you consider testing for fructosamine at all? So fructosamine level is used to estimate a pet's average blood glucose level over the previous 2 to 3 weeks.
No po.
No, Doc. So actually, as part of the key takeaway, as we've seen from the first speaker up to the third, ang ganda nung binibigay nilang case studies and reports sa atin. Why? Because for Doc Sayeda alone, it's more of how we as practitioners manage not only diagnosing part and then treatment, but also considering, client education related to proper nutrition as well. So, dinesclose naman ni Doc kanina kung ano yung mga binigay niya na diet-rich na makakatulong. Kasi if we manage, di ba, pera, money-wise, they can spend. The owners can spend. Kasi they love the dogs or the cats. But the thing here is, how do we end up dun sa position, like sa case niya, from 24, naging 20 kilos. So it's a huge hooray, di ba, as a veterinarian. Ang saya. Nagawa ko, di ba, in a span of how many, ito, Doc?
3 months.
3 months, kaya pala natin. Siyempre, sa tao din pwede nating ma-apply. Anyway, pero meron pa akong 13 minutes. If there's other doctors here, you want to ask questions? May diabetes ka ba, Doc Randy?
Wala naman, Doc. Mataba lang. Okay, thank you, Doc. Ang ganda nung case presentation mo, clinical management. Gusto ko lang malaman, Doc, before or after ka nagbibigay ng insulin sa feeding time? Kasi usually, di ba, sabi mo kanina, consider the time of the owner. So usually, sa practice ko kasi, before feeding time, chine-check yung BG. Kung mataas, magbibigay. Kung mababa, magbibigay pa rin. Kasi kakain siya eh. Paano kung hindi kumain? Magbibigay ka pa rin ba?
Yun po, we have to also consider that the insulin has a 12-hour effect maximum. So if in the morning mababa po yung result niya, hindi siya dahil sa ngayon lang. So dahil siya sa gamot kahapon. So kailangan talaga magbigay pa rin dun sa patient. Yes, kailangan po siyang papakainin before magbibigay ng insulin to help the body to absorb glucose from the food, not from the insulin.
Yeah, kasi sometimes it's pwede siyang maging tragic, right? Because what if sobrang mapababa mo ng husto? Okay, mag-hypo naman ang aso. Okay.
Okay, so speaking of pakain na tayo. So since di ba, Doc, si owner magta-travel siya papunta sa clinic. So saan ginagawa yung pagpapakain? Bago pa siya pumunta sa clinic? Or kung sa clinic na, kasi nga i-check muna di ba yung blood glucose niya. So sa clinic na rin ba nagpapakain? And yun nga, kung ayaw talaga kumain ni dog, so ang ginagawa na lang is
syringe, opo. Sa clinic na po siya kakain.
Okay.
Kasi yung insulin treatment will help in the absorption of the glucose lang from the food.
Okay.
Usually 30 minutes po yung ginagawa namin.
Okay. Doc, I think I have a very interesting question here. How much would the total treatment and diagnostic cost if owner is unable to do treatments due to overall cost and holistic approach was not effective? Would you recommend humane euthanasia?
First po, for the testing, we have naman available online market. So, it is not an excuse partly. Siguro in some pet owners na talagang hindi maka-afford of the treatment and if the pet is showing severe sign of diabetes, possible nasa end stage or sobrang dami ng complicating factors, we can consider because we also have to consider we are treating the patient to improve the quality of life.
Okay. Doctor, as you mentioned, you only check blood glucose level if there is an external symptoms. Is it not harmful to develop cardiac complication if the sugar is already high for a long time before it already shows external signs?
So for this case, we only check the fasting blood glucose if there is an external sign, but ever since the patient was diagnosed, me and the client, we have an Excel file, complete Excel file from July up to recent, this morning po, of the glucose monitoring of the patient. So, ina-enter niya lang sa Excel yung date and time and kung ilan yung glucose na binigay niya. Tapos, nakikita ko na po siya. Then, doon na din ako nag-i-instruct ng mga instruction to be given to the own. So, hindi po na-monitor si patient if meron lang external sign. Ang minomonitor pag may external sign is yung fasting blood sugar. Since kailangan i-consider baka pumayat si patient or like last January, kaya nagkaroon siya ng abnormality kasi according to the client, Pasko daw tsaka bagong taon. So, nag-cheat month si patient. So, nag-gain siya ng weight. So, there was an adjustment in the weight. So, we also have to adjust the insulin dose.
Okay. Doc, how about water intake? Ano yung preferred milliliters, liters? Kasi insulin binibigay na natin siya, external source. So, do you recommend like how do we compute for the water that's going to be needed sa kanya per day?
For this patient, we did not compute for the amount of fluid or of the water to be taken po per day. But I've given the client signs yung to monitor for ano ba yung mga signs if dehydrated po siya.
So wala ka rin, Doc, prior knowledge dun sa water intake niya. Okay. Did you also do follow-up, Doc, until today?
Yes, opo. Recent follow-up was last month lang po.
Okay, kamusta siya?
Happy dog.
Happy dog na ulit. Okay, 4 minutes. Okay, Doc.
Hello, Doc. Ano ko lang kasi is kung yung patient ba is hypothyroid din ba? Chine-check din ba yung thyroid function niya every now and then? Kasi pwedeng concurrent kasi siya sa sa diabetes And then what's your intake regarding sa human insulin? Kasi yun yung pinaka mas available sa market rather than dun sa porcine na insulin. So what's your take on that?
Opo. Well, first po, porcine insulin is just the generic name. So, same po yung available sa market and sa human. And I'm not quite sure but parang may stable na po yata ng supply po ng insulin ngayon. Pero last month wala. So, for the thyroid naman, yes, regular po siyang chine-check. In fact, for the very first, and then the follow-up consultation, ni-rule out na din po siya. Wait lang. And just last March po, nag-test po ulit tayo for thyroid to make sure lang po na na negative. So, hindi lang po na-include dito yung T4 pero all are within normal limits.
Any other questions?
Doc, hello po, good morning. In humans, they use metformin. What is your insight on metformin in dogs?
Yes po. So, as part of the option for the medical treatment, it is indicated that we can use oral treatment. But there is not an established study for the use of metformin in dogs. And it is only used po in type 2 diabetes, not in type 1. Pero there are some parang studies they try to give. Siyempre, kapag na-overdose, ma-hypoglycemia patient.
Doc, what is the pathophysiology of PUPD, polyuria polydipsia, in diabetes in dogs? Or why is there a PUPD in the diabetes in dogs? That's your last question.
So, in diabetic patients, there are 4 classical signs. You have polydipsia, polyuria, and polyphagia, and weight loss. So, these are the common signs that are observed in diabetic patients.
Okay. As part of the help, so that's the reason for that is because meron kasi siyang high blood sugar levels, 'di ba, kapag diabetic tayo. So nagli-lead siya dun sa increased water intake, tapos mag-urinate tayo kasi yun yung mechanism ng katawan ng tao at ng hayop to flush out the excess glucose. So, para din siyang may payo, mitra, di ba? PUPD din. Pero, it's actually the mechanism ng ating katawan. No, yun yung reason, high blood sugar levels. So, ang nakakatakot lang dito is every time we do, sa tao even sa tao, we do urinalysis, tapos may makita tayo na glucose, tapos 2+, 3+ sa ihi natin. So, these are molecules na malalaki. Diba? Macromolecule siya, hindi siya dapat nakakadaan dun sa ating kidneys down to the urine. So, be very careful then also kapag nagdi-disclose din tayo sa ating mga clients, lalo na when we do client education. Kasi sometimes, Doc, reliable ba yung UA nyo? Kasi di ba may mga, lalo na pag medical doctors, nag-a-ask sila sa akin na parang, Doc, saan ba ni-run yung urinalysis ng dog ko? Kasi minsan hindi makapaniwala, lalo na yung mga nurses, no? Kasi nga malaki siyang molecule. So every time ako, like my dad, he had diabetes way before he had cancer. So sine-check lagi, okay, may andami na, 2+, 3+, plus. So ganon, yun yung mechanism ng katawan para ma-excrete out or ma-flush out yung excess glucose. Kaya inom ka ng inom. Tapos ihi ka ng ihi. Okay, that's a wrap up. Thank you so much, Dr. Hussein. So we'll now go for our break.
Mic check. Mic check.
VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman Fit ZC is a combination of 2 mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Happy Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silymarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Happy Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin wound ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn, and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iozine wound spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Papi emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is also used in dogs and cats to induce milk letdown and to promote milk production. Vermifuge and Volapets is an anthelmintic drug for the treatment of mixed infection by nematodes and cestodes of the dogs and cats, such as Toxocara canis, Toxascaris leonin, Uncinara stenocephalia, Ancylostoma caninum, Echinococcus species, Taenia species, Dipylidium caninum. Happy Oatmeal Shed Control Shampoo gives a long-lasting soothing relief in controlling shedding or loss of hair of your pets. It contains oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Pappy Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itching. And jojoba oil has been used as an anti-inflammatory property that helps our pet's coat and skin, leaving them a softer and healthier manageable skin and coat. Pappy Oatmeal Insect Control Shampoo gives a long-lasting relief in controlling external parasites such as ticks, mites, and fleas. It contains oatmeal that hydrates and moisturizes your dog's skin to promote a healthier and manageable coat, and fipronil that eliminates and kills the fleas and ticks that try to bite our pets that can be itchy and uncomfortable. It can also cause painful allergic reactions and transmit dangerous illnesses. Papi Mixidin is a combination of miconazole nitrate and chlorhexidine gluconate that helps provide relief against fungal infections such as ringworm and superficial skin infections caused by yeast and bacteria. It is the shampoo of choice for those suffering from mixed fungal and bacterial infection and skin with wound and other skin damage. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. Multivits, multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Bayan Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Papi Plate Leaf contains a combination of multivitamins, minerals, and Euphorba hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nakalvit ZC is a combination of two mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Papi Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silymarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Papi Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion, and promotion of better growth. Renacure is a dietary supplement for use in dogs and cats that contains a combination of potassium citrate, docosahexaenoic acid, and Lumea balsamifera ingredients known to aid in the prevention of urinary stone formation. Uticare contains cranberry extract and D-mannose for the relief of symptoms of mild recurrence, lower urinary tract infections of dogs and cats. It also promotes urinary function with proper pH balance and helps support the bladder against any infection. Oritec. It contains a combination of gentamicin sulfate and dexamethasone valerate used for the treatment of inflammation and bacterial infections of the ear in dogs and cats. Gentamicin wound ointment. It contains 0.2% gentamicin sulfate, a broad-spectrum antibiotic used in disinfection of all types of wounds, such as cuts, bruises, burn, and surgical incise wounds. Topiderm contains 10% iodine solution, cotrimazine, and potent herb such as guava leaf extract, citronella, eucalyptus extract, and aloe vera for disinfection of all types of wounds, such as cuts, bruises, burn, and insect bites. It is also a good insect repellent for ectoparasite and other crawling and flying insects. Iozine wound spray contains 10% iodine solution, cotrimazine, and potent herbs such as guava leaf extract, citronella, eucalyptus, and aloe vera extract. It is used as disinfectant in all types of wounds such as cuts, bruise, burn, mange, and surgical wounds. Papi emetics is used in dogs, cats, and small mammals to stimulate stomach and upper small intestinal movement to prevent esophageal reflux. It is also used in the treatment or prevention of vomiting in dogs and cats. It is also used in dogs and cats to induce milk letdown and to promote milk production. Vermifuge and Volapets is an anthelmintic drug for the treatment of mixed infection by nematodes and cestodes of the dogs and cats, such as Toxocara canis, Toxascaris leonin, Uncinara stenocephalia, Ancylostoma caninum, Echinococcus species, Taenia species, Dipylidium caninum. Happy Oatmeal Shed Control Shampoo gives a long-lasting soothing relief in controlling shedding or loss of hair of your pets. It contains oatmeal that hydrates and moisturizes your dog's skin for a healthier and manageable coat. Vitamin E is an antioxidant that protects and repairs the skin and generally prevents it from dryness. And guava extract has a natural antibacterial property to maintain healthier and germ-free skin that prevents your pet's excessive loss of hair. Happy Oatmeal Hair Regrowth Shampoo is enriched with oatmeal that hydrates and moisturizes your dog's skin. Aloe vera extract that prevents your pet's hair loss. It also soothes dog's skin to prevent itch. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. VetMate Pharma Corporation, a Filipino company engaged in the distribution of veterinary products, specializing in companion animals for grooming, supplements, and veterinary medicines. Founded in June 13, 2006, it started when Mr. Herman A. Panghulan, President and CEO, shaped up a cluster of former Beringer Mannheim associates to build a veterinary company. The company continues to expand to provide premium quality veterinary products. VetMate Pharma Corporation also offers a wide range of premium quality products for poultry, such as broilers, layers, and racing pigeons. And on October of 2020, we introduced our first agri product, Leafy Green Organic Foliar Fertilizer. Multivits, multivitamins and minerals plus omega-3 fatty acid for support of your canine companion's heart health, promotes a silky coat, reduces itchy and flaky skin, and can help relieve allergies and joint pain. Papi MVP is specially formulated nutritional supplements fortified with vitamin D3 to promote your pet's general health, internal organ, function, and proper diet. Vitamin D3 is cholecalciferol, which maintains calcium balance necessary to bone growth and increase bone mineral density. Papi OB is a breakthrough herbal and mineral nutritional supplements specially formulated to enhance and promote animal health during the pregnancy period. Papi OB aims to supply that requirement using natural ingredients from malunggay and other mineral resources. Papi Bayan Plus is indicated for the use in prevention and treatment of iron deficiency anemia due to infection, intestinal and external parasitism, iron depletion secondary to post-operative blood loss. Papi Plate Leaf contains a combination of multivitamins, minerals, and Euphorba hirta for the prevention and treatment of vitamin and mineral deficiencies. It is a supportive remedy of thrombocytopenia and anemia in pets. Nakalvit ZC is a combination of two mineral ascorbates or non-acidic vitamin with zinc. It improves immune function and increases the blood level of interferon and antibodies. It also helps in dog arthritis and other regenerative joint diseases. Happy Live Well is a natural food supplement for dogs and cats for a healthy liver, heart, and brain. It is a combination of silymarin or milk thistle to specifically protect liver against toxin. L-carnitine helps fat metabolism and docosahexaenoic acid or DHA, and omega-3 fatty acid for faster brain development and serve as an anti-inflammatory. Happy Live Well also helps increase appetite, regeneration of damaged liver cells, elimination of harmful toxins, enhances digestion and promotion of better growth.
Good afternoon, everyone, and welcome back to the Philippine College of Canine Practitioners and VetMate's 5th Veterinary Focus Course, Elevating Companion Animal Care. I am, once again, Doc Aline, your host this afternoon. I hope you all had a great and sumptuous lunch today. So, in order for us to begin with our second leg, may we call on Dr. Criselda Lau to introduce our first speaker this afternoon.
Dr. Hernando graduated from the School of Veterinary Medicine at Isabela State University with a degree of Doctor of Veterinary Medicine in 2017. He focused on small animal practice and went to different areas in Metro Manila. His extensive knowledge is also shaped by working in Singapore and training internationally, enriching his perspective and insights in uplifting veterinary medicine. As his dedication to veterinary practice is rooted in his upbringing, surrounded by feline companions, in which he served as the Chief Veterinarian and Medical Director from 2021 to 2023 in the Cat Clinic, Philippines. Dr. Hernando is also an associate member of the Philippine College of Veterinary Surgeons, Companion Animals, showcasing his multifaceted skills, and proudly holds the honor of being one of the pioneers performing laparoscopic surgery, a milestone that brought a transformative impact on the field of veterinary medicine in the Philippines. Currently, Dr. Hernando is practicing as a senior veterinarian in Peralta Veterinary Center in Parañaque City, performing his field of interest, minimally invasive procedures using flexible and rigid endoscopy, soft tissue, and reconstructive surgeries. Please welcome Dr. Hernando Bal G. Hernando.
Okay. Good afternoon, everyone. I hope you're all doing well and feeling energized this afternoon para sa aking presentation. And since kakakain lang natin, I hope na gising tayong lahat, right? Okay. First, I'd like to express my sincere gratitude to everyone here. Thank you so much. Thank you to the PCCFP for giving me this opportunity to share something I am truly passionate about. A special thank you to the specialty board, all the officers, and especially to my mentors for guiding me every step of the way. Thank you so much. Okay, again, good afternoon. I'm Dr. Harold Hernando, a senior veterinarian at Peralta Veterinary Center in Parañaque City. So, whether you're already familiar with this topic or just getting started regarding endoscopy, my goal this afternoon is to share insights that I hope you'll find it both interesting and useful. So now let me begin my case presentation titled Endoscopic Retrieval of Esophageal Foreign Body Object. But before we dive in, may I ask how many of you have an endoscopic machine in your clinic? Kindly raise your hand. One. Oh, okay, I see. It's very few. Thank you for that. All right. With that in mind, let's dive into the topic. For the introduction, foreign body ingestion is a common occurrence in veterinary practice, but retrieving of these objects can be quite challenging due to a variety of factors. Honestly, kung gaano siya ka-common, kahapon lang I just had an FBO case yesterday, and luckily again, it's esophageal foreign body siya. So that makes it common in my practice, and I hope sa inyo din na from symptoms, then nandun lagi yung ating mga foreign body objects as a differential diagnosis. So in small animal practice, dogs are more commonly affected other than cats. This is largely because of the cats tends to have a more selective and cautious feeding behaviors. These cases often present with clinical signs such as retching, vomiting, regurgitation, excessive salivation, and dysphagia. Such symptoms should raise a strong suspicion for foreign body ingestion and be considered in our differential diagnosis. So these foreign bodies typically become lodged in the upper gastrointestinal tract, most commonly in the esophagus, the stomach, and the proximal duodenum, and can often be successfully removed using flexible endoscope. Now, let's proceed to the objectives of this presentation. First, to present cases involving the retrieval of an esophageal foreign body. The second one is to highlight or to illustrate the importance of proper patient selection for endoscopy. And lastly, to identify the factors that influence the success rate and potential complications associated with the procedure. So what is flexible endoscopy? A flexible endoscope is a slender, bendable instrument with a built-in light source and a camera. It is designed to visually examine internal organs, and it can be inserted through the mouth to access the stomach or through the rectum to reach the colon. So these methods provides a real-time images, making it an essential diagnostic tool, particularly for evaluating conditions that are challenging to detect with standard imaging techniques. Okay, so the use of endoscopy is crucial for its minimally invasive approach, as it eliminates the need for scalpel incisions. This direct visualization enhances diagnostic accuracy by allowing real-time inspection of the lesion with a camera. Endoscopy also reduces surgical time and improves success rates compared to traditional methods. So as a result, it minimizes post-operative discomfort, reduces the stress, and accelerates the healing process. This endoscopic procedure is an excellent option for both veterinarians and clients, particularly in geriatric and debilitated patients. So it also provides the added benefit of enabling tissue sample collection for biopsy, aiding in the diagnosis of underlying conditions. Next is the factors influencing the endoscopic retrieval. So first, the type of the foreign body. This plays a significant role, whether it is a bone, a sharp object, or another material, as well as its shape and size. Some objects are smooth and cause minimal trauma like balls, coins, or beads. These usually don't cause much damage. Thank you. But others are sharp objects, like you've seen in the picture, or pointed ones like bones, needles, or similar items, and these are the ones that can be dangerous. Sharp objects can cause bleeding or even perforations, especially if they get stuck or during the removal process. In my experience, and supported by studies, bones are the most common foreign bodies we see in dogs, making it about 80% of the cases. Toys and other household items comes next, depending on what accessible in animals' environment. Next would be the location. The location of the foreign body in the gastrointestinal tract also plays a big role in how we manage the case. Some areas are easy to reach, while others like deeper sections or tight anatomic spaces can be much more challenging to access during the procedure. Another important factor to consider is the equipment we used. So specifically the size and the flexibility of the endoscope. This can greatly affect how easy or difficult the retrieval will be. In addition, the type of the retrieval instruments, like the graspers, baskets, or the snares. This must be chosen based on the shape, based on the size and material of the foreign body. Not every tool works for every cases. So knowing what and when to use is the key. Again, not every tool works for every cases. So knowing what and when to use these tools is the key for a successful retrieval. And of course, the operator's experience plays a crucial role. A skilled and knowledgeable practitioner can significantly improve both the success rate and efficiency of the procedure. So in many cases, it's the combination of the right tool and the right hands that makes the biggest difference. Next, let's take a look on the anatomy of the esophagus. So the esophagus here is a relatively narrow muscular tube that connects the mouth to the stomach. Because of its structure, it can be quite sensitive and vulnerable, especially when a foreign body is involved. If a retrieval procedure isn't done carefully, the esophagus can easily damage. This can lead to serious complications like perforations, bleeding, or even stricture formation later on, which can cause long-term swallowing difficulties for the patient. So that's why understanding the anatomy is so important. It helps guide us in choosing the safest and most effective approach for those procedures. So here, the esophagus is divided in 3 areas, which are the cervical esophagus, the thoracic esophagus, and the abdominal esophagus. In most cases, 60 to 75% of the foreign bodies lodge typically between on the heart base to the diaphragm, so on the distal part po siya. And around 20 to 35% is over the base of the heart, which is, I think, nakikita natin siya palagi. Even, the rest are just on the cervical or the neck region. The esophagus has 4 layers: the mucosa, submucosa, the muscle, and the fibrous tissue with longitudinal folds inside. So another one is in cats. The upper third is striated muscle, while the lower 2/3 is a smooth muscle. Okay. I think everything is good with the introduction. Let's proceed with case discussions. For case number 1, the patient name is Paco, a 4-year-old male Boston Terrier. He was presented with a month-long history of vomiting and was referred to Possum Pets Veterinary Clinic in Pangasinan for a second opinion. It's actually Dr. Winwin Akshomo who diagnosed this patient. So the veterinarian conducted the evaluation, diagnosed an esophageal foreign body. So based on the findings, endoscopic retrieval was recommended. So as you can see in the image, Paco appeared severely emaciated and very weak. He couldn't tolerate solid food. And even pagkakain niya, magvo-vomit siya agad. And it shows signs of dysphagia kahit umiinom lang siya. Excessive salivation was also noted during the physical examination. And this supports the suspicion of the esophageal obstruction. Okay. So for the diagnosis, a series of tests were conducted, including a complete blood count and the blood chemistry, so to rule out any underlying systemic issues. So here, the blood result shows that a complete blood count is normal with no issues with white blood cells or the red blood cells, although the platelet count is slightly elevated, suggesting a recent clotting event likely due to inflammation at the lesion site. In the blood chemistry here, the low albumin levels and elevated globulin levels suggested protein loss, which may be associated with an underlying pathological conditions or inflammatory processes. Another one is pancreatic lipase levels were also measured with suspicion of pancreatitis, and C-reactive protein was found to be elevated, indicating the presence of systemic inflammation. Okay. Let's go to the radiographs. Radiography is the primary diagnostic tool when foreign body ingestion is suspected. In this radiographic view, the exact location of the foreign body is not clearly visible. However, the lungs is still clear. While the stomach is empty, it is notably distended with gas. So normally, mahirapan talaga tayong makacheck ng foreign body object on this view, especially if esophageal foreign body yung tinitignan din natin. So, in this right lateral view here, the abdominal organs appear clear with no foreign body observed. So, in the thoracic view, or in the thoracic region, there is no foreign body present in the caudal esophagus. Kikita ba? There. Or near the base of the heart. However, a displacement of the trachea here is noted. So we then proceed to examine the left lateral thoracic view for further assessment, which is this one here. Okay. Parang mabilis ata ako. Wait lang. So in this lateral view, the foreign body is clearly visible. This one. Causing a noticeable tracheal displacement, this one. And then there is also an air accumulation on the distal part of the foreign body object. To further evaluate the patient, a radiographic contrast study was performed to assess for potential perforations or an esophageal diverticulum. Fortunately, there were no abnormalities detected, or there were no foreign bodies that were identified on the rest of the gastrointestinal tract. By the way, if like for example, we do a endoscopic procedure and then ang meron lang tayong contrast media is the barium, I would recommend yung Omnipeg or yung mga hindi recommended yung barium na gagamitin kasi sometimes it would also cause problem dun sa mismong machine or nakaka-interfere din siya sa mismong lens ng machine. Okay. So here is the maximized view of the foreign body object in which it is located on the thoracic inlet from C6 to T2 to the thoracic. Okay. So after diagnosing the patient, treatment options were considered. So given the severity of the condition, the location and the type of the foreign body, and the overall health of the status of the patient, endoscopic retrieval was strongly recommended as the most appropriate course of action. Pero why we need to use endoscopy? So this is again the big question for most of these cases. So the primary goal po kasi ng endoscopy is to remove the foreign body object using an atraumatic, meticulous approach. Endoscopy allows for precise, minimally invasive retrieval, minimizing the risk of injury to surrounding tissues while ensuring the foreign body is safely removed. This procedure is preferred over traditional esophageal surgery due to esophagus' poor healing capacity. So I've discussed yung ating anatomy ng esophagus earlier. Esophagus lacks a serosal layer which delays fibrin sealing, and it does not have the ammental support found in abdominal surgeries that promotes faster healing. Additionally, the esophagus has a segmental blood supply, which can further hinder the healing process. Its constant motility, as we know, means that a foreign body lodged in the esophagus can cause distension, increasing the risk of tearing or perforation. So therefore, endoscopy provides a safer and more effective approach for foreign body removal. For the surgical planning, we need to prepare the necessary equipment. We have to ensure the proper patient stabilization and anesthesia is required for endoscopic procedure. So during the procedure, several complications can arise, so we have to think everything, including the perforations that may cause by the foreign body object. This can lead to severe bleeding, abscessation, and subcutaneous emphysema. These are critical risks we must be mindful and carefully monitor throughout the procedure. For endoscopic retrieval of an esophageal foreign body, the patient should be positioned in left lateral recumbency with the neck extended. Gas anesthesia should be maintained throughout the procedure. So one helpful tip to determine the exact location of the foreign body during the procedure is to rely on the measurements of the measurements printed along the this one, the flexible one. So this makes the markings provide a reference point. This allows accurate gauge and the depth and position of the foreign body object. So upon checking here, so the foreign body is located at the level of the thoracic inlet. It is encased in a mucinous slimy substance, which likely represents a combination of mucus and other secretions that have accumulated due to irritation or inflammation of the esophageal lining. The mucinous coating may obscure the shape and edges of the foreign body, making it more difficult to identify its location and orientation during the procedure. This also complicates the retrieval process, as the operator or may have difficulty to distinguish the foreign body from the surrounding or assessing the best approach of extraction. I'm going to show you a video clip showing the foreign body. There. So as you can see, it provides a visual representation of the object, its position, and any surrounding anatomical structures which can aid in assessing the situation and planning the best approach for retrieval. Yeah, there's a lot. Okay, so as we check the foreign body object, initially, I attempted to use the four-prong grasper due to irregular shape of the foreign body. However, this was ineffective as the object was too heavy to be retrieved. So, pag hihilain mo siya, nawawala or natatanggal lang din siya. So, mahirap siyang kunin or mahirap siyang i-move at least. So in this case, a grasping forceps would be a better choice, as it provides a firmer grip and is more suitable for handling heavier objects. Maneuvering the grasping forceps remains challenging due to the slimy coating of the foreign body, which reduces the grip and increases the risk of the object slipping or being damaged when held too tightly. Therefore, it is essential to carefully assess and identify the most suitable point of contact using a gentle twisting and pulling technique to gradually dislodge the foreign body without causing further injury or compromising its integrity. Yes. And honestly, hindi lang yan yung grasping forceps na ginamit ko. May mga external grasping forceps pa po akong ginamit para mat-retrieve siya ng mas madali. Okay, and then this is the image that shows the foreign body, which upon inspection was identified as a bone. So yung size ng foreign body objects, 2 inch, 1.4 inch wide with 0.75 inch thick. If you're going to ask me kung ilang minuto or ilang oras ko po na retrieve ito, dahil sa sobrang slimy and pagka grip ko po kasi siya, nadudurog na rin yung ibang parts, kaya medyo nahirapan po talaga ako dito. It would take 1 hour po nung ginawa ko yung procedure. So, medyo matagal siya. So, yeah. There is also post-operation endoscopy check just to know if there is a remaining foreign body of na naiwan, the severity of the lesion, and then the possible perforation. Pa-play po. There. So during the inspection, ulcerations, erythema, and inflammation were observed in the mid to upper esophagus. There. Okay, so every time na magtatanggal tayo ng foreign body object, it's best to do a post-operation endoscopy check just to monitor or to check everything po. Okay, so Paco was sent home after recovering well from anesthesia and being monitored. So since, yun nga, naging question na rin siya sa akin before na bakit ko pinapauwi agad yung aking pasyente. And sometimes because din sa client discretion din po, na the patient is actually from Pangasinan pa and then they come to Manila, then kailangan iuwi agad and so on and so forth po. Pero yes, you can discharge po yung mga patient as long as you know na magiging okay siya after the operation. So after the procedure, 2 hours, 3 hours po post-operation is wala naman po siyang vomiting, there is no anything, even nauseousness is wala na rin naman na sa kanya, so pina-discharge ko na rin naman siya thereafter. But still, analgesic medications, anti-nausea medication, gastric protectants were also prescribed and advised to give soft diets for 5 days po. The analgesic that was used is meloxicam, pero yun lang din po kasi available that time. So I think yun po yun aking naibigay. It's also advised to have a follow-up check with the attending veterinarian after a week. And then there were no vomiting noted after the procedure and the patient went back to normal. So this is, hindi na siya payat po dyan. It was just after 2 months, I think. Okay. The next one, case number 2. For our second case, we have Tai Chi, a 4-year-old female dog referred from, again, Pet Post Veterinary Clinic, Dr. Winwin Agshomo again, thank you. She was brought in with a history of vomiting and noticeable difficulty in swallowing or dysphagia. The owner reported that the symptoms began a few days prior and have been progressively worsening. Tai Chi was no longer able to eat solid food and showed signs of discomfort when trying to drink water. So this one, may bibigyan natin ng comparison yung matagal ng foreign body object, which is 3 weeks to a month na na-dislodge or na-lodge yung foreign body object, and then this one is just for a day. So on physical examination, excessive salivation was noted along with sign of dehydration and weight loss. Based on the clinical signs, an esophageal foreign body object was strongly suspected. So again, blood results were done. Everything is actually good. Results shows that she was stable and fit to undergo anesthesia and planned to do an endoscopic procedure. For the radiograph, here, mas nakikita rin naman po siya agad actually on the top of the, or on the base of the heart. Okay? And then on this side, on the right lateral view of the thorax is nakikita din po siya. So its shape and size suggested that it could be a piece of a bone or a similar dense material. The object appeared to be causing partial obstruction, which explained tychus vomiting, dysphagia, and excessive salivations. There were no signs of gas leakage or mediastinal changes at this stage, which was a good indication that there were no perforations, making endoscopic retrieval a viable and safe option. Okay. So here is the magnified view of the foreign body, which is clearly located at the base of the heart. On the radiograph, the location aligns with one of the most common sites for esophageal obstruction. So before starting the procedure, it's crucial to ensure proper preparation and positioning of the patient. Okay, that's it. She was placed in a lateral recumbency to allow optimal access to the esophagus, ensuring the foreign body could be reached with ease. Proper positioning is key for safe endoscopic retrieval, as it helps avoid unnecessary strain on the patient and provides a direct pathway for the endoscope. Additionally, adequate anesthesia and monitoring were in place to ensure Tai Chi remained stable throughout the procedure. So, yes, ganito lang po yung aming setup. Although, as we know, if like for example, there is complication na mangyayari, you have to know na rin kung paano ba gumawa ng traditional approach and then be ready always. Although, based dun sa mga clinical signs na nakita natin sa kanya and then sa x-rays din po, this approach is just as easy na lang din naman po. I also have Dr. Bong here to assist me po. So next, we'll watch again a video clip po demonstrating the endoscopic retrieval of the foreign body. So as you'll see, the procedure involves carefully navigation of the endoscope to locate and secure the object. The video highlights the technique used to safely remove the foreign body without causing damage to the surrounding tissues, particularly given its location near the base of the heart. So please pay attention po to the precision required in handling both the endoscope and the retrieval tools to avoid complications such as perforation and bleeding. So I'm just going to discuss na lang din po. Ano? So here, before you're going to retrieve the foreign body object, you have to know kung asan yung position niya. Tapos, you also have to check on what approach you're going to do. First, you have to know where is the sharp object. Is it perforated? Is it embedded? Or is it needed to be pushed? Or is it needed to be pulled out? Another one is how to maneuver those instruments, or what instruments do we need to use. As you can see, this one is a dense material and sa bone din naman. So the grasping forceps would be as easy to get that bone, which is on this video from the endoscopic machine. It was actually done very fast. It would only take 3 to 5 minutes procedure, and then that's it. Okay. So the foreign body was deeply embedded in the esophageal lumen, but fortunately it was immediately visible. So unlike the previous case, there was no mucinous liquid covering the object, and then the esophagus appeared less inflamed, which made the procedure quick and more efficient, and the retrieval process may took just few minutes po. Okay. So here is the picture. So we have the sharp wishbone that was successfully retrieved from the Tychus esophagus. And as you can see, it is a dense, sharp object which is pose a significant risk for injury during retrieval. So it is best to remove the foreign body immediately then. So para hindi siya mag-cause ng perforations or cause respiratory problems. So next, we have a photo here showing the lesion caused by the embedded object. So the sharp edges of the wishbone caused some mucosal abrasion and mild local inflammation, but fortunately there were no signs of perforation or severe damage. So again, it was sent home, medication still the same, and then perfectly fine naman po yung patient. For the third case, now let's look po on Brownie, an adult domestic short-hair outdoor cat with history of drooling for almost a month, and he was suspected for foreign body object and referred for endoscopic check. He presented with 1 week history of vomiting but surprisingly maintained a good appetite. So that was before the confinement pa. So upon physical examination, we noticed a sunken left eye, crackling sounds during respiration, and a history of viral infections kasi meron siyang coronavirus, herpes virus, and calicivirus. So despite these signs, Brownie remained active and had a sweet temperament. So as you can see, all of my cases is referral patients po. So honestly, wala pa po akong patient on my own. Lahat po ng aking patient ay nangagaling from referral po talaga. So from Pangasinan, Batangas, pumupunta pa po sila sa Manila to do these procedures po. Okay. His medical records indicated that he had been hospitalized for a week due to a respiratory infection which was confirmed by mucosal nasal discharge. So given the persistence of his symptoms, the new suspicions for foreign body obstructions was included po sa ating differential diagnosis. So doon na siya na refer po sa akin. Based on the blood test, we observe an elevated white blood cell count which point out a bacterial infection. A blood chemistry also showed a slight increase in globulin levels, indicating an ongoing inflammatory response. Additionally, amylase levels were elevated, but further testing of pancreatic lipase confirmed that the pancreas was functionally normal, ruling out pancreatic dysfunction as a cause. So in the initial radiograph, there were no foreign body obstruction that was apparent. So the lungs was clear. There were no evidence of any abnormality within the thoracic cavity. However, there is a mild distension of the cervical esophagus that was observed here. Okay? So, specifically over the trachea. So further investigation was conducted using a barium contrast study, which revealed a significant accumulation of a barium within the cervical esophagus. Notably, the barium did not pass through the esophagus, strongly suggestive the presence of an obstruction. So given these findings, esophagoscopy was recommended as the next step to visually assess the esophagus and confirm the nature and location of the obstruction. Okay, and this radiograph is actually 24 hours post-barium study na. So there were no attenuation of that barium po. Even mapunta sa stomach, it was just stuck, and then sinusuka pa rin po niya yung barium media. Okay. So this is a video clip again, just to show po kung ano yung nakita natin sa esophagus ng cat. So during the esophagoscopy, no foreign body was identified. However, an abnormal outgrowth was observed in the esophagus, which appeared to be the cause of the blockage. This suggests that the symptoms Brownie was experiencing were likely due to this growth rather than a typical foreign body obstruction. So yes, hindi siya part ng foreign body retrieval on my presentation, pero yun po kasi yun main problem na binigay po sa akin. And when I actually asked my mentor if I could just add this one, which they agreed din naman, since we also have to know what is the importance of endoscopy as well, other than retrieval ng mga foreign body objects. So, hindi lang po retrieval ng foreign body objects ang ginagawa ng ating endoscopy. We can also do diagnosing. We just check through the esophagus, and so on and so forth po. And then din natin malalaman na ito pala yung problem, hindi pala siya yung foreign body object. Okay. Next. So here is the picture po. So before entering, ito po yun. During the procedure, I actually tried to distend or put gas or oxygen po para po mag-inflate po yung kanyang esophagus para malaman natin if there is really at least a small opening para magkaroon man lang tayo ng recommendations to the client na okay, hindi lang pala siya obstructions. What we can do is to do a surgical procedure or an operation like for example ballooning method para ma-extend po natin or ma-open po natin yung esophagus niya at doon tayo makakapagbigay ng food, or we can also do nasogastric tubing then para mas maging okay siya. Pero even na dinilate ko po yung kanyang esophagus, hindi na talaga siya nag-open. So totally closed na po yung kanyang esophagus. So the abnormal growth was obstructing the normal passage of food through the esophagus. So upon closer inspection, nothing. No entrance po na makakapasok pa ng kahit na any instrument po doon. This suggests that the outgrowth may have led to narrowing or fibrosis of the esophageal wall, which was contributing to the obstruction of the dysphagia. So biopsy sample collected for diagnostic evaluations. As you can see, may mga blood na po kanina here. Kasi dyan na din po ako kumuha ng biopsy. So, to gain better understanding of the lesion, an esophageal biopsy was performed using a cup biopsy forceps, and then the patient condition and preliminary findings were thoroughly discussed with the client. After reviewing the options, the client chose to return to their primary attending veterinarian for continued management and further decision making. So later, the attending veterinarian informed us that based on the poor prognosis and the clinical findings, the client ultimately elected humane euthanasia po. So, yeah. So even we've discussed everything, it's the client discretion pa rin po yun nangyari doon sa patient. Now, we finished sa retrieval ng mga esophageal foreign body objects. So what are the possible complications after endoscopy? So after the foreign body is successfully removed, the esophagus should be thoroughly inspected for any mucosal damage, in which yun yung nakikita din natin kanina, the post-endoscopy check. If endoscopic retrieval of the foreign body succeed and esophageal damage is minimal, again, the patient may be discharged the same day. Here is the list of potential complications to monitor after endoscopy. First is esophagitis, mucosal laceration, esophageal stricture, diverticula, and aspiration pneumonia, in which this aspiration pneumonia is particularly common in brachycephalic dogs and requires close attention. For the limitations and recommendations, there are certain limitations and recommendations associated with endoscopy. It may not always be possible to remove the entire obstruction, as the scope As the scope inserted, a plan should be developed for how to retrieve the object, considering whether it can be safely and effectively removed with minimal manipulation of the scope. If retrieval is not feasible, the traditional approach may be necessary. Alternatively, if the foreign body can be pushed into the stomach, a gastrotomy may be performed to remove it. The availability of the machines and instruments is a significant challenge in the Philippines, particularly in rural areas where surgical operations are often recommended. Other foreign body objects can also be removed by administering emetic drugs, but several factors must be taken into account. For instance, the species of the animal, the type of the foreign body, and any pre-existing conditions or clinical signs should be all carefully addressed or considered before proceeding. So, in conclusion, endoscopy is considered a minimally invasive procedure with a high success rate, making it the first choice method for removing foreign body objects from the upper gastrointestinal tract. So unlike traditional surgery, endoscopy involves smaller incisions or none at all, reducing their overall risk to the patient. While complications can still occur, such as perforation or infection, the risk is generally lower compared to more invasive surgery procedures. Furthermore, recovery time is faster, allowing the patient to heal with less trauma to the body and a shorter hospital stay. The effectiveness of this procedure is influenced by several factors, as I discussed earlier. First, the operator's experience, crucial role, the location, the foreign body object itself, and the instruments used. So basically, while endoscopy is a highly effective and low-risk method for foreign body removal, the outcome depends on a combination of technical expertise, the characteristics of the foreign body, and the appropriate use of the medical tools. Okay, thank you for listening.
Thank you so much, Dr. Harold, for the wonderful and very informative glimpse of esophageal foreign body endoscopic retrieval. So, as a starter, ito very interesting itong tanong na ito, Doc. What would you do if after your endoscopy FBO retrieval procedure, the esophagus developed megaesophagus? How would you explain it to the owner?
Yes. Honestly, before doing those procedures, is sinasabi na talaga natin yung mga risks or complications, which is part po yun, the megaesophagus part po ng explaining doon sa client before doing the procedure na pwede siyang magkaroon. Lalong-lalo na if we put gas or distension of the esophagus. So yes, dinidiscuss na siya bago pa na mangyari po yung procedure. If you're going to ask me na ano pong gagawin natin if there is megaesophagus, we have to know pa rin what is the reason kung bakit nagkaroon siya ng megaesophagus. If there is any complications or systemic infections, then we give those necessary things.
Okay. Doc, is there an attachment for the endoscope that can be used to administer or spray at the specific site? Example, administering or spraying local anesthetic or antiseptic?
None. The thing is, the endoscopy machine, meron po siyang connection to flush. So there is saline or distilled water that can use to flush po yung lens po niya. And you can also clean yung view or image po na makikita po doon. And another thing, if na connection po doon is meron din siyang suction para po magtanggal ng gas po doon.
Okay. Doc, how much is the cost for this endoscopic procedure?
Yes, for the endoscopic procedure of this case, esophageal foreign body object retrieval, in our clinic, I think, and even sa ibang clinic, kasi hindi lang minsan isang clinic ako pumupunta, may mga clinic din na kumukuha po sa akin para gawin lang yung procedure. Since meron sila ng endoscopy machine, pumupunta po ako doon para gawin. It's about 10 to 15,000 range.
Okay.
For that
Doc?
procedure alone po ha, wala pa po yung mga blood tests and everything.
Okay. Doc, if the patient is geriatric and somehow had CKD while having this FBO, which might be common, I am wondering what type of anesthetic procedure we need to choose in this case for this type of endoscopic procedure.
Yeah. So the safest the safest anesthetic is still gas machine pa rin po. So it's the safest. So even yung mga questions nga kaninang umaga, even matanda na siya, we have to be confident enough na gawin yung procedure para at least mawala yung problem or main concern po ng patient po natin. Yeah, so gas anesthesia is the best.
If endoscopic retrieval is not viable, when do you cut and do the surgery?
Yes. So again, if we're going to do the procedure po, upon inserting the endoscopy, dun ka na mag-check, dun ka na magplan, is it okay to do the retrieval? Is it okay na i-pull mo na lang yung foreign body object? Or is it okay na i-push mo na lang yung foreign body object to the stomach para gawin na traditional approach na lang siya? So that's the time po. It's the operator's skill, the knowledge of the practitioner on when to open or to cut for that cases.
Say, for example, Doc, if the foreign body is midway to the thorax, what is your approach? Should you do gastrotomy?
No, it's still again to check pa rin po the type of the foreign body object, the location, the size of the foreign body object, if is it sharp, if is it round areas lang din naman siya, then we can just pull it out din naman po. So I think it's the same thing. So I think, yeah, pareho lang yung question, I think.
Okay. The next question, Doc, ito is my personal question. Say, for example, before performing ba the endoscopic part, nagdi-disclose ka na rin ba? Kasi you have to mention, of course, the cost. Diba? Like, I was prepared lang, Doc, 15,000 plus blah, blah, blah. Tapos biglang, hindi pala kaya. Nagkamali pala ako ng estimate. Ang lalim pala. So, kailangan mo pa rin magpa-opera. So, do you have like certain clients na encounter like that na akala mo kakayanin with endoscopy alone and then somewhat nag-lead pa rin sa surgical intervention?
Yes, definitely po nagkaroon na po ako ng cases na ganoon. The good thing lang is, what ang ginagawa ko on my cases, naglalaan ako ng timeline. So if like for example, in 1 hour, 30 minutes, hindi ko kayang gawin, then okay, I think I have to think on the next step. Is it, am I going to push it or going to the traditional approach po? So I think that's the best thing based on your experience, based on what would be your evaluation to the patient para malaman mo kung kailan ka talaga mag-open.
So there was never a conflict with, syempre, di-disclose mo na dun sa client na magsa-surgery na rin.
Yes, and that is actually a suggestion or recommendations. Like for example, if you do have this machine in your clinic, dun sa consent form po natin, sa surgery, isasama na rin po natin dun sa consent form na if ever hindi kayanin ng surgical procedure na retrieval, then the next po is traditional approach, which is part po ng consent form natin. So, i-discuss din natin siya.
Yes, tama yun. Doc, how will you assess if there is perforation while doing endoscopy alone?
Yes. As you can see, lahat po ng cases ko was a referral cases po talaga. So sila na mismo agad nagche-check kung merong perforations or wala, depending on the barium study. But on my case, or if ako yung nagkaroon ng case po, I would suggest na there is no need for barium study. You can just use the endoscopy kasi part siya ng diagnostics. Check mo doon and that's the time na there is something wrong. There could be a perforation, there could be an abrasion, or there could be a problem. Kasi makikita din naman po natin with clinical signs, like for example, respiratory problem, respiratory distress. There could be factors po doon. So I would do endoscopy first. If there is a problem, then I would also do iodine contrast media, not the barium one, because as we know, if there is a barium media that we use na merong perforations, that could lead to abscessation, there could be a problem with bacterial infection dun sa kanyang respiratory tract. So the iodine solution will be best po.
Okay. Doc, hypothetical. If you cannot pull the foreign body with endoscope, say for example, na-reach mo na yung 1.5 hours, and it is in the esophagus, in the thoracic area, where is your approach? Gastrotomy or esophagotomy? Gostomy in the thorax?
Usually po, depende pa rin po dun sa location po niya. If like for example, nandun na siya sa distal part ng esophagus, then I will try to use the abdominal approach to push down din po. Or, there could be a lot of surgical approach that we can also do. So like for example, we can also do a laparoscopic approach through thoracoscopy para po mas madali lang or mas, again, precise kung ano yung gagawin kasi nga sobrang hirap ng thoracic surgeries. Or like for example, din naman, if nasa neck area lang din siya, then we can just open through the neck din siya. So it's based doon sa location po talaga ng foreign body object.
Ay, thank you, Doc. Bal, ang ganda nung sharing presentation mo sa amin. Sikat na sikat ka na pala. You have a lot of clients all over the Luzon na nagre-refer sa iyo. My question is, of course, we need to start from first step, di ba? My question will direct on paano mo na naging ganyan ka-prestige yung minimally invasive surgery practice mo. Ano yung mga trainings na pinagdaanan mo?
Yes. Thank you so much for that question, my mentor. Yan. So, 2019, I work in Singapore po as a veterinary technician. So, during that days, part po ako ng surgery team o kaya pag day off ko po, lagi akong uma-attend ng surgical procedures para po mag-assist ng mga procedures and even emergencies kahit gabing-gabi na. I remember it's my first, I think, my first flexible endoscopy is nagtanggal po kami ng hook, fish hook doon sa isang pusa. And it's actually good. Sobrang tagal and sobrang meticulous yung approach kasi kahit nasigaw-sigawan ka na, pero wala namang nangyaring gano'n, luckily, is doon po ako nagkaroon ng interest with minimally invasive surgeries. After that one, I also had an experience po na nagkaroon ng laparoscopic procedures. The very basic one in Singapore is the laparoscopic ovariectomy. The thing that you're just going to remove the ovaries and there is no need to remove for the uterus po. So those are just basic po sa ibang bansa and I hope sa Pilipinas ay magiging okay din po siya. After that, in Singapore po, when I came back po here in the Philippines, luckily I have, again, a clinic that is actually very supportive sa kung ano yung gusto ko na marating, which is, nung nangyari po yun, pinunta po nila ako or pinadala nila ako sa China to had a training for laparoscopic procedures po. So I had trainings po to remove ovaries, to do biopsies and everything po. So those are the trainings that could help po na magsimula doon sa ating mga laparoscopic or endoscopic procedures. Other than that, you can also ask for suppliers na nagkakaroon or meron po nitong mga machines na to kasi sila din po talaga nagbibigay ng trainings para po maging okay po doon. And thankfully, meron din po akong isang supplier na nagsusupport din po sa akin to have this kind of practice. So as of now, what I am doing po is focusing on minimally invasive surgeries. What I am doing is the flexible endoscope and even adding my rigid endoscope po. Other than that, we can also do bronchoscopy, thoracic surgeries po. So yeah, I hope na hindi lang yung ibang bansa ang magiging ganito, kundi this is a start po ng pagiging advance ng Pilipinong veterinaryo. Maraming salamat.
Thank you so much. So that's a wrap up for our first speaker. Our second speaker is a visionary veterinarian who is driven to push his boundaries and has a passion for holistic care. He has been practicing veterinary medicine for more than 18 years, locally as well as globally. He is particularly interested in soft tissue surgery, dentistry, dermatology, internal medicine, and integrated veterinary medicine. With a passion for healing and a thirst for knowledge, he pursued excellence in veterinary medicine. He earned his Doctor of Veterinary Medicine degree from Isabela State University and later his master's degree from Pangasinan State University. He is a respected member of the Philippine Veterinary Medical Association and has served in leadership roles, inspiring others with his expertise and commitment. A true pioneer, he is a member and co-founded the Philippine College of Veterinary Surgeons Companion Animals, paving the way for innovative and compassionate care. His commitment to his craft is matched only by his dedication to his own well-being. An avid triathlete enthusiast, he inspires to complete a triathlon in the future. He is also a skilled dragon boat paddler, having competed in various organized competitions during his time in Singapore. He is currently employed at Manila East Veterinary Care and Annapolis Veterinary Care Center as a senior veterinary surgeon. He continues to push the boundaries of veterinary medicine. He remains committed to providing exceptional care and making a positive impact on the lives of his patients and their families. His tale serves as a reminder that with dedication and determination, everything is achievable. Without further ado, Dr. Bong Santos.
Hello po. Good afternoon, everyone. Just to give you a brief description, I am Dr. Romelito Santos, Bong Santos for short, and a graduate of Isabel State University, and at and with a master's at Pangasinan State University. Okay. I'm here to talk about chronic feline gingival stomatitis, surgery, management, and the treatment options. Okay. The objective of this presentation on chronic feline gingival stomatitis will be broken down into several key goals, starting by defining what chronic feline gingival stomatitis is, basically. Provide an overview of its prevalence in cats, including common age, breed, and health status factors. We're also going to discuss the etiology, the diagnosis, the clinical signs and pathophysiology, explaining the underlying causes of FCGS, including the immune-mediated mechanisms, bacterial infections, and viral infection associations. We're also going to discuss the treatment options of this disease, review conservative treatment options, especially like medical management with anti-inflammatory drugs, antibiotics, immunosuppressive drugs, and the pain management. Next is, okay. We're also going to discuss the prognosis management of the disease and provide an overview of the prognosis based on the treatment options and the potential for recurrence even after the interventions itself. And also, discussing the offer insights on the preventative measures such as regular dental checkups, vaccination strategies, and maintaining good hygiene. Additionally, one of our objective is to raise awareness by educating pet owners, veterinarians, veterinary technicians about the severity of the disease and the treatment options of FCGS. Also, encouraging research by highlighting the need for ongoing research into better understanding and managing the condition. And this framework will allow you to provide a comprehensive understanding of FCGS, focusing on the disease, clinical aspects, the treatment strategies, and ongoing management of. I've included here a cat dental anatomy for you to have a look, and then I just wanted to give you a brief description actually of what I always encountered with this kind of disease. Normally, the one that yung mauunang matatanggal talaga dito is this. We will be tackling it later kung bakit ito yung unang-unang teeth na affected during the disease process. Okay? Next. So, may I ask my dear colleague, kapag ka may pumasok sa inyo na client coming in for a regular check-up, who encountered these lesions normally? Do you guys always encounter these lesions? Okay, Ken. So, in definition, stomatitis is an inflammation of the mucous lining of any of the structures in the oral cavity. And the term should be reserved to describe the widespread oral inflammation beyond gingivitis and periodontitis that may also extend to the submucosal lining or the palatoglossal fold, which is this one. And then this is a pathognomonic, layman's term appearance or cobblestone appearance, basically. Okay, and it's actually a debilitating disease marked by severe and chronic inflammation of a cat's gingiva and mucosa, the moist tissue that lines in its oral cavity. And although the condition is most frequently diagnosed among cats with certain viral diseases, especially infections with feline immunovirus or FIV, FCV, FHV, or even FELV. However, it can also cause an abnormal immune response to plague or plague bacteria by a role in the disease progression. But, okay, so ito pala yun. Sorry. At a young age, sometimes ito makikita din natin. Like 6 to 7 months of age, especially sa mga stray cats, minsan nakikita na din po natin ito, itong ganitong lesions. Normally, it started like this. And then eventually, pagka nag-advance na yung diseases, yung unang picture kanina, which is the cobblestone appearance, also develop it later on if this disease advances already. Okay? So, okay. Here are some of the differential diagnoses that we can consider when diagnosing an FCGS. But the thing is, most of it are cancers. Okay. One of the pathognomonic lesion also for feline chronic gingival stomatitis is feline odontoclastic resorptive lesion or tooth resorption basically. And tooth resorption is a very common condition affecting on estimated at least 20 to 60% of all cats. And close to 3/4 of these are 5 years of age and even older. But even at a very young age, sometimes kahit mga 1 to 2 years old, if the immune system is already overreacting and then there's a load of bacteria into the mouth already, resorption already started. So I included also the stages of the tooth resorption, and then stage 5 is already, halos wala ka na makita sa stage 5 basically. And even in here, ang hindi mo, sometimes it can be mistaken this one as the stage 3. Ito, minsan makikita mo normal sa labas. But when you can sometimes just see this in an x-ray. But with these lesions, already you can see it obviously when the cat is fully sedated, whenever you are going to do an oral examination. Okay, so this is a picture of a starting with having a tooth resorption. Nakikita mo na hindi na smooth yung kanyang the roots of the canine. And then, this is what I'm talking about earlier regarding this photo. You can see that the lesion, the enamel outside is actually very normal. But if you're going to take an x-ray, you can actually see it already that it's already resorbing. And by the way, can I ask if you guys have a dental x-ray? Who has it? Okay, how many of you? At least mga 20 to 30%. And 70% or even 80% of us still doesn't have any x-ray, right? So my tip for you guys, for those who doesn't have x-rays, pero ang tawag dito, you can diagnose it by just looking at this tissue area here. Especially when you go deeper and then hawiin mo tong area na to ng tongue, this area, when you take a look inside, the resorption already is happening inside it. Okay? Because the tissue is already damaged and then the bacterial overload is already high. Okay, here's another photo. This area is actually very obvious, the resorption. And then if you're going to take an x-ray, yeah, it's a confirmatory, actually, this one. Next. Let's go for the treatment options. For this debilitating oral condition, usually involves 1 or 2 approaches depending on the severity of the disease. Sometimes, it's just plainly medical management, or sometimes it's, which is the most recommended one is the surgical management. For those cases, especially if you don't have money, they opt to go to the medical management side of thing only. But you have to remember that the medical side has a, tawag dito, hangganan kumbaga. Okay? And it's not a option long term, basically, because you keep on giving medications, giving a lot of immunosuppressions and antibiotics. Giving them long term is not sustainable, and then later on complications may arise. So the best option pa rin is the surgical management, which either you do a full mouth extraction or you do the partial extraction. Okay. A colleague and a friend actually suggested me some journals about feline chronic gingival stomatitis, and then he shared me this, and this is actually quite a good guidance, systematic guidance on how to diagnose a feline chronic gingival stomatitis. Okay, the preoperative state, intraoperative, and postoperative management of the disease. Okay, and let's proceed with my first case. My first case is Fluffy. It's a 5-year-old male, domestic short-haired, and he came with pawing symptoms, and then he is always having halitosis, mabaho yung hininga, and then sometimes drooling excessively according to the pet owner. And then when he came to the clinic, we performed CBC. There is a leukocytosis, granulocytosis, and lymphocytosis. And the full mouth extraction was performed January of 2021. Okay, so my postoperative treatment is this clindamycin at 11 milligram per kilogram twice a day, meloxicam, and buprenorphine. Actually, this case is in Singapore, and unfortunately, we do not have buprenorphine here in the Philippines yet. It's difficult for me actually to source it out, and even what else I'm using, the methadone or the butorphanol. So, in the Philippines, I'm using tramadol or even gabapentin for my pain relievers. So this is Fluffy. After 2 weeks of recheck, after the full mouth extraction already. Okay. Let's go to my second case. My second case is Prince. It's a domestic short-haired male, 6 years old, and also FIB positive. His CBC is mild leukocytosis with the granulocytosis, and the full mouth extraction was performed on September 2021 as well. On the physical examination, Prince was bright and alert and responsive still, with a mild dehydration as noted. And on the oral findings, a severe gingival inflammation or ulceration is present. Gums were very reddened, swollen, and it sometimes bled easily, especially when you're opening the mouth. Here, in this area, is very sensitive, and once you open it like that, because it's very brittle, the gums in here, it easily bleed completely. And also with a significant plaque accumulation with moderate gingival tartar buildup. And the gingival recession is very obvious also. Okay, so same thing. My postoperative care is antibiotic and pain management, and clindamycin, and meloxicam, and buprenorphine. Normally, my antibiotic course is at least 10 days. Depende sa severity ng infection. Sometimes I will do it until 14 to 20 days, depending on how they respond with the treatment. And my case number 3 is a partial tooth extraction. This is a case in the Philippines, and I took over from a colleague. And Tom was rescued domestic short-haired in the Philippines and is a male estimated at least 5 years old upon rescue. And Tom is an FCB positive. And Tom underwent at least 2 dental prophylaxis already with a partial extraction on this second dental prophylaxis. Okay. Unfortunately, there is no oral radiographs performed due to the lack of equipment, and although the tooth resorption lesions were very visible already and it's very obvious during the dental prophylaxis. For the blood work, he was positive with calicivirus. No further confirmatory diagnosis due to the owner's lack of finances as well, and he's a budget constraint. And there were elevated liver enzymes noted, likely secondary to oral diseases and chronic inflammations. And Tom received liver supplements prior to the secondary procedure. Okay, so this is the antibiotic culture and sensitivity performed to Tom, conducted twice for me to monitor if the medications that I use are still responsive or not. Okay, so the outcome of the management for Tom is basically after 2 months, he relapses, and then symptoms treatment was initiated as the owner was hesitant already about the another general anesthesia and a full mouth extraction. Medyo naaawa na kasi yung pet owner that time. CBC and biochemistry were monitored, particularly focusing on the organ functions. 2 antibiotic culture and sensitivities were performed to ensure the resistance to the antibiotic use. And Tom received cephalosporins, antibiotics including cefovecin and cefuroximes during the last few months of his life due to infection. Administering oral medications to Tom is actually one of the difficult scenarios for the pet owner because he is quite feisty and he is not a very cooperative case. That's the reason why the owner has opted to injectable antibiotics, and that's the reason why also I keep on doing my culture and sensitivity to make sure that he is not resistant with either cephalosporin or the cefuroxime that I use during the time of treatment course. Also, methylprednisolone was administered at least every 3 to 4 weeks or whenever oral mucosa inflammation recurs. And sadly, Tom did not survive due to several complications already and developed during the treatment process. Okay. Why full mouth extraction? Because it requires the minimization of the oral bacteria, and it's the most favorable clinical control for resolution of oral inflammation is via partial or the full mouth extraction. And studies indicate that the partial removal of all premolar and molar teeth or the full mouth extraction yields to the best long-term outcomes for cats. These findings reveal that about at least 70 to 80% of cats experience significant improvement or complete resolution of feline chronic gingivous stomatitis, while approximately at least 20 to 30% show the little improvement. Okay, for postoperative care treatments, of course, anti-inflammatory will be dispensed most of the procedures and will help with any pain after extractions, and also the importance of feeding tube as well. This will help with the, especially if you do a full mouth extraction, this is really needed. Mainly because it's for the nutritional support, making sure that the adequate nutrition during the recovery period is not as painful. And hydration status facilitates fluid intake in the cats is when it's reluctant to drink. Also, it minimizes the stress as well. When you are doing a feeding tube, when you are placing a feeding tube, because imagine you yourself, napakasakit ng bunganga mo, and then you syringe feed your cat, opening it some more, and it's very infected, it's really painful. So, might as well, it's either you place a NGT, nasogastric tube, or since your cat is already sedated, and then why just don't place a feeding tube already? So, it's even much better. Because you can place a bigger French, wider French rather than the narrowing one. Because if you put it on the nasogastric, it's the tube is narrower, and placing a liquid in this area is not as smooth compared to the esophageal. Okay, this is a picture of a cat that's placing a feeding tube. Okay, we just shave the neck area, disinfect the area so that it's not going to be contaminated when you place a feeding tube, because you're going to create a wound in here as well. Okay, this picture showing how we are going to secure the feeding tube actually. Chinese strap, what we call it Chinese strap, so that it won't, dislodge easily when you are placing a tube. Sometimes what they does is they put also a glue, yung super glue, so that it's not so slippery when okay. In here, it's very important for you guys to do and perform an X-ray if you place a feeding tube. It will help us to avoid complications like, aspiration pneumonia, because this tube can easily go to a wrong pipe rather than in the right pipe. Okay? If you don't have an X-ray, there's one thing again that we can test. May I ask, who can answer? It's a negative pressure. What else? When you're going to aspirate the tube, what can you aspirate? Gastric juice. Yes, correct. Thank you for that answer. Okay. Oops, sorry. Wait lang, may nawala. Okay, as a veterinarian, and you may consider also using antibiotics in conjunction with the full mouth extraction. Okay, and as a treatment measure for chronic gingival stomatitis, especially under certain conditions, you are placing a tube here, and then of course you are creating something that can penetrate, bacteria may penetrate. So pre-operative, post-operative, and then the severity of the case is very important in using antibiotic for us to not complicate the culture. And sensitivity also is if there's a recurrent or stubborn infections, consider performing this, a culture and sensitivity test, to guide the antibiotic choices also that we can use during the recovery period. And carefully monitor the patient for signs of infection post-surgery, and adjust antibiotic therapy as needed based on the clinical response also of the disease. Okay, ultimately, The decisions also to use antibiotics should be based on the individual patient's condition, the severity of the case, so you really can assess if it's needed or not. And it's an essential to balance the benefits of antibiotic use with the risk of resistance and adverse effects. Okay. Here are also some of the immunomodulators that we use. Cyclosporin, glucocorticoids or prednisolone, around 0.5 to 1 milligram per kilogram body weight, 24 to 48 hours on a taper dosage, and NSAID. So what I use here is meloxicam and tolfenamic acid. And I think even also carprofen, sometimes we are using it. Pain relievers. Unfortunately, these two, like I said earlier, buprenorphine and butorphanol, we don't have it in the Philippines, but we have the tramadol, luckily, and the gabapentin that we can use to manage the pain during the recovery period of the patient. Okay, so for the prevention measures, regular dental care to remove plaque and tartar buildup, daily brushing with toothpaste formulated for pets to help maintain the oral hygiene, provide dental chews and toys to help break down any dental tartar that's been formed in there, and reduce stress reduction, minimizing the stress on environment, as stress can contribute to immune response issues that may exacerbate the oral condition. And by implementing these measures, pet owners can significantly reduce the risk of chronic gingival stomatitis and promote a better overall oral health in their pets. Okay. In conclusion, full mouth extraction is a highly effective treatment for chronic gingival stomatitis in dogs and cats, offering significant long-term relief from pain and inflammation associated with this debilitating condition. By removing all the teeth, the procedure eliminates the source of persistent bacterial infection and facilitates healing, leading to improved quality of life for affected pets. Ultimately, full mouth extraction allows pets to thrive in the absence of oral discomfort, underscoring its importance as a viable solution for managing chronic gingival stomatitis. Okay, that's it. Thank you, guys, for listening.
Thank you so much, Dr. Santos. Sabi nga, sino po ang nagsabi nito? You can't discover new oceans if you are afraid to leave the shore.
Yes.
By yours truly ba yan?
No, exactly defines me.
Palakpakan naman ulit natin si Doc Bo. Okay, Doc, ang dami na ng questions, pero ito yung isa sa ating number one question. How do you close a fistula? Do you perform debridement? If so, what instruments do you use for debridement? Yun muna.
Okay, I haven't closed a fistula, to be honest. So I am not able to answer the question, but I am open for a training on how to close a fistula. Although I have an idea, it's just that I don't know how to perform it yet properly.
Okay.
Yeah.
Doc, what are the common complications or issues that can occur after surgery?
The common complications that we can, sometimes for the complication,
Post-operative.
for the post-operative.
Oo, after.
Whenever the cat is not cooperative enough, sometimes it's very difficult. Of course, if the cat is already on an NGT, it's easy. But then, sometimes, unavoidable infections also may arise. So, regardless of the antibiotic that we use, if happens, there were iatrogenic infections happen in the hospital. Sometimes that cannot be avoided also. But so far, big complications hindi ko pa naman po na-encounter. Yes.
Okay, Doc, during your first cases of performing a full mouth extraction, what mistakes did you make or what lessons did you learn as a beginner?
Okay, as a beginner, you have to be very careful when you are extracting a tooth. It happens to me one time already. Okay? Say for example, this is your elevator. You do not put your finger in here. You put your finger in here, just close to this, so that you have a very good manipulation. Because if you put it here, you don't have a control, and then mamaya mapoke mo yung areas dito, and then these areas are full of nerves, arteries that we don't want to damage, and then later on this can complicate the patient already. So you can avoid that by just doing this. At least maybe 1 cm to 1 inch yung ano mo. Yung para if you're doing this, at least.
Okay. Doc, do you have any alternative treatment or rather any temporary treatment if the client cannot afford full mouth extraction? So Doc, magkano muna yung range ng full mouth extraction?
In our clinic, we charge it per tooth. And
How
then
much?
we follow the PAHA rate. Yeah, and mainly I do not do the quotation, so I'm not really particular how much it costs. But for the anesthesia, I guess I can give you how much it costs for the anesthesia. And then cost of anesthesia, at least 3,500 for the gas anesthesia. And then subsequently, around 500 per 30 minutes, things like that. I think I can remember how much is for the simple extraction. Yes, we charge it 250. Yeah, per teeth. Yeah, per teeth. Yes, and then of course the injections and the hospitalizations, the feeding tube wise when it's placing it, I am not really sure how much it costs. Yeah.
Okay. In your cases, what is the most common cause of FCGS? Can you immediately consider full mouth extraction during the first visit?
Not really. It depends really on the situation. I would rather just do a partial extraction rather than the full mouth extraction if the teeth are still healthy. It's so difficult to remove a teeth that's healthy. So I'd rather not do a full mouth extraction. And that goes with your question earlier for the clients who cannot afford the full mouth extraction, right? You assess the condition if it's really needed a full mouth extraction or not. You can always tell or suggest the pet owners to give to perform only maybe a partial extraction, tooth extraction.
Okay, Doc, hypothetical. If full mouth extraction was performed, given the extraction was properly done, no retained roots were seen on the radiograph, and gingivous stomatitis is still present, how will you manage it?
Immunomodulators. Still, we go back to the long-term treatment, the long-term management of the disease. Like I said earlier, there's one colleague who suggested me this journal, the one that I showed you earlier. I suggested me about the interferon omega that we can use only if the cat has a viral infections. Of course, we can use that. Other than that, we can also combine it with immunomodulators also.
Okay. Doc, do you consider using laser therapy after doing dental extraction? If so, what is your protocol? How often and how long?
For the laser therapy, I do not practice, so I am not really sure about it. Although I think I've spoken to Dr. Ken before. He told me about the help of the pain management. When I think we can also apply that as well to patients who just undergone a full mouth extraction or partial extraction.
Okay. Did you perform local blocks before extraction, Doc?
Yes.
And about your post-op, ano yung protocol?
For
Post-operative.
just pain management will do.
NGT.
Yes, NGT, yes. It's either NGT or the esophageal gastric tube.
If, for example, there's no NGT, how many hours can we feed the patient after the procedure?
Once they're fully awake already, normally I often offer a little bit of water, and then if there is no vomiting within the next 30 minutes to 40 minutes, I start offering a liquid diet already. Yeah.
Say, for example, Doc, if the client cannot afford the full mouth extraction, what can you say about the monthly injections of methylprednisolone?
It's good, but like I said, it's not sustainable long term because the last one that I had was on a long-term methylprednisolone actually, and during the treatment period, I struggle with the kidney values and the liver values. Regardless if I am giving any liver or a kidney supplement, it still happens. So long term of this use is really it's not really sustainable also. And yeah, there's always an end into it.
Doc, in full mouth extraction, do you really remove all the teeth or do you leave the canines?
For the full mouth extraction, depends. Like I said, I'd rather do a partial extraction for a dog, for a cat that has a leftover healthy teeth rather than taking it out that healthy teeth, because it takes some time for me to, extract a teeth that's still healthy. If the canine is already unhealthy, I'm going to remove it. Yeah, especially if there is already a gum recessions, you have to take it out. Otherwise, it will just keep on relapsing.
Doc, if oral radiograph is not available, is it still advisable to pursue full mouth extraction?
Okay, one of my pictures earlier, I actually give a tip on how to assess if there are resorption, you can do the partial. You can do the extraction. Yeah. And
Even without the radiograph?
Well, if there's already a continuous infection in the gingiva and then there's recession already, you really have to remove the teeth. Yeah.
How long, Doc, was the steroids given?
What do you mean?
If magbibigay ng steroids, most likely, how long mo siya pwedeng ibigay? Maybe that's the question.
Okay. For the methylprednisolone, because this one is a long-acting one, right? So every 3 to 4 weeks yung ginagawa kong or it depends on the clinical manifestation of the disease. If there is no manifestation even after 4 weeks, I am not going to give any steroids. I'd rather wanted to buy time than giving on consistent medication onto that patient, so that we can stretch a little bit of the efficacy of the steroid, because sometimes it really depends on each patient on how they respond with the treatment. So for the oral ones, I normally just give at least 10 to 14 days of treatment on a tapering dosage, and then I will ask them to come back for me to modify the dosage if it's necessary.
Okay.
Yeah.
So ito naman, in cases where full mouth extraction was performed, is bone resorption of the mandible a concern? Have there been cases that it was observed after mo na mag full mouth extraction, Doc?
I haven't encountered yet. Yeah.
Have you used interferon in FCGS?
It was already introduced to me, and I'm excited to start using this one. Just like what was, I think a few months ago, someone asked me about 1TDC also. So I read about it and I got so excited because I only knew it here in the Philippines. So I'm on the process of using it already, and then the efficacy is quite promising to me. It helps with some of my cases with the FCGS, it really helps to reduce also the inflammation.
Okay. Would you agree that FCGS is mostly underdiagnosed with simple stomatitis? What can you suggest or what tips can you give for non-compliant owners?
At the end of the day, still their their pet. So regardless of how much explanation I am going to to tell them, if they are not really compliant, I cannot really help them also. But because this is a very complicated case that you really, and it's a very time consuming one. Sometimes even after a week, they keep on coming back to me. Medyo tawag dito? Madugo, even on the pocket. Yeah.
Yeah. Doc, ito, basic siya. Can you explain what is happening in tooth resorption? Why does it cause inflammation or the FCGS?
Because of the overreaction of the bacteria in here. So if there is a bacteria in the gums, and then it's also starting to resorb already. Yeah, it's consuming.
So can it go directly to the heart, yung problem sa mouth? Because that's what the dentist told us, diba, sa tao. If you have problems sa teeth, hindi mo na-address, it can cause cardiovascular diseases.
Systematically, yes. Kasi it also affects the underlying nerve and veins dun sa sa area na.
So when you do the extraction, Doc, kino-consider din ba ninyo sa clinic yung sa blood chem, yung sa electrolytes and everything, or wala namang restrictions?
Before I do my dental procedures, I always make sure that there is always a blood clearance. Yes, regardless. In every surgery. There's always a blood clearance. Especially here in the Philippines, oh my goodness, you can see a lot of thrombocytopenia here.
Yes.
I'm so scared about it.
Doc, is it also related to calcium deficiency since tooth is being resorbed? So maybe the doctor was pertaining to the tooth resorption.
I think tooth resorption is most likely due to the infection that's attacking the teeth.
So it's not related to calcium.
Yeah.
So Doc, about the cobblestone appearance in the mouth, do you surgically remove it and do you send samples to the lab?
I did once. It just came back as an inflammatory process only. And I don't remove it because it's part of the tissue that's just inflamed in the area. Yeah. Hindi naman siya cancer. So I don't think it's necessary for me to remove it. You just need to control the infection because that's the one that's causing the cobblestone appearance into the palatoglossal area.
Okay. Doc, is FCGS related to viral infection or more on bacterial infection or both?
Both.
Both, bacterial and
both
viral.
In a way that what the viral does is that, especially FIV, right? So what it does, it exacerbates the problem. So the immune system becomes immunocompromised, and here comes the underlying bacterial infection that's living into the teeth, in the area of the teeth, and then there is no way for that immune system to fight back the bacteria here. So yeah, it just exacerbates the problem.
Okay, now the next question is from Dr. Win. Do you proceed anemic patients to undergo dental extraction?
No.
No. So how long will you treat first?
It depends. Depends on what kind of it depends on what values of the anemia it is. Yung alin, yung anemia. I give at least 2 weeks, and then and then recheck the blood test again. And then if it's okay, then that's it.
Hi, Doc Bong. I have a compound comments and questions. First, dito, I attended one lecture by a specialist saying that there's no difference between partial and full mouth extraction. So I guess yun din yung sa case mo dito eh. Kasi even when you perform full mouth,
yes,
nagre-relapse yung pasyente. So
Correct.
it's not guarantee when you remove all the teeth is magiging back to normal yung patient. The question with that is, why is that so? Bakit yung partial or full mouth removal, extraction, ay hindi guarantee na magre-resolve yung case kung this is a simple bacterial problem? Ano yung mga factors that should be considered?
The thing with it is it's also immune-mediated related issue that it just exacerbates this infectious part of the disease, the viral and then the bacterial infection thing. So that's the reason why one of my in one of my slides, at least how many percents? There will still be relapses between at least 20 to 30%. So let's see, we are still going back with the treatment of the long-term management pa rin kapag kaganon.
So what I'm getting here is basically ang gusto lang natin ma-achieve is a less painful life.
Yes.
Parang ganun,
less
no?
painful life, yes.
Less painful.
Yes, because full mouth extraction is not a 100% guarantee, but it will help for the patient to thrive, comfortably.
Yes, I guess siguro kailangan natin ma-emphasize yun during
Mm.
client education na
Yes.
even when we refer this to a specialist,
Yes.
hindi guarantee na treatable.
Yes.
Siguro another question is, have you experienced complications with methylprednisolone? Kasi I, for one, would say na there are cases that develops diabetes by chronic injections ng methylpred. So, did you consider that when deciding to add methylpred in this case?
Kaya tawag dito, that's the reason why I always do my blood chemistries, because easily it can affect the liver. So I don't have any. What else is the immunomodulator that we're using? It's the cyclosporine, right? It's expensive, and methylprednisolone is one of the cheapest. So considering the Philippine, market, the clients here are not all capable enough to buy cyclosporine. So we end up going to use methylprednisolone. But of course, we are always going to use it with caution and a proper explanation to the clients, educate them that this is the side effects of this case, of these drugs, and then so that they know what to expect in the future. And then no arguments will be happening.
Hello, Doc. Doc, good afternoon.
Hey, good
I
afternoon.
have 3 questions. So yung first one, if the cat has FCGS and CKD at the same time, paano yung magiging treatment plan mo doon? Then second, what is your take about amantadine? And then the third one is, saan magandang location for biopsy para sa FCGS?
Okay. Going to your first question, one of my case earlier, the third one, Tom, he died from organ failure. He developed a stage 4 CKD already, and then liver. So my worry is not all about the mouth anymore. My worry is all about the organ functions, the kidney, and dito po mapasok yung internal medicine side of it. So you have, normally what I do, I disregard the mouth. What I need to treat first is the organ, because they are the one that's filtrating the medications that you've been giving. So you have to correct that one first before you giving again another sets of medication to treat the oral problems. And then with the question earlier that you told me about where is the good location, it depends. Ano bang gusto nating makita? Are we looking for cancers? So anywhere part of the mouth, you can collect a sample. But if there is a cobblestone appearance in the palatoglossal area, I think it's a good area in there to get a sample also. I did try once, and it just came as a inflammatory process only. So I don't think for me, since then, I seldom do the biopsy already because, yeah, that's basically it. And I think there's one more, right?
Amantadine, Doc.
About the amantadine. Do we have amantadine in Philippines? I'm not really sure because in Singapore we do have it there. Yeah, we can use amantadine basically.
Doc, ang hindi ko nakita kanina, yung what suture type do you use for closure kung after you do the full mouth extraction?
Oh, absorbable sutures. Yeah.
For aught?
Yes,
Okay.
absorbable.
Size, Doc?
Sa cats, I normally use 4. And I use the braided one. The silk.
Absorbable.
Yeah, absorbable. Sorry, silk ba yun? Yung the braided, yung ginagamit dito sa Pilipinas. Hindi yung parang, oo, yun. PD. But, yeah, it's unabsorbable. The one that, is that polyglactin? Yes.
Okay. Tas, Doc, since we've mentioned po, no, we still have 6 more minutes na you are into a holistic care, veterinarian. So, when it comes to that, na-pass through mo na yung elemental side of surgical intervention, yung management na lang at home. Ano yung most important na sinasabi mo as part of the client education?
Less stress for the cats.
Feeding management.
The feeding management side is if you have the thing is it's very difficult if there is a multi-household cats. So that's one thing, and then it's for the feeding management. Well, it's always a soft diet that we can introduce it to them, but there are cats that doesn't really like the wet food, so they end up getting still the hard ones, the kibbles. So what I always told them sometimes is they can still have the dry food, the kibbles, but they can blend it into smaller pieces so that it's not so big when they chew it, and then they can just swallow it, something like that.
Doc, for the recheck, how many weeks kailangan bumalik?
After surgery?
Yeah, post-op.
I normally, regardless of what kind of surgery, I always wanted to see my patients during the 3rd to 5th day of the surgery, from the surgery, and then after the suture material, so basically that's 10 to 14 days. Yeah. So they basically need to see me at least twice.
For antibiotic use, may preference ka ba for dental?
I have 2 favorite ones, the clindamycin and the coamoxiclav. But in the case of some culture and sensitivity reports, of course you have to follow that one. The one that's sensitive from the result.
For example, meron kang patient, which is,
yep.
Yeah, ganito. Merong feline gingivitis. Have you ever considered giving them interferon, tapos minix mo siya sa sodium chloride, and then treated for around 90 days? Have you tried using that instead of extracting everything?
I haven't tried that one yet, and I'm about to try.
Because
if you have experience, I think I wanted to talk to you about it.
Yeah, based on my experience, I've had cases, actually 3 cases, na they became okay after using interferon. Virbagent omega, I think that's the name.
Yes.
Yes.
That's the
And-
one that I'm going to try actually.
But depending on the grade ng resorption, bone
Exactly,
resorption.
yes.
Oo. So, malamang mas mauuwi rin sila sa tooth extraction. Yeah. So, you haven't tried using it, right?
I haven't tried using it, and I wanted to try using it also because I see some, based on what was presented to me by one of the colleague in the market. It's quite very promising drug, the Virbagent omega.
Hi, Doc. Last question, Doc. Just want to ask if this chronic feline gingival stomatitis is zoonotic to other, or is it easily transmissible to other cats? Or is it transmissible?
I don't think so. It's an immune-mediated issue, and it can be transmissible, yes, in the sense that if the cat is positive with some sort of a viral infection, I guess. Yeah, because it, it's one of the, cause of the disease.
Yes, so I think it's a wrap up. Thank you so much, Dr. Santos. Congratulations again. And for us to know more about the third speaker, let me call on my partner, Dr. Chris Lau, for the introduction.
Dr. Janilyn Alcantara Valdez began her veterinary journey as a junior veterinarian in 2006 at Noah's Ark Animal Clinic in Nueva Ecija, where she cultivated her clinical expertise and deepened her passion for animal care. She later transitioned to the role of animal health specialist at Foster Foods Incorporated, gaining significant experience in managing animal health on a broader scale. From 2009 to 2015, she expanded her knowledge and skills as a veterinary technician in Singapore, specializing in diagnostics, advanced veterinary medicine, and animal welfare. In 2015, fueled by her commitment to exceptional veterinary care, she founded Fairy Tales Veterinary Clinic in Project 4, Quezon City. This clinic has since grown into a network of branches, reflecting her dedication to animal health and welfare. Dr. Valdez became an associate member of the Philippine College of Canine and Feline Practitioners on January 29, 2025. She remains committed to enhancing her practice and advancing animal care by regularly participating in both local and international seminars and training programs. Let's all welcome Dr. Janilyn Alcantara Valdez.
So thank you, Doc Chris. So it's a pleasure to be here and to share you some truly rewarding and challenging cases. So my passion lies in veterinary internal medicine and surgery with a strong focus on ophthalmology, orthopedics, and rehabilitation. So today, I'm excited to present a case report titled Management of Non-Healing Corneal Ulceration in Dogs, a Comparative Case Report. So this case study highlights the successful management of two special cases. I have the 7-year-old Boston Terrier with a severe corneal ulcer that progressed into a descemetocele. And I have a 7-year-old Jack Russell Terrier with superficial indolent ulcer. So to begin, let's start with a quick review of canine eye anatomy. So for this presentation, I will be focusing on two key structures. We have the cornea and the conjunctiva. Okay, the cornea is the clear window of the eye. So it's the outermost layer of the eye. It's actually very thin and it is transparent. So it is transparent primarily because the cornea has no blood vessels. So it is made up of 3 layers, okay, so which are arranged like those of a sandwich. Okay, we have the epithelium, okay, the outer layer of the cornea, and we have the stroma, which is the thick middle layer. And we have the endothelium, the single cell thick inner layer of the cornea. And just above the endothelium, we have a special structure called the Descemet's membrane. So this structure helps protect the eye from deeper infection or deeper penetrating insults to the eye. Now, what is a non-healing corneal ulcer? So these are often called indolent ulcers. They go by the acronym SCEDS, which stands for Spontaneous Chronic Corneal Epithelial Defects. So they are essentially superficial erosions that on the cornea that fail to heal normally. Okay, so unlike regular scratches that heal in days, these ulcers can linger for weeks or even months. So why don't they heal? So bakit hindi sila gumagaling? So on these cases, the epithelium, which is the outer corneal layer of the eye, is loosely attached and doesn't stick to the stroma underneath. Okay, basically there's a formation of a hyaline layer na tinatawag on the stroma that blocks new cells from anchoring. Okay. Because of this, they don't heal on their own and need intervention for that matter. Now, why do these ulcers happen? Okay, so the cause of indolent ulcers is actually multifactorial, but the main issue is that there is a poor epithelial adhesion to the stroma, and because in healthy eyes, the new epithelial cells stick tightly to the corneal stroma for the cornea to heal. Okay, but in SCEDS, during these cases, this attachment is defective. It is often due to problems at the basement membrane or deeper layers of the eye. So what are the contributing factors? So number 1 is the genetics. So some breeds like the boxers have known a NOG gene mutation which is associated for this defect. And of course, we have age and breed predispositions. So these conditions are often seen or common in middle-aged to older dogs, and of course to the breeds which are the brachycephalic ones. And it is very important to note that these conditions can occur spontaneously. So these ulcers can appear even without trauma or even with a minor trauma. Now, what do these indolent ulcers look like clinically? So number 1, they are considered chronic. So healing takes about weeks or even months, not days. And dogs often show signs of eye discomfort, such as excessive tearing, which we call the epiphora. And we can also observe some squinting or blinking, which we call the blepharospasm. And conjunctivitis also, we can observe that, including the occasional mucoid or whitish discharge. Now, on the eye exam, the ulcer is usually superficial. It's usually just in the epithelium. And these ulcers often appear to improve and then flare up again because the new epithelial layer fails to anchor. So the key point is that this ulceration doesn't heal with antibiotic therapy alone. Now, let me share you the objectives of this case report. So number 1 is to evaluate the effectiveness of 2 treatments. So we have the conjunctival pedicle grafting for deep ulcers. We have the diamond burr debridement for indolent ulcers. Second is to compare surgical versus minimally invasive techniques, looking at the healing outcomes, the complications, and recovery time. And last is to provide practical insights to help veterinarians choose the most appropriate treatment based on ulcer depth and chronicity. So how do we diagnose non-healing corneal ulcers? So of course, we need to start with a very good clinical eye exam. So we can use an ophthalmoscope or slit lamp biomicroscopy if you have one to assess the cornea and the surrounding structures of the eye. And next would be the Schirmer tear test or the STT. Okay, so this procedure checks for tear production, and it is very important since dry eye can delay healing. And next would be the fluorescent stain. Okay, so the fluorescent stain highlights corneal defects and also shows the depth and severity of the ulcer. And last but not the least is the cytology and culture. So these are very special, especially in chronic cases where we need to detect infection, and this can help guide us for treatment or what antibiotics are we going to use. So to summarize, these are the diagnostic tools that can give the picture of the cause of the ulcers, and it helps us to guide also what treatment modalities are we going to use. Now, after knowing how to diagnose these ulcerations, so what are we need to know or to expect using these diagnostic tools? So we start with the superficial corneal ulcer. Okay, so these superficial ulcers are limited to the epithelium, as you can see on the illustration, so they don't go deeper. And in STT, usually we can see a normal or mildly decreased depending if the patient has a concurrent KCS or dry eye. But in fluorescent stain, which it highlights only the epithelial loss, which can be seen as the bright green area there. And in cytology, we usually see no organisms or few to no inflammatory cells, which suggests that this kind of ulcer, usually infection is not present. So the takeaway is that these findings help us to distinguish or differentiate superficial ulcers from the deeper or infected ones. Now, what about for SCEDs or yung indolent ulcers na sinasabi natin kanina? So, these ulcers look superficial. Okay, they are still superficial, but as I've said, they fail to heal properly. Okay, so the classical sign would be the loose, non-adherent epithelium with a rolled edge seen on the eye exam. And since it is considered still a superficial, so in STT, usually it's still normal, or if KCS is present, it will be reduced. But in fluorescent stain, it shows epithelial loss, but the hallmark is that the presence of a halo or undermined margin around the corneal ulcerations, which you can see at the picture. And in cytology, they may show mild inflammation, but cultures are often negative unless there's a secondary bacterial infection. So the key point is that recognizing these features early is crucial to choosing the right treatment approach. Now, what about on deep stromal ulcers? So the illustration shows the ulcer penetration deep into the cornea, all right, or deep into the stroma. And in the STT, this may show reduced tear production due to the pain reflex or possible concurrent also for dry eye. But in the fluorescent stain, so you may see a deep, uneven dye uptake, as you can see in the picture, which indicates stromal loss. And for cytology, it often shows bacteria and neutrophilic or mixed inflammation, which helps us to target the antimicrobial therapy. So the bottom line is that these ulcers are serious because there is a deep involvement and possible infection, and so that you have to make an accurate diagnosis, critical for effective treatment. Now, what about for the dexamethasone? Okay. So this is actually an advanced ulcer. Okay, as you can see, the cornea has thinned down to the Descemet's membrane, creating a bulging sac. And actually, this is a high risk of rupture. So yung bulging sac na nakikita natin, that's why it's called Descemetocele. And the illustration shows the near full thickness corneal loss. So in STT, okay, what we can see is decrease due to pain, just like the deep stromal ulceration. But in fluorescent stain, so this is the hallmark of this condition or ulceration. So typically we see a donut sign, okay? So it appears like a donut. So basically, nagpo-pull around yung dye, around the corneal ulcerations, or it could pull down also below, and then it doesn't stain at the center. So it doesn't stain the center because yung Descemet's membrane is actually not absorbing the dye, since hydrophobic si Descemet's membrane. Okay, so in cytology, it may reveal severe neutrophilic or mixed inflammation, and possibly bacterial infection as well. So this is considered as a veterinary ophthalmology emergency, actually. Now, learning how to diagnose these kinds of ulcerations, we need to address or do an initial medical management as well. And before we jump into advanced procedures, it is important to manage these cases medically. So before surgery, we can start with medical management. Okay, step 1 would be infection control or prevention. So we can use topical antibiotics. And during or for chronic cases or melting ulcers, we can actually consider anticollagenase therapy. Example of that is the autologous serum. So who among sa audience po natin ang nakapag-try na po ng autologous serum? So si Doc. Okay, Doc. Okay, so for anticollagenase therapy, so we can either use the autologous serum, or we can actually use also the doxycycline, which is known to have this effect. And next step would be the providing pain relief to the patient. Okay, so what can we use for that, okay? So we could either use topical atropine drops, okay, to dilate the pupil and relieve ciliary spasms. Okay, another option would be the systemic analgesics to provide comfort for our patient. And of course, we don't forget to prevent self-trauma to the patient by giving Elizabethan collar. And to provide also a supportive care, such as giving lubricating drops to the patient to maintain or to keep the cornea moist. The key takeaway is that this initial medical management can prepare the eye to heal or even prepare it for next procedure or surgery, but alone they are not enough to heal the indolent ulcers. Now, I would like to share a brief description of the procedure of the autologous serum that we do in our clinic. So, as much as possible, we have to do it as aseptic as possible. So we usually draw 10 to 15 mLs of the patient blood and then put it onto the sterile plain tube or clot activating tube. Then it will be followed by centrifugation. Okay, so after letting it clot at room temperature, we then centrifuge it to separate the serum from the cells. Okay, so this gives us clear, protein-rich serum with growth factors and anti-inflammatory cells. Now, after that, we need to harvest the serum, okay? So we carefully extract the serum using a sterile pipette. Again, we have to do it aseptic, or a sterile syringe to avoid contamination. So we can store it into an amber-colored dropper bottles, also aseptic, to protect the serum from the light. So in our practice, we store it for 7 days under refrigeration, and we use that as the topical eye drops for the patient for 4 times a day. Okay, and this is the QR code. This is a reference for more detailed step-by-step procedure of the preparation of the autologous serum. So you can take a picture of it. Now, after the initial medical management, of course, we're going to talk about the conservative treatment options for these kind of ulcerations. Okay, so number one, so there are a lot of conservative treatment options, but I will be discussing the most common ones. So number one would be the CTAD, or the cotton tip applicator debridement. So it is done under topical anesthesia. So typically we gently rub off loose dead epithelium by using a sterile cotton tip. And then the goal is that to create a fresh edge so new cells can anchor. And it is a very simple, low cost, no special tools needed. The success rate is about 50 to 65%. But since the success rate is not too high, the ulcers may recur if only debrided once. So we might need to debride again if the ulcerations recur. The second one is more invasive than the first one. It's called the GK, or the grid keratotomy. Okay, so for stubborn cases, this procedure is done by scratching tiny grooves, or just like creating a crosshatch pattern into the superficial cornea using a needle. So this helps epithelial cells to stick and break down the hyaline barrier na sinasabi natin kanina. So the success rate is higher than the CTAD, but it carries risk of scarring or infection. So it must be done under strict sterile conditions. Okay, so the idea is that you can start with the CTAD, and if the debridement fails, you can go to the grid keratotomy. However, you have to weigh the risks and the benefits of the second procedure. Now, we proceed to the diamond burr debridement. This is actually a preferred option for indolent ulcers. Okay, so this procedure uses a rotary burr tool with a diamond-coated tip to remove loose epithelium and to smoothen the stromal surface. Okay, so this is usually done under a brief general anesthesia or heavy sedation. And why is it effective? It's because, number one, it removes the non-adherent epithelium na discussed natin earlier. Number two is that it polishes the stroma, which enhance epithelial adhesions. So the success rate is about 85 to 90%. And the advantages is that it is still considered a minimally invasive technique since it's not a full surgery. It can produce a smoother and safer than scratching compared to the grid keratotomy. And what about for ulcerations that are complicated? Okay, so we have two surgical interventions here. Okay, I will be discussing the superficial keratectomy and the conjunctival pedicle graft. Now, in superficial keratectomy, okay, it involves the surgical removal of the defective corneal surface using an ophthalmic blade or laser. Okay, so it removes abnormal epithelium plus the hyaline layer, giving the cornea a fresh start. And then nearly 100% success rate for indolent ulcers, but it requires a specialist training and of course a surgical microscope. And next would be the conjunctival pedicle graft. This is a procedure that I'm quite familiar of. So it is actually very ideal for deep ulcers. If there is more than 50% of the corneal thickness is lost, or there is a risk of perforation, because it transfers a vascularized flap from the conjunctiva to cover the ulcer. So it promotes healing, protects the cornea, and delivers blood supply. Now, why is it called a life-saving for deep ulcers? Because, as I described earlier, there's it's like formation of a living patch. This because of the section of the conjunctiva is sutured over the corneal ulcer. Okay, so it brings blood supply, nutrients, and immune cells to promote healing. It provides structural coverage to protect the eye against rupture. That's why it is ideal for deep ulcers or descemetocele. Okay, so the benefit is that the success rate is about 90%. So the only trade-off is that the grafted area stays opaque, so vision may be impaired on that particular spot. Now, let me present to you our first case. So, this is Kobe. She is a 7-year-old neutered Boston Terrier with a 25-day history of a non-healing corneal ulcer. So, despite medical treatment, the eye worsened, showing squinting, discharge, and cloudiness. Okay, so Kobe had a history of minor trauma from play, and as a predisposed breed, this likely led to the indolent ulcer, which led to a more complicated ulcer. Now, Kobe's corneal ulceration persisted. So after 25 days of unresponsive medical management, the ulcer remained non-healing with continued pain and corneal cloudiness. So the risk factors is that breed predisposition and the risk of deeper involvement made this case critical. So the next step would be to do a surgical intervention, since nasabi natin kanina that descemetocele is considered an emergency for ophthalmic medicine. Okay, so the next step would be we opted for a conjunctival pedicle graft, which aimed to restore structural integrity and, of course, to save the eye. During that time, kasi the owner really wanted to save the eye, and they don't like the idea of having Kobe enucleated. Now, Kobe was, okay, hold on. Okay, so Kobe was placed under general anesthesia. So this is a surgical procedure. So after a sterile preparation of the eye, we debrided the ulcer bed to remove the necrotic tissue, and we have to expose the healthy edge of the cornea. Okay, and then we need to harvest the flap of conjunctiva from the lower limbus of the eye and suture it over the corneal defect. Okay, so we have to keep the base intact to maintain blood supply. Okay, and then to protect the graft and aid healing, we also perform a temporary tarsorrhaphy. This partially closed the eyelids over the graft, shielding the cornea from trauma, and of course prevent dryness for the immediate post-op period. Now, first, for the post-operative care, so it's actually very similar to the initial medical management we described earlier, okay? And it is included, of course, topical antibiotics. We have the pain medications and systemic antibiotics as well for support. And then at 2 weeks' time, the graft had integrated well and the ulcer had healed. And although the graft left a scar there, but Kobe's eye was saved. And actually, during that time, Kobe is already pain-free because bumalik na siya sa dati niyang parang behavior at home. And this is the post-op picture, 25 days after the surgery. So the graft was fully vascularized and well adapted to its new position. And the cornea was intact, okay, so with those signs of rejection of the graft. So this confirmed the successful restoration of the corneal integrity of the patient. Now, moving on to our case 2. So this is a very good contrast case to the first one. Okay, so case 2 features a 7-year-old Jack Russell Terrier with a long-standing superficial ulcer on the left eye. So it wasn't an emergency, unlike the first case, but the owner reported a chronic discomfort to this patient at home. So classic signs were seen, including the epiphora blepharospasm, which typically match to a typical SCED condition. On exam, it was observed that there was a rolled edge of the epithelium with no stromal loss, parang yung dinescribe nating condition that we can see on SCEDs, and fluorescent stain confirmed superficial involvement. Okay, so tear production was normal for this eye, and everything pointed to a primary indolent ulcer. So the next step would be the treatment plan, okay? So it was laid out to the owner, the different treatment options, which we described earlier. So the options would be to do the CTAD, grid keratotomy, and the diamond burr debridement. And for this case, since the owner wanted or wished for a more definitive solution, so it was opted to do the diamond burr debridement technique. So a full pre-workup was done to this patient and everything was clear. So we proceeded to the surgery. Okay, so under anesthesia, a sterile cotton swab was done to remove the loose epithelium, and then using the diamond burr, the cornea was polished in a circular motion to remove debris and smooth the surface. Then the temporary tarsorrhaphy was also performed to this patient. So this is the images which show the process. We have the first one will be the swabbing and the burr debridement at the center, followed by the temporary tarsorrhaphy at the end. So you can see the burr tool in action in the middle picture and the final protective closure on the right. Now for post-operative care, so the tarsorrhaphy stayed for a week, and the patient was given topical antibiotics, it was given a regenerative serum as well, systemic medications, and of course the use of Elizabethan collar. So the recheck was scheduled 7 days after the procedure. So these are the outcome and for the follow-up. So the tarsorrhaphy was removed and a strong healing was observed, and by the days 10 to 14, we are expecting full healing, and the cornea was already stable at recheck. And these are the visual comparison of the dramatic improvement. They also resolved, and the cornea looked healthy again, validating the DBD as an effective treatment of SCED. Now that we've reviewed both cases, okay, so let's zoom out and look at the broader lessons, okay? So one key takeaway is that corneal ulceration must be tailored, so not all ulcers are the same, and we must apply the principle of one size does not fit all. So for superficial indolent ulcers, like in case 2, we start with a less invasive options. And when a simple debridement fails, tools like the diamond burr provide excellent results with minimal scarring and high success rates. And for deep or non-healing ulcers like the case 1, conservative treatment often is not enough. And once there's a risk of rupture, or we can escalate it to surgical options like the conjunctival pedicle graft. They offer both coverage and vascular support. And yes, grafts often leave a permanent opaque spot, but they preserve vision and comfort, which are far more important in severe cases. So ultimately, ulcer depth determines the intervention. Okay, superficial ulcers get minimally invasive care. Deep ulcers need structural surgical repair. So this comparison shows that when we match the treatment to the ulcer type, we get successful results even if the methods are different. So this table highlights the 5 most common treatments for non-healing corneal ulcers that we described earlier. So each has its specific indications and success rates. So we have the CTAD, which is the simplest, just a cotton swab, but has a lower success rate. The grid keratotomy improves adhesion with corneal scratches. The diamond burr debridement smooths the cornea and gives 85 to 90% success. The superficial keratectomy, which is the surgical removal of the epithelium, it's highly effective, about 100%, but is more invasive. And we have the conjunctival pedicle graft, which is used for deep ulcers and saves the globe, about over 90% of success, but can leave a scar. So I'm giving you this QR code again for you to access or download that table. And to wrap up, okay, so the key to managing non-healing corneal ulcers is matching the right treatment to the right ulcer. Okay? Superficial SCEDs often respond well to diamond burr debridement. It's quick, it's minimally invasive, and effective. But when ulcers are deeper or progressing, we must act boldly with surgical options like grafts to preserve vision and prevent rupture. So the key takeaway is very simple. Don't wait. Intervene early and appropriately for the best outcomes. Now, based on this case comparison, here are my clinical recommendations. Number one is we have to assess ulcer depth and chronicity before selecting any treatment. Second is that for superficial ulcers, start with minimally invasive techniques. We can escalate to surgical options when needed, especially for deep or refractory ulcers. And finally is to support and participate with ongoing researches and studies to refine treatment protocols and improve success rates. And also by staying proactive and precise in our approach, we give our patients their best shot at healing and seeing clearly again. So that ends my presentation. I would like to take this opportunity to thank my mentor, Dr. Genio Bailon, for his guidance and for generously sharing his case report, which was integral to this comparative case report. Thank you very much.
Thank you so much, Dr. Janeline Valdez. He actually gave justice to the title, Management of Non-Healing Corneal Ulceration in Dogs, a Comparative Case Report. So without further ado, the first question, Doc, is what systemic antibiotic do you always use? And do you still consider using blood serum?
For systemic antibiotics, I usually use doxycycline because it's actually known to have, of course, as an antibiotic, and it has anticollagenase effect as well.
Doc, what's the dose?
I use 5 milligram per kilogram BID.
BID. Next question, Doc. How can you differentiate the ulcer types and depths? Is it only through fluorescein stain?
Okay. Actually, the fluorescein stain is the parang the best way to differentiate the ulcerations, because merely by looking at, even with the clinical examination or using the ophthalmoscope, but we cannot differentiate kasi yung deep stromal ulcerations and the desimetocele by not using the fluorescein stain. So you still have to use the fluorescein stain.
Follow up, Doc. What is the ulcer type or depth of Kobe's eye ulcer?
Okay, it actually started with deep stromal only, but given the behavior of Kobe, he was very playful and liked to roughhouse with other dogs at home. It became desimetocele afterwards.
Did you place it Elizabethan collar right
Yes.
away, Doc? So still nag-proceed pa rin siya?
Because, maybe because he was a Boston Terrier also, which is a predisposed breed to this kind of ulcerations.
Doc, have you read about corneal transplantation? Can this be done in dogs?
Yes, it can be done at dogs, but I haven't tried it yet, but I read an article about it that it can be done.
Okay. Doc, what suture did you use for the graft?
Okay, for the graft, we use the 8-0 polyglactin for the suturing of the conjunctival pedicle graft.
Was it simple interrupted or continuous?
Simple interrupted.
Okay. Doc, earlier you've mentioned about anti-collagenase medications for chronic ulcers. May I know the mechanism of actions of such agents or medications to help us discuss to the owner and make them understand the benefits of these agents?
Okay. So basically, kapag merong mga corneal ulcerations, especially for the chronic or sometimes the melting keratitis na tinatawag natin, so we have the presence of neutrophils and other microbial organisms. So these neutrophils and bacteria can produce collagenase. So we call it, actually there's a collective term for that. We have the MMP, which is the matrix metalloproteinases. Okay, so these are enzymes that could inhibit the collagen, and the collagen is important for the healing of the cornea. So for autologous serum, they have actually on the report, they contain the TIMPs na tinatawag natin, which are the tissue inhibitors for metalloproteinases. And they have also alpha-globulin, which can directly inhibit the production of these enzymes.
Okay. Are there any contraindications of autologous serum administration?
Okay, for the contraindication, it will depend on the condition of the patient. Of course, sabi natin kanina, we need to collect about 10 to 15 ml of blood. So obviously, we cannot do that to the patient who has anemia. Okay. Secondly would be if the dog or the patient has significant heart problem, so whether or not they can tolerate the blood collection itself. And of course, for the patient that is currently or ongoing receiving a mga therapy na immunosuppressive, such as, for example, nag-undergo siya ng prednisolone or cyclosporin treatment, we cannot do that for these specific patients. And of course, if they have immunosuppressive conditions as well, such as kung may mga viral infections, because it may aggravate the situations.
Okay. How about, Doc, are there any contraindications of a conjunctival pedicel grafting procedure?
Okay, again, we will talk about with the condition of the patient. So the one thing that's contraindicated is that if the patient is having a condition that can immunosuppress them, so it delays healing. Because remember, we put a graft sa cornea and we need the patient to be responsive for healing.
Doc, for case 1, what is the main reason why you opted for conjunctival pedicel grafting instead of other procedure that you've mentioned? What's your first go-to knowledge for that?
Okay. So number 1, I'm quite familiar with the procedure. I've seen few cases to do that. Secondly is that with Kobe's condition, the eye is at risk of rupture already. So we really need a surgical intervention which can provide both structural and vascular support to the eye. The vision of the patient was already compromised before the procedure, so the only goal was that to save the eye and of course to remove the patient from pain.
Okay. Doc, you've mentioned earlier that the vision was already compromised before you did the graft. So how do you decide when to escalate from conservative to surgical management? Kasi sira na compromised na.
So we decide if there is a risk of rupture of the eye, and of course, if we need a structural support for that eye, so kailangan na nating mag-intervene surgically with these conditions.
This one is from Doc Randy. Why was keratotomy not opted?
Okay. Keratotomy, I usually don't do that because I really don't like the side effects of it. Kasi you are intentionally putting or giving a intentional wound to the eye, so there is a risk for infection. Okay, so I'd rather do the DBD rather than the keratotomy.
Why was tonometry not performed?
Okay, number one, we don't have the tonometer in the clinic, but it's a very good tool to use to assess before we could proceed to any procedures, because knowing the pressure of the eye can also guide us to help explain to the owner kung ano po yung magiging management and expectations.
Yeah, very important to explain first and foremost to the owners ano po yung magiging roundabout ng treatment. Doc, since you've mentioned the case was dexamethasone, what is the best treatment for that? Is it PRP? Why or why not?
PRP.
PRP.
Okay.
Platelet-rich plasma.
Platelet-rich plasma, I haven't tried that, but it's a very good suggestion for dexamethasone. Okay.
Doc, was inoculation an option?
It was never an option for this case because the owner doesn't really like that idea. They wanted to save the eye even if the patient cannot see.
Okay. Was contact lens considered or eye bandaging?
Eye bandages can be good, but here in the Philippines, I don't know if it's available, but in Singapore, after doing the keratotomy, also the bandages can be used to protect the cornea.
How many days, Doc, will you recommend eye bandaging?
The eye bandaging, I haven't tried it yet, but I think it could, parang after na wound healing, it could be possibly about 7 to 10 days.
Okay. Doc, this one, I think you've mentioned na kanina, but I'll still ask this. Autologous serum. Can we use the serum of other species or any animal for dogs or vice versa?
For other species, I'm not sure about it, but autologous and then heterologous, you can use the serum of the other dog.
Was stem cell technology used? How long?
For the case one, if you're talking about the regenerative serum, we use that to Kobe, or the case one. We used it for 10 days, but then again, it still progressed to dexamethasone, probably because the behavior of the patient as well.
Okay, Doc. Say, for example, you have, due to playing or fighting, nagkaroon ng corneal ulcer. Have you ever removed a foreign body, like a claw?
I haven't seen one, but it's possible.
And how do you deal with clients, Doc, who refuse to do surgery if needed and ask for medicines only? And if that's the case, what medicine do you usually recommend them instead?
Okay. If the client doesn't really like the surgery, or probably because they're scared of the anesthesia, we can opt for the use of the regenerative serum and autologous serum in combination with temporary therapy, because this quicker or very brief anesthesia only. But talagang kung ayaw nila, we can go for the regenerative serum, which is available commercially, and the autologous serum.
Say, for example, Doc, a patient was presented to you showing low platelet count and high BUN or CREA, aged around 9 years. Given that there is already dexamethasone, which is an emergency case, would you recommend immediate surgical intervention?
Okay. For this kind, we have to weigh the risks versus benefits. If the dog is in pain and it's the eye is at risk of rupture, I would still recommend it, provided that I can really explain to the owner so that they can manage their expectations. Meron naman po tayong mga anesthetic protocols for these situations, but of course, it will really depend on the client still if they are okay with it.
So say, for example, Doc, you were able to perform. What suture size was used, Doc?
80.
Why did you not use 6/0 or 9/0?
9/0 is too small. We don't have the surgical microscope at the clinic, so we won't be able to see that anymore using naked eye. 6/0 is too big, and it might cause a scarring to the cornea.
So for the grafting alone, Doc, how many simple interrupted did you place?
Okay, so first is the cardinal suture, so like the corners, and then for that, I think I place about 8 stitches on the flap alone.
Oh, 8 stitches. Other questions, dear doctors, here in Penglai? You still have right around 15 minutes. Doc Mary? Okay, Doc Paul. Exercise.
I think this is just a bit, innocent question. So, how long can you wait, or how long can a patient wait before the damage could be, cannot be resolved anymore? At what point? Parang, kasi for example, there are cases na darating sa atin and some of these clients cannot afford immediate treatment. How long can we delay treatment up to the point of no return na siya? Pag too late. Ano yung too late?
Okay. So that will depends on the type of ulcerations that we saw after using the diagnostic tools that we used. If it's deep stromal and then the breed is belong to the predisposed breeds, then right immediately magiging decimetocele yan kahit tomorrow. So we really need to intervene. Depende po dun sa corneal ulcerations na nakita natin based on a diagnostic tool.
Doc, ang ganda nung case. How much do you charge on that kind of procedure?
Okay, for conjunctival pedicle graft, we charge 8,000 for the procedure alone.
Before doing the procedure, do you debride first?
Yes, Doc.
And any corner of the sclera you can pull out to close the...
Ideally, it's the lower limbus. So, because we don't want to get the conjunctiva on the side, kasi pag nag-blink sila, it will be, it's a bit painful. So, usually on the lower side.
But it can be done by other side of the eye also?
Yes.
And my last question, Doc. After healing, will you remove it or it will stay for life?
It will stay for life.
Then it will close the eye. I mean, it will close the vision.
Yes, on that specific spot where graft is located, there will be an opaque scar over there. So, on that spot, yung vision niya is already covered. But there are reports that say during pag nagtagal, nagiging thin yung flap. So, sometimes nagiging thin siya, so nagiging clear yung vision niya doon.
So, Doc, how many patients na yung nagawan mo nung different procedures po?
Okay, for conjunctival pedicle graft, we only did 3 in our practice. Kasi usually, yung mga clients kasi they don't like to do the surgery. So, yeah, they will opt for conservative treatment.
Okay. If, say, for example, Doc, the IOP is high or low, what is the recommended treatment for cases with eye ulcers?
Okay. So that would be the conjunctival pedicle graft because it provides structural support. So yung patch kasi parang piniprevent niya yung eye from rupturing. So it will be a good option for that.
How about, Doc, what is your take on giving retinol palmitate or vitamin A oral supplement in ophthalmic cases?
Okay, it can help, but during those cases where which is very deep or complicated, so you still need to do the treatment modalities na nabanggit natin kanina.
Can you mention also, Doc, or share with us the risk of the procedure, yung depth on how or what to disclose to the fur owners before doing the procedure? For example, CTAD and GK.
For CTAD, there's actually yung pinaka-disadvantage lang would be it can recur again. So, hindi siya pwedeng, majority, since 50% lang yung success rate niya, so half of the cases would recur, so definitely it will come back again. For
GK.
For grid keratotomy naman, so since nga, sabi ko kanina, it's prone for infection, so you have to manage the expectations of the owner. So, after that, you have to monitor if there is possible infection na mangyayari after the procedure.
Also, another thing, Doc, yung pain medications used.
Okay. So in our case, we used NSAIDs, okay? And if, for example, merong problem sa platelet, then you can use also gabapentin.
Say, for example, Doc, for the benefit of those living in the province, what if the clients refuse those surgery, serum remedy, therapy, financially, di ba? What other remedies will you recommend them?
Okay, for superficial ulcers, of course, we can use the topical eye drops. Okay, for deeper ones, wala talagang options for that. It's still surgical removal because, or you can explain to the owner that the eyeball will rupture at any time, so probably that can help.
So, Doc, melting ulcer, di ba, is synonymous with the somatocyl problem. What is the best approach, in your opinion, and not based on your experience alone? And also, what are the complications after surgery?
Okay. For melting ulcers, of course, we need to use the anticollagenase therapies na nabanggit ko kanina, plus conjunctival particle grafting is also again my first choice. The possible the second question would be complications is the rejection of the graft. Okay, so rejection of the graft happens when there is a severe infection na hindi na control, or if ever the dog has unknown conditions which is very immunosuppressive to them, so hindi nag-heal, so possible na ma-reject nung body niya yung graft.
So after rejection, ano yung next step?
Next would be, you can do the flap again, but of course, you need to address the condition na nagkakos ng immunosuppression to that patient.
Was there ever a case na, Doc, that you've handled?
Wala pa naman.
Wala pa naman. So very lucky si Doc. Then also, Doc, nutrition-wise, management-wise, meron bang mga bawal? Kasi baka magkaroon ng allergic response into this and then mag-pop yung eye. How about vaccinations? Baka magkaroon ng post-reactions, anaphylactic reactions din. Tapos biglang mag-pop yung eye.
Okay, so that's why we need to keep in mind also yung breeds na predisposed to that. So, minsan kasi yung scales tinatawag nating spontaneous, they can just occur even without trauma or even just a minor trauma. So, we have to also explain to the owner na, look, yung aso nyo pwedeng ma-predispose sa ganito. So, you have to be very careful also kapag yung dog mo is very active and likes to rough house with the other dogs. So, yun naman.
Doc, which is better or easier to be treated based on your experience? The melting ulcer or the non-melting ulcer? And also, using autologous serum, how much is the cost for pet owners? And how long does a 15 ml extracted blood can be used?
Okay. Of course, it's easier to treat the non-melting ulcer one. And for the autologous serum in our clinic, we charge 2,000 din po for the autologous serum. And usually, a single 2 drops to the eye. So yung 15 ml, it can give you roughly about 2 ml to 3 ml of serum. But you have to consider the storage also. So under refrigeration, you can only keep the serum for 7 days.
So, consume.
Yeah,
kahit may matitira. Okay, Doc. Tapos, ang other question ko, Doc, is, so since nag-extract ka na 1 week, tapos syempre hindi pa siya magaling, so that's another charge.
Yes.
So kailangan mas dumami ang dugo ni dog.
That's why you cannot do it to the patients who has anemia. Yeah.
Will the dog stay sa clinic?
No.
Outpatient na siya,
outpatient
Doc.
naman po.
Okay. Any other questions, dear doctors? We can accommodate. Last one. Going once, going twice. How about frozen plasma?
Plasma, I haven't tried it yet, but I think it will be also possible.
Doc, can we use the serum from EDTA tubes?
It might interfere also, it might cause irritation, so
Red
I
top.
would, yeah. It has to be plain tumor, the clot activating ones.
All right. Let us all give a round of applause to Dr. Valdez. Thank you so much.